तस्मै श्री गुरुवे नमः।
Very warm good evening to one and all. On behalf of Sameeksha, I invite you all for the today's session. We know that Sameeksha is an organization started by many of doctors and house surgeons with the aim of developing the knowledge of Ayurveda in a way that is accessible to all physicians for the advancement of Ayurveda around the world. From the very first step of Sameeksha on the subject of nervous system, we were made aware of the importance of nervous system in Ayurvedic treatment. The associated gynecology, obstetrics and Ashwagandhidiyam classes received a lot of attention. Similarly, our international seminar also received a lot of attention. The single session we conducted was very focused on the upliftment of BAMS students, clarifying job opportunities outside India, information on what to do for the MOH exams, and completely dispelling the doubts of many related to it. In addition to these seminars, several cases including photos were put doctors to understand the treatment of diseases in each condition. Details of our seminars are displayed on the screen. Those who wish to watch these seminars can send a message at any time to the WhatsApp number displayed on the screen for the recordings of seminars. Let us go to today's class to learn more about becoming a good doctor by praying to Jagadishwar that he will bless all our Ayurvedic doctors to excel in the field of treatment.
Good evening to the final day of national level seminar.
Without delay, first I would like to invite Dr. Rahul ISHWARLAL DESAI for the paper presentation.
Yeah.
Dr. Rahul.
Hello, sir. I am audible.
Audible, doctor.
Okay, I'm just share the screen, sir.
Okay, doctor.
Sir, host disable participant screen sharing.
On minute, doctor. On minute. Okay, doctor. Please share the screen, doctor.
So you are getting? I'm visible?
Not visible, doctor.
Just one.
Once again, please try.
Yeah, visible, sir, right
Yes, doctor. Visible, doctor. Now visible.
now? Okay.
Okay, doctor. Please chat, doctor.
Just 1 minute, sir. Good plus. Oh. Yes, sir, I can start.
Please,
Hello.
doctor. Please chat.
Yeah. Good evening, everybody. Myself, Dr. ISHWARLAL DESAI. I'm here to present on the topic It is clinical trial to evaluate the role of Chatusama Gutika in ATISAR SAMAVASTA with special reference to acute diarrhea. Now, in case of that, we started with the introduction of ATISAR is a common disease in our day-to-day practice. The disease occurs due to unhygienic preparations and handling of food and sanitary material. Most of these patients are treated by modern physicians, but they don't know think about the Samovastha and Niramavastha of ATISAR. If the ATISAR is treated without considering the avastha, it leads to aggravation in disease leading to the upadravas instead of reducing the symptoms. According to Ayurvedic text, it is necessary to diagnose the Samovastha and Niramavastha before starting the treatment. In case of Samovastha, we use Deepan Pacham drugs, and in case of Niramavastha, the Stamban drugs are indicated. The drugs Chatusama Gutika that is explained in Vangasen Sanhita, we are mainly the Deepan Pachan in Samovastha Patisara. Aim of the study to evaluate the role of Chatusama Gutika in Atisar Samovastha with special reference to acute diarrhea. Objectives: primary objective, assess the effect of Chatusama Gutika on Mala Parikshan parameter, and secondary objective is to study the Agnideepan effect of Chatusama Gutika in Atisar Samovastha, and second is to find out the drug on different Prakruti effect. The review of literature, the Ayurvedic review, modern review, and drug review. In case of Ayurvedic review, started with that is Agni. Main Agni concept is mainly that is useful in that to diagnose the avastha. In case of Agni, as we know that is explained charak chikitsa, ayu varna bala swastha utsaha ucho prabaha, ojas tejo agneha pranas chatukta deha agni hetukaha, shanta agni mirete yukta chiranjeev tanmayaha, rogi syad krutaya moolam agni sannat niruchyate. Types of Agni, we know that there are 13 types of Agni. Jatra Agni, that is 1, Dhatu Agni 7, and Bhuta Agni 5. Ama, the concept is explained Ashtanga Sutra Sthana. That is Ushman Alpavatvina Dhatu Madhyapachitam Dushta Amajitam Rasam Ama Prachakshate. The asterisk of Am, as we know, Avipakvam Asayuktam Durgundam Bahupichilam Sadam Sarvagataram Amitya Vidhirate. Avastha, as we know that Avastha Rupeshanta Rupam, that is explained in Ashtanga 12/68. Definition of Atisara. As the Atisara is combination of two words Ati and Sarati. Ati is not excess and Sarati to move out of the body or Gati. Atisara Atisara Ashtang Sandra Nidan Sthana Atyanta Sarana Atisara Shushu Uttar Tantra. Hetu 7 in Atisar. That is the Purva Rupa of Atisara. The types of Atisara Doshaj, Sannipataj, and that is Manas, Bhayaj, and Shokaj. As a Rupa, that is Gudena Bahudrava Saranam Atisara. Vishay Lakshana as per Doshaj, Ekadhikya, the Lakshanas are there. And Pitta Jatisara, Kafadati Jara, Sannipata Katisara, Shokajana Bhajatisara, Amajatisara, Upadrava Patisara, these are the important to know the Sadhya Asadhya to Atisara. The main are Shota, Shula, Jwara, Tushna, Kasa, Arochak, Chardi, Murcha, Hikka, Nidranash, Arati, Kampa, Utraghat, Visajnata, Arsha, and Grahani. These are the important Padravas of Atisara. Sadhya, as we earlier told, if there is a Rakta Lakshana in Atisara, there is a Rakta Jatisara there, then it will be the Krucha Sadhya. Lakshanas, the Vyadhi in Atisar Vyadhi, other Lakshanas and Upadravas like Shwash, Shosh, Shut, Shoth, Aruchi, and Shul are developed are certain to die. This leads to arrest mainly. These are Lakshanas are there. सामान्य संप्राप्त्यपतिसार आज वेदा संशम्यम अपाम धातु अग्नि प्रवृद्धः शक्रुन ईश्वर वायुना अदप्रणुन्नः सर्वत्यतिसारम तमहो वेदुगोर षड्विधं भवन्ति. And we explain the samprapti by flow chart as hetu 7 leads to the vat prakopa apadhatu vikruti that stretched by the vata in koshta in downward direction leads to the agni leads to the apadhatu vikruti, and that apadhatu vikruti liquefies the mala, more frequent evacuation of the liquid stool leads to the atisara. Chikitsa, as we know, the amapakva ahitatam natisarem kriya yataha atasarva atisarantu neya pakvam lakshane shushut tantra tatrado langanam karyam atisareshu dehinam tata pachan sayuktam yavagadi kramahitaha. So through tantra 40/25. In case of chikitsa, charak has explained natu sangram deyam purum atisarenahi vivadhyamanam pradoksha jayantyamana bahun. अतिसार मुक्ति लक्षणास यस्योच्चार विनामूत्रम सम्यक वायुच गच्छन्ति रित्तरुल्य कोष्ठ स्थित साधद्रमायः. Our definition, as we know that that is a modern review of that atisar. We are comparative with acute diarrhea. Now the diarrhea is defined in according to modern. We have increased frequency of stool and greater than 200 grams stool per day. That is lead to considered as an atisara. As types, as you know, the acute is less than 2 weeks having the symptoms, persistent 2 to 4 weeks having the symptoms, and chronic greater than 4 weeks. Acute diarrhea, more than 90% cases of acute diarrhea are caused by infectious agents. These cases are often accompanied by vomiting, fever, and abdominal pain. Remaining 10% are caused by the medication, toxic indigestion, ischemia, and other conditions. Causes of diarrhea: infectious diarrhea, bacterial bowel infection, food poisoning, travelers, amoebic dysentery, bacillus dysentery, gastroenteritis, parasitic bolus, and many more. Differential diagnosis is a viral gastroenteritis, bacterial gastroenteritis, parasitic infestations, food allergies, and others. Investigation which normally do the stool routine microscopy, stool cultures, stool for ova and parasite, blood culture, stool local blood WBC is often little value differentiating viral and bacterial causes, urine analysis for specific gravity and ketones, serum electrolyte, acidosis, hyper or hyponatremia, hypoglycemia, etc. Treatment, quinolones and fluid are the mainstay. Chronic diarrhea, diarrhea lasting more than 4 weeks. As we know, treatment of chronic diarrhea depend upon the specific etiology and may be curative, suppressive, or empirical. Now, the mainstay of study, we have studied with the material method. What is the method used for the study? We selected 30 patients from our IPD and OPD from our hospital with having the Samavassta Lakshana of Atisara, that is, and symptoms like compared with other acute diarrhea symptoms were taken with prior informed consent. We investigation for that, we done the police examination by Ayurvedic Mala Parikshan and routine stool examination were done at the baseline and at the end of the treatment. Place of work, that is in our hospital. Study design, the screening of patient, inclusion criteria included, exclusion criteria excluded, included patient, counseling done, informed consent obtained, included in trial, initial assessment done, drug intervention, follow-up after every 2 days, data collected, subject to statistical analysis, conclusion. Total 30 patients were selected and we are giving the follow-up every 2 days and total treatment given for the 7 days, and at the end and at the starting of the treatment, we are assessed the criteria of Samavassta, and we done stool routine examination at the end and at the starting of the treatment. Selection criteria, that is first was the inclusion criteria, age 18 to 60 and having the grade 1 and grade 2 lakshanas of Rasasai lakshanas. This patient we are considered and having the sign and symptoms of Samavastta. Exclusion, age greater than 60 years and less than 18, pregnant woman, ATISAR associated with hypertension, COX, HIV, cardiac disease and any other major illness, patient with grade 3 Rasasai lakshanas and severe dehydration, Niram Lakshana ATISAR. Withdrawal criteria, patient develop any adverse effect, patient not responding to treatment and not willing to continue to treatment. Criteria for assessment, this is the main. We are considering these symptoms and signs of the patient. These are recorded at every second day and before and after the end of the treatment. That is, first is Udar Shul, Udar Gaurav, Gatravasad, Aruchi, Ananabhilasha, Adman, Atop, Trishna, Klama. These lakshanas are, we are considering on the basis of visual analog scale. Their mildness, moderate, severe category we have considered. We consider Neil 0, mild to moderate 1 to 3, moderate 4 to 7, severe 8 to 10, pulse and blood pressure. We are monitoring on every second and at the end of the and starting of the treatment. Objective parameter in case of Veg, Malavegas, Neil 0 to 1 wake per day, that is Neil, mild 1 to 5 wakes per day, moderate 5 to 10 wake per day, and severe more than 10 days. Jiva, Ayurvedic prediction and drug tiredness, we're considering both point in Jiva, Neil non-coated, mild, slightly coated, moderate, partially coated, severe, fully dense coated. Tongue dryness, Neil weight, mild, slightly dry, moderate dry, severe, honey purchase. Purish, in case of Purish, we have also done that Gandha prediction, that is Neil 0, mild 1 to 5 meters square, we will get Gandh, that is were considered moderate 6 to 10 feet and severe more than 10 feet. Vichilta present and absent, and Mukti Lakshana present and absent. That is the drug review. We have used Chatusama Gutika. We have given the 500 milligram, 3 tablets, 3 times a day, means 1.5 gram, 3 times a day. Total 4.5 gram of that tablets we have to given in per day with Koshna Jala in a Saman Kala for 7 days and follow up after every 2 days. That is content of Chatusama, Abhaya Nagar Mustan Guda. Abhaya Nagar Mustan Guda, that is the Karma Rasavirevika of the Davyas. Chatusama Gutika was there. Now the observation we are getting on the study, we are getting 10 males, 20 females. That age by distribution, we are getting the maximum 21 to 30 years patient 11, 31 to 40, 10 patient we are getting. Agni, we are getting maximum 28 patient of Mandagni. Vishamagni has 2 patients we are getting in our study. Economic status, poor 9 patients, middle class 21 patient. Prakriti Prediction, we are to Vata Pitta, maximum patients we are getting on Pitta Kapha, Prakriti that is 19, and Vata Pitta we are getting 10, and Vata Kapha only getting 1. Religion wise, we are getting Hindu 29, Muslim 1 patient. Effect of drug on vague, as we know that when before the treatment, after treatment we are compared. Before the treatment, patient was 1 grade 11 patients shifted to 3 number of patients. In grade 2, there are 18 patients shifted to 0 patient. Grade 3, 1 patient shifted to 0 patients. The test used is Wilcoxon, that is was the test was used to compare the study. In case of drugs on Gandha, we have the same grade 1, 14 patient. After the study there were 30. Grade 2 has 16 patient before the treatment, after grade was 0. In case of drug on Udarshul, we are getting the hello.
Please continue, doctor.
Okay, yeah. In case of Udarshul, we are also getting the we are getting the grade 4 patient, 11 patient before the treatment. After the treatment, at the day 3 we are getting 9, or day 5 we are getting 0, and after treatment we are 0 patient on the grade 4. The grade 5 patients, 11 patient before the treatment, and at the end of we are getting 0 patient. Before the treatment grade 6 there are 5 patients and 0 patient after treatment. That will indicate that Udarshula has significant effect before the treatment, after the treatment, when treated with the CHATUSAMA GUTIKA. The same when we are getting the drugs on Udargaurava, we are also getting the grade 4 20 patients. After the treatment we are getting 0 patient in grade 4. Before the treatment, that is the grade 5 7 patients are there. After treatment the 0 patient was there. We are also getting the significant of Udargaurava. In case of drugs on Gatra Usada, we have maximum grade 3 18 patient that after the treatment getting 0, and we have 7 patients on grade 4, that is after treatment has 0 patients. That was their effect of drugs on Aruchi. Aruchi also has a good result, that is grade 3 19 patient has grade 3 level of Aruchi, later on shifted to 0 grade after the treatment. Drugs on Ananabilasha, that is 16 patient grade 4, maybe have to give after the treatment has 0 gradation. 10 patient on grade 5 has a 0 gradation. Drugs on Prasek, that is 18 patient at grade 3 Prasek, shifted to 0 gradation. 7 patient grade 2 shifted to 4, number 4 patients. Drugs on Adman, in case of Adman, 12 patient in grade 2 shifted to 0 gradation. 10 patient in grade 3 shifted to 0. That was it. Okay. On ATOP, the 15 patient from grade 0 to after the treatment is also in grade 22 patient in grade 2 totally, and from that is grade 2 7 patients shifted to 0. Grade
Hello,
2,
Dr. Rahul.
yeah.
Doctor, time allotted for your presentation is running out. Can you speed up your presentation?
Yeah, just I'm speed up, sir.
Okay, doctor.
Just 2 minutes. Yeah, like this we are getting our on different parameters we are getting much more result. Will directly goes on that is conclusion of the our study. In case of Chatusama Gitika, the significant result in ATISAR Samasya were gated because of Deepan Pachan and Mrudu Anuloman Karma of the content of the drugs. In present study, most of the patient has Mandagni, no patient in Tishtagni was found. 27 patients showed ATISAR Mukti Lakshanas in short duration of time. Deepan Agni is one of the Lakshana of ATISARA. The most of the patients, 27 number of patients show the ATISAR Mukti Lakshanas. Out of 20 patients, 7 patients, 18 patients were of Pitta Kapha Prakriti, 8 of Vata Pitta, and 1 patient of Vata Kapha. From the it is concluded that Chatusama Gutika shows a significant effect on different Prakriti. Conclusion, where the significant change in the clinical parameters such as Vega, Pichilta, Gandha, all the Lakshanas get significantly decreased. There is a okay. The one more slide was more important. This I'm discussing. When we given the tablet and we checking the patient's stool routine before and after, when we compared with the pus cell in the stool sample of the patient, we get a significant result in the case of an pus cells, and that is the number of patients where 30 patients were included, and we have the maximum 27 to 28 patients have decreased the pus cells in that sample of that stool. Scope of further study was there, and that's bibliography. Thank you. If anyone has a question, can ask me. Hello.
Okay, thank you, Dr. Rahul.
Thank you, doctor.
Yeah.
So next I invite Dr. Vidhya Shivhari Khansole. I invite Dr. Vidhya.
Yes, ma'am, I'm present here. Hello.
Yes,
Hello.
doctor, please start.
Okay. Ma'am, can you share the PPT on screen?
Sure, doctor.
Just a moment, doctor.
Please start the session, doctor.
The clinical study and Ayurvedic management of Shayyamutra presented by Dr. Vidhya Khansole, PG Scholar, Department of Komarbruthya. Shayyamutra, that's the bed wetting through persistent in very small number of children, but it creates a multidimensional impact on child's mental health, social behavior, and overall self-esteem. Most bedwetting is a developmental delay, not an emotional problem or physical illness. Only a small percentage, 5 to 10% of the bedwetting cases are caused by specific medical situations. Bedwetting is frequently associated with family history of the condition. Ancient scholars have also described Shayyamutra as psychosomatic origin. Because of this, we selected the Shankapushpi in syrup form along with the Yashtimadu Churna for this study. Introduction. Shayyamutra is considered to be shameful problem to our society. It causes shame both to child and parents. Vangasen has noticed first the common complaints of Shayyamutra anuresis and mentioned its management in his text. In this disease, mainly Vat, Apan, Pitta, Pachak, Kapha, Tarpak, along with Mansik Dosh, Tama are involved. vitiated. Dushya involved in is rasa, ambudhatu. Aims and objectives. Next slide, please. To study the Shayyamutra as per Ayurvedic and modern classics, to assess the effect of Shankapushpi and Yashtimadu Churna in the management of Shayyamutra. Material and methods. This is the clinical randomized control trial conducted on 10 patients of Shayyamutra, which are randomly selected from the OPD and IPD department of Komarbhutya of our institute, and written consent taken from parents. Drug review. Syrup Shankapushpi and Yashtimadu Churna were selected for management. Both drugs were purchased from the GMP approved pharmacy. Dosage. Syrup Shankapushpi 5 ml twice a day for 45 days with Poshnajal. Yashtimadu Churna 3 gram twice a day 45 days with Poshnajal, and follow up on first day 15, 13 and 45th day. Now the inclusive criteria is the first one, subject irrespective of sex, subject age group 6 to 10 years, cardinal feature of Shayyamutra without daytime incontinence, and repeated voiding of urine in bed or cloths at least 4 to 5 times in a week. Exclusive criteria, patients below the 6 years and above 10 years, patients having systemic disorders like TB, diabetes mellitus, patients with congenital anomalies or with anatomical defect in genital urinary system and UTI, neurodevelopmental disorders like MRCP, spina bifida, seizure disorders, subject with worm infestation, or the patients are on another treatment for the same disease. We results and observations for the complaint Shayyamutra, number of patients, stain, irritability, fear. The complaints from the patients are the Shayyamutra, irritability, fear, concentration, violence, excessive activity, shamefulness, and the memory. From that, the graphical representation. After that, the discussion. Mutravasrotas Vikruti, the focus of treatment should remain on the drugs acting mainly on Mutravasrotas. Clade neuron is the function of mutra. Hence, the clade vriddhi is clearly evident in the pathology along with dhatu shethilya. Thus, the dhatu dhatu ardhakara drugs are also thought of from causative or aggravating factors. It is clearly evident that manas and neurological developmental delay plays a role in pathology. Thus, medhya drugs are also required. Shankapushpi possesses antidepressant effect, and Yashtimadu possesses anxiolytic and memory enhancing effect. From that, the conclusion is that beside a medical management, counseling and toilet training play to and toilet training may play a vital role. Child must be made habitual to go to urination before going to bed and avoid drinking liquids and thereafter. Boosting confidence of child and behaving calmly when child urinates in night makes his psychology positive. That helps for the proper neurological growth. Thank you, everyone.
Thank you, doctor. So next I invite Dr. Vinutha.
Certificate viewers.
Hello, Dr.
Hello, doctor. Hello, sir.
Vinutha.
Hello, sir.
Doctor, please start.
Sir, can you please share my screen, sir?
Okay, doctor. Okay, doctor. 1 minute.
I'll try, sir.
1 minute, doctor. I'll share for you, doctor.
Okay.
Hello, doctor.
Hello, sir.
Please chat, doctor.
Okay. Good evening, everybody. Today my topic is PRASHASTA BHESHAJA. As we all know, in Ayurveda there are we study about Ashtanga Ayurveda, that is Kaya, Bala, Graha, Urdhvanga. But apart from that, there are many branches like Dravyaguna, Rasashastra, Agada Tantra. When we go through, these all have their own importance. That's why they have came into the post graduation study. In view of that, I have taken this Bheshaja. I need to mention about the importance of PRASHASTA BHESHAJA here. Need for the studies, when we see into the aim of the Ayurveda, that is Swasthasya Swasthya Rakshana, Aturasya Vikara Prashamana. These are the two mains of Ayurveda. In these Swasthasya Swasthya Rakshana and Aturasya Vikara Prashamana, Acharyas have mentioned the four entities, that is the four Pada Chatushtayas which we have to follow. That is in Charaka Sutrasthana, that is Bishak Dravyani Upasta Rogi Pada Chatushtayam Gunavat Karanam Gneyo Vikaro Upashantayah. Here Bishak is doctor, Dravya is, that is our Bheshaja, Upasta is assisters. Next, Rogi is one who is the patient. Here, our Dravya or the Bheshaja has given second importance to attain to achieve our aim of Ayurveda. Hence, we need to focus first he is given importance to Bishak, then next he is given importance to Bheshaja. Without Bheshaja, Bishak cannot achieve the aim of the Ayurveda, or he cannot treat the patients. Hence we need to focus on the Bheshaja and how it should be. It is clearly explained in Charaka Sutrasthana and all other Bruhatrayis also. When we go into the Chikitsa, sir, before, okay. When we go into the Chikitsa Pradhana Karana is, that is Dravya. It should be Prashasta, means it should be ideal. Next slide. Thank you. Meaning of Prashasta Bheshaja, that is Prashasta means well appraised, good or auspicious. Bheshaja, when we see into the Paryaya of the Bheshaja is one of the Paryaya of Chikitsa, means if we want to treat, or we need to Bheshaja, means that's why Bheshaja is considered as the Paryaya of Chikitsa. Next, what do you mean by Chikitsa? Chikitsa Ruk Pratikarya, Bheshaja Oshada, Vaishajya, Agada, Jayur Ityapi. Bheshaja means Bhesham Roga Jayati, means that one wins the disease, that is called as Bheshaja. Bheshaja means that one will Bayam Jayati. When we see into the definition synonyms of the Roga, the one of the synonym of the Roga is Baya. That is one which wins the Baya over Roga, that is called as Bheshaja. And other synonyms, Oshada, Oso Namarasaha, Oshadaha, Vaishajya, that is Roga Bayam Vinashaka. Agada means Na Gado Asti. Gada here is disease or Roga. Next, sir. Next slide, sir. When we go into the types of Bheshaja, there are two types of Bheshaja, that is Swasthasya Urjaskaram, Aturasya Vikara Prashamanan, and next is Ubhayaja. Swasthasya Urjaskara is that one which promotes health. Here we can take the examples of Raktashali, that is daily Nitya Sevaniya Dravyas, and Aturasya Vikara Prashamana is that one which treats the disease. Any drugs, for example, Trifala, any drugs, any herbal or mineral drugs. Then Ubhayaja, we can promote health and also treat the disease. Here we can go for the Vyayama, like other examples. Next, sir. Here our all acharyas, he was given importance to the Bheshaja Guna. According to Charakacharya in Kuddaka Chatuspada, he has clearly explained about the Bheshaja Guna. Among that, Bahuta Tatra Yogyatvat Anekavida Kalpana Sampayacheti Chatushko Ayam Dravyanam Gunam Muchede. Means Bheshaja should possess these four gunas. We'll see in detail what do you mean by each context. That is Bahuta. Bahuta means Bahuto Bheshaja Gunaha. When we see into the Chakrapani Tika, here he tells that Alpam hi Bheshajam Gunavadyapi Vidyamanam Yuva Asadakatvat, means if we selected Bheshaja which is having Alpaguna, it will not yield any result for us. Hence we should see Bahuta. It should be Bahuta, means it may be in terms of Rasa Panchaka, it may be in terms of of its quality and all perspective, it should be Bahuta Guna. Next, Yogyatvat means Tatra Pratikarya Vyado Yogyatvam. Means it should be Yogyatva, it should tackle the disease which we are treating. That is, here if we take the example of Ichabedi Rasa in Udara Roga, Ichabedi Rasa is indicated in, we can give Ichabedi Rasa in Udara Roga, but if patient is Erbalavan, he is having Rudukoshta, we cannot go for the Ichabedi Rasa. Then we should select other drugs which is having mild potency. This is one of the example. Next, Aneka Vida Kalpana means Nana Prakara Swarasyad Upayukta Kalpana Yogyatvam Ityartaha. Here Aneka Vida Kalpana means drug, we should select a drug that it can be prepared in many ways. If why this has importance means, if we say, if in terms of Rogi, if we take having patient, if we consider the age of the patient, in Balarogi we cannot give the Swarasa in terms because it is not palatable to the child. If Rogi Avastha, if we taken in Mandagni, we have to go for the Shruta, then it will be an added advantage for us. Suitable for Roga, that is in Jwara, we need to, Kashayas are more indicated. Like that, according to the Avastha, Rogi, their Aneka Vida Kalpana differs. Hence, we should select such a drug. It can be prepared in different formulations. Next slide, sir. Next, Sampad. Sampad iti Krimi Saliladhyan Anupahatattvena Rasadi Sampad. Means here Sampad we have to understand in two ways. That is Krimi, it should be free from Krimi, Salila, mud and all. And Rasadi Sampad means it should be having good potency, means Rasa Sampad. Rasa here comes all Rasa Panchakas. See, if we say, take the examples in Pitta Dosha, we have to select for there are many drugs which are acting on Pitta Doshas, but we have to select the more on Tikta Rasa with such that it will subside the Pitta Dosha. When we go for Vata Kapha, we should select a drug which is having Ushna Virya. Drug should be free from, that is, physical, chemical impurities. Example, that is, and in Sampath it is also like Agni Samskara, Toya Samskara, Mardhana, Marana. These will help to remove all these physical and chemical impurities and to enhance the property of the Bheshaja. To attain purification, neutralize of the toxins, these bhavanas are bhavana, marana, other procedures are explained. Next, sir. Next slide, sir. According to Vagbhatacharya, he follows the Charakacharya and they explain same guna, that is Bahukalpa, Bahuguna, Sampanna, Yogyatvat. Next, sir. In these, Sushruta has given a different enlightenment, different knowledge on this. That is, he goes with the Prashasta Desha Sambhuta. That is, he is more particular. He particularly he explains more about the Prashasta Bheshaja. That is, in first he explains about the Desha Sambhuta. Means we should select a drug which is we should select a drug from place which is free from Valmika, Kutsita, Anupa, Shmashana, Ushara Pradesha, etc. Or not fit for the therapeutic usage. If we consider a small example here, before cultivating any medicinal plants, we need to go for the soil examination. That is, we cannot take the drugs from alkaline rich or acidic rich soils. That will in turn affect on the drug quality. That is one example. That is, if we say this was explained by our acharyas in ancient times only. That is, if he has clearly mentioned that we have to take the Virechana drugs, that is Bhumi of Prithvi and Jala Mahabhuta predominance. For Vamana, we have to select drugs which are grown or Bhumi of Agni, Akasha and Vayu Mahabhuta predominance. Shamana Ushadhi, we have to take a Bhumi of Akasha Mahabhuta predominance. This I have given example of minimal. He has explained very detailed when we go into the Tikakaras. Next, Ushnavirya drugs we should be collected from Vindhya region. Shitavirya should be collected from the Himagiri region. Next, sir. Next, Prashasta Ahani, that is, he has given on which day also we have to select the drug that is produced on good day. According to BHESHAJA Ratnavali Paribhasha, he has given we have to select particular part of the plant on a particular
Hello,
ritus.
doctor.
Such, sir.
Doctor, you are exceeding the time limit. Can you speed
Okay,
up your
sir.
presentation?
Okay, sir. Moola, we have to select it Shishura and Grishma, Patra and Varsha and Vasanta, Kanda, Kshira, Sharad, Kusuma Phala, respective seasons, like that he has given. And drugs of animal origin like Naka, Roma, Mutra, Rakta, etc. should be collected in young animals after Jirna of Ahara. Next slide, sir. Next, Yukta Matra. According to Bala, Kala, Desha, we should select the Matra of the next. Bheshaja should be pleasant to the mind. And Gandha Varna Samanvita means, suppose if we take Vacha, it should be Ugra Gandha. That is, if you take Hingula, it should be Japa Kusuma. Next, sir. Doshagna, it alleviates specific doshas. If we take Rasna, it will specify the Vatahara, Gugulu Kafara, like this. Next slide, sir. I have taken here concept of ideal drug just to tell that whatever the ideal drug which is nowadays we are studying, that has already explained clearly in our ancient text. That is, ideal drug means non-toxic, be biocompatible, biodegradable, can have any type of physical state, that is independent of dosage. All these points will already clearly explain. We need to segregate and study in detail. Next, sir. Next slide. These are many qualities. Next slide, sir. Hence, here conclusion we can take this: efficacy of a doctor or healthcare system treatment modalities with regards to cure of disease can be achievable by selection of an ideal drug, that is Prashasta Bheshaja. Thank you, everyone.
Thank you, doctor. So next I invite Dr. Gokarna Ankushrao Chavan. I invite Dr. Gokarna Ankushrao.
Yes, ma'am. I'm sharing my screen.
Okay, doctor, please share. Doctor.
Sure, doctor, please.
Is it visible, sir?
Yes, doctor, visible, doctor. Please start the session, doctor.
Yes, sir. Good evening, everyone. Myself, Dr. Gokarna Chavan from Panchakarma department. Today, I'm going to present Ayurvedic management of Anidra. First of introduction. In Ayurveda, Anidra is considered as one of the Vata Snanatmaspadi. Acharya Vagbhata and Acharya Shushruta have mentioned Vata Pitta Vradhi Nidra Nasha. Sukha Dukha, Pushti Kasharya, Bala Abala, Vrakshata, Klibata, Jnana Adnyana, Jivan Marana, all are depend upon the proper sleep. In modern, it can be correlated with insomnia. It is defined as difficulty in sleep. It is a common sleep disorder. Approximately 30 to 40% of people are affected by insomnia. And incidence goes on increasing day by day because of excessive caffeine, alcohol consumption, drug abuse, smoking, poor sleep habits plays an important role in developing insomnia. Definition of Anidra. Any reason which cause a decrease in kapha and tamaguna in body leads to Anidra. Anidra is broadly defined as the loss of sleep or the derangement in the quality and quantity of sleep. Synonyms of Anidra: Anidra, Nidranasha, Aswapna, Nidrakshaya, and Alpanidra. Nidana of Anidra: Aharaj Nidana, excessive consumption of ahara, which causes qualities like Ruksha Lagu Tikshna Guna, and excessive consumption of caffeine and alcohol. Viharaj Nidana, Ratri Zagrana, Adhik Sharirik Shrama, Ati Vyavaya, Ati Dhumapana, and Divaswapna. Mansik Nidana, Chinta, Bhaya, Shoka, Krodha, and Manastapa. Improper treatment: Atiyoga of Vamana, Virechana, Dhumapana, Raktamokshana, Vyayama, etc. causes the vitiation of Vata. Other factors: Ati Vyayama, Rogi person, and Vata Prakriti person. Purarup of Anidra. This is Vata predominant Vyadi, so Avyakta is a Purarup of Anidra. Roof of Anidra. Cardinal features of Anidra is loss of sleep. Due to lack of sleep, symptoms usually appear as follows: Jrambha, Angamarda, Tandra, Shirashula, Akshi Gaurava, Shira Gaurava, Zadya, Glani, Brahma, and Apakti. Samprapti of Anidra. Due to Nidana factors, that is Aharaj and Vidara. Due to Ahara Vihara Nidana factor, Vata and Pitta get increases and Kapha decreases. And due to Mansik Nidana factor, Sattva and Raja increases and Tama decreases. Due to Kapha Kshaya and Tama Kshaya causes the Anidra. संप्राप्ति घटक of अनिद्रा, दोष वात पित्त वृद्धि and kapha kshaya, दुष्य रस, agni जठर agni, श्रोतस is मनव श्रोतस and रसव श्रोतस, श्रोत दृष्टि is अति प्रवृत्ति, उद्भव स्थान is हृदय, अधिष्ठान also हृदय. चिकित्सा ऑफ अनिद्रा, निदान परिवर्जन, आहार चिकित्सा, विहार चिकित्सा, मानसिक चिकित्सा, शमन औषधि चिकित्सा and पंचकर्मा चिकित्सा. निदान परिवर्जन, one should avoid all causative factors which results to anidra. In nidra nasha, vata dosha is involved, so one should avoid the vatakara ahara and vihara. Ahara chikitsa, acharya charak mentions gramya mamsa rasa, anupa mamsa rasa and mahishak shira. Use of shari rice, curd, milk, wheat, ikshu, draksha and misri. Vihara chikitsa, practicing yoga and meditations like pranayam, surya namaskar, tadasana, etc. It relieves the stress and calms the mind. Practicing shirabhyanga, samvana, induces the sleep. Mansik chikitsa, acharya charaka mention, mano anukul vishaya grahana, mano anukul shabda grahana, mano anukul gandha grahana as a mansik upchar. Next, shaman aushadhi chikitsa, in single drugs, sarpagandha churna is 2 grams BD. It is powerful tranquilizer and induces sleep. Ashwagandha churna, 3 gram churna is used 2 times in a day with sugar and grahata before meal. Zetamamsik churna, 50 mg to 1 gram, 2 times in a day with milk after meal. It relaxes the nervous system. It used as a tranquilizer. Vachak churna, dose is 1 to 2 gram BD. It is a mind calming herb which cures tension and depression and induces sleep. Brahmi churna, 1 to 2 gram BD with milk and sugar. Mandukparni churna, 1 to 2 gram BD with milk and sugar. Shankapushpi churna, 1 to 2 gram BD with milk and sugar after food. Parsik Yamani churna, 575 mg churna is used twice in a day with honey. Jati Faladi churna, 3 to 6 gram churna is used twice in a day with ghee. Next, Panchakarma Chikitsa. Virechana, expel toxins, pitta, dosha, and dushti kapha. Therefore, it balances the normal doshas and one can induce the sleep. Next, Nasya, Abhyanga. Abhyanga with medicated Vatahara oil. Ada Abhyanga. Food massage with Vatahara oil and Mastu. Akshitarpana. Retaining of oil over eyes. Samvana. Gently pressure on body. Next, Murdini Tela. Shiro Pichu with Shirabala Tela, Brahmi Tela, etc. Or Vatahara oil. Shiro Abhyanga with massaging oil result in calm mind and induces sleep. Shirobasti, Shirodhara, and Shirolep. Other management of anidra, comfortable bed, comfortable room should be used. Maintaining regular time for going to sleep. Not indulging any type of work or reading till late night. Should divide of thought tension before going to sleep. Hearing soft, calm music before going to sleep. 5 to 10 minutes meditation before going to sleep. Washing of hands, feet, and face before going to sleep. Proper evacuation of stool and urine before going to sleep. Maintenance of adequate privacy and free from disturbance. Next conclusion. Nidra is one of the important aspects of life. The disturbed sleep causes a high risk of lot of physical and mental abnormalities, and most of the patients suffering from insomnia having negative emotions like krodha, bhaya, shok, and chinta. The problem of insomnia increasing currently day by day due to the stressful life. Ayurveda literature established various therapeutic measures in the management of anidra, such as avoiding positive factors, administration of drugs in a single or compound form, Shodhana Chikitsa, Panchakarma Chikitsa, and regulation of Ahara and Vihara are the best way to treat anidra. In modern science, it treated with sleeping pills. Sleeping pills causes many side effects like tingling, dizziness, and peripheral neuritis, etc. So Ayurveda has a great potential to treat insomnia. Okay, thank you, sir.
Thank you,
Thank you,
doctor.
doctor. So next I invite Dr. Shweta Shankar Hardas.
Yes, ma'am. Just give me 5 seconds. I'll share my PPT.
Okay, doctor.
Okay, doctor.
Is it visible?
Yes, doctor, visible. Please start, doctor.
Yes. Yes. Good evening, everyone. I am Dr. Shweta Hardas, pursuing teaching Shastrayam Bheshaja Kalpana from IMT Ayurvedic Medical College under guidance of Dr. Ninath Sati. My topic for paper presentation is Need for Knowledge of Intellectual Property Rights for Young Ayurveda Entrepreneurs. Introduction. So basic, what is intellectual property? It is a category of property that includes intangible creations of human intellect. Intellectual property rights are the rights given to individual persons over their innovative creations, so to protect the intellectual property. Definition. Intellectual property rights have been defined as ideas, innovations, and creative expressions based on which there is a public willingness to bestow the status of the property. Intellectual property pertains to any original creation of human intellect, such as artistic, literary, technical, or scientific creations. Intellectual property rights refers to legal rights given to the inventor or creator to protect his innovations or creation for a certain period of time. WIPO, that is World Intellectual Property Organization, is a specialized agency of United Nations. It promotes the protection of intellectual property throughout the world. These are the basic types of intellectual property: copyrights, trademark, design, patents, trademark, trade secrets. We'll see in brief. Copyrights includes literary, artistic, musical, etc. works such as books, songs, films, web content, etc. It is valid for original owner's lifetime and 60 years after his death. It is the validity. Example related to Ayurveda entrepreneur, it can be a research article which we published or blogs, so that to avoid unlawful reproduction or plagiarism. Trademarks, it is used to protect signs, symbols, logo, taglines, words, or sounds used for distinguishing the products and services of one commercial house from that of its competitor. So its example can be Cipla, Dabur, Vicks, Patanjali. Below I have shown McDonald's and Lay's. These are the example of trademarks. Design, it protects designs such as computer models, drawing, fashion industry, designs of clothes, shoes, or anything else that comes under designs. When a design is registered, it has a validity of 10 years from the date of its registration. Next is patents. It protects the inventions created and brought into use for commercial purpose. It prevents an invention from being created, used, or traded for commercial purpose by any other party. It is valid for 20 years from the date of filing of the patent application. Its example can be Ayurvedic medicine, which are patent, that is LSRX. Few of them are LSRX from Charak Pharma. Next can be Arkanim tablet of Arkashara. These are the examples of Ayurvedic medicine patent. Geographical indication is given to products belonging to a particular place to depict their geographical uniqueness. GI tags are valid for 10 years and can be renewed for an indefinite period every 10 years. Examples of GI tags are in India, that is, one is Navara rice, also known as Shashti Shali. It is specifically found in northern Kerala. Second is green cardamom. It's two types. One is Alepi, that is found in Kerala. Second is Korg, that is in Karnataka. One more is in Ganjam Kevda, also known as Ketki Pushpa or Kevda flower. It is found specifically in Orissa. And last is saffron. It is found in Kashmir. So these are the examples of GI tag, geographical indications. Next is trade secrets. Trade secret is a formula, practice, process, design, instrument, pattern, or compilation of information which is not generally known or reasonably ascertainable, by which a business can obtain an economic advantage over competitors and customers. It protects the subset of traditional knowledge. It can be used to protect the subset of traditional knowledge. And one more example can be used as the recipe of Coca-Cola. No one knows the recipe of Coca-Cola, so it is a trade secret of that company. Next is plant variety. Plant breeders' rights or plant variety rights are the rights to commercially use a new variety of plant. It actually encourage farmers and breeders for development of new variety of plant. So why knowledge of IPR is needed? Awareness regarding Ayurveda has increased tremendously in the last few years, and in COVID-19, it further caught the attention of the public. Ayurveda is now being acknowledged globally from people, and people from various countries want to learn this ancient knowledge. People from other countries are claiming patents and processes and invention which we work hard on due to lack of knowledge to protect it. So we must be able to protect our work by taking benefits of IPR. IPR also helps to restore our scientific knowledge and promote them globally. It makes them acceptable without any financial constraints. It provides employment and increase the participation of farmers to cultivate medicinal plants. Few more benefits of IPR. To make a new invention, creation, or conduct research, it needs a huge investment. IPR makes sure that the assignee's investment does not go in vain by protecting the content from unlawful use. These legal rights confer an exclusive right to the inventor or creator or his assignee to fully utilize his invention creation for a given period of time. It enables them to reap commercial benefits from their creative efforts or reputation. Other benefits, it fosters innovation and business idea. As through intellectual property, your ideas or innovation turn into commercially viable and turn into a product or service. It helps secure grant and funds. If you have intellectual property rights, you can raise funds from private investor, and a strong IPR portfolio is necessary, as IPR portfolio is necessary to raise funds. Third is it creates a strong financial portfolio. If your company or pharma has an intellectual property right, your portfolio becomes stronger. Example, let's take Google. The word Google is trademarked and it's now worth $44 billion. That's 27% of the company's worth. It creates a financial net. If your intellectual property assets are something, your startup and your company can fall back on. Intellectual, if in case your startup has to close down or declared bankruptcy, they can sell the intellectual property and use the intellectual property as an asset and get a significant boost. It's provide protection. There is a need to protect inventions in the healthcare domain, as every product or service is unique. If that is not protected through IPR, anyone can use the prototype or a blueprint to develop a similar product of their own and do a business out of it. Discussion. Always try to invent or create something which is beneficial to the society and mankind. Ayurveda is a traditional knowledge, so you cannot take patents on things already mentioned in Ayurveda. But inventions in the field of art, process, method, or manner of manufacturing, machinery, apparatus, and other substance produced by manufacturers can be done with which are noble and original. Start from the local or regional level, then go step by step, then go to national, and then go to globally, so that you will come to know what are the drawbacks, what are the inputs required to make it utmost useful. Create awareness among the public, as a patent, copyright, or trademark, etc. will not get that much attention if people don't know. Under plant variety rights, we can propagate a new variety of plant, or we can even encourage other people to cultivate it and make them aware about the various schemes of governments had made. For getting a patent, it's always not necessary to do a big thing. Even small things can make a big difference. For example, a single kalpa, but processed by different methods. If you take a single kalpa, it may have 4-5 references. So you can study what are the difference between those references, what are the different methods, or what are the changes that happens in that methods, and it can become your specialization.
Hello,
or
Dr.
your
Shweta.
uniqueness. Yes, ma'am. Yes, sir.
Doctor, the time allotted for your presentation is running out. Doctor, can you speed up your presentation?
Yes. I'm almost done. Yes. So it is a detailed process, and for that you require detailed study process, test, and literature is required. It requires equal contribution from both teacher and student. So try to learn new things and invent new things, as it will create a great impact of our nation globally, and it will improve the India's rank in global invention index. These are the reference. Thank you. Keep learning and keep inventing. Thank you.
Thank you, Dr. Shweta. Next, I invite Dr. Pranesh P for the paper presentation. Dr. Pranesh, are you there?
Yes, sir. Can you hear me?
Yes, doctor. Please share the screen, doctor.
Yes, sir.
Your screen is visible, doctor. Please start.
Yes, sir. Good evening, sir. Good evening to everyone. My topic is based on a critical review of obesity and its management through Ayurveda, through Panchakarma. Introduction. Staulia is a burning problem in the world scenario and has acquired the status of epidemic. Indiscriminate dietary habits, sedentary lifestyles, stress, etc., which are the gifts of modern world, are predisposing factors for Staulia. Due to economical, industrial, and astonishing progress in the science and technology, quality of life is deteriorating. In 1997, December, WHO declared obesity as a global epidemic, giving rise to a new term, globesity. 5,000 years back, Ayurveda had identified this state as Staulia and grouped it among the Santarpanotta Vyadhi. Obesity is basically a behavior disorder. Coming to Nidana, it can be classified into three types: Aharaja, Viharaja, and Manasika. Aharaja, intake of food which is having qualities like Guru, Shita, Pichila, Snikta, and Rasa, Madhura, Dravya like Navana, Gorasa, Dadi, Gaudika, Varuni, Anupa, Varija, Mamsa, Vidhya, Adhyasana, Ati Sampurna, Ati Matra Bhojana. Viharaja include Shayasana, Sukha, Divaswapna, Chestadvesha. Manasika includes Achinta and Ashaniyatva. Coming to Staulya Rupa, it is explained in Charaka Sutrasthana, which includes Aishwarasa, Javaparoda, Krishna Vivayata, Daurbalya, Daugandhya, Svedabada, Shudati Matra, Pipasati Yoga. Coming to types of Staulya, as per Charaka, it can be classified into two types, Stula and Atistula. According to Sushruta, Staulya and Medaroga. According to Vagbata, it is classified into three types, Adhika, Madhyama, and Hina. Coming to Chikitsa, Nidana Parivarjana, Gurucha Apatarpana Ahara, Langana Chikitsa, followed by Satata Karshana Chikitsa, and Patya Apatya. Coming to Shodhana, Charaka and Vagbata both have clearly mentioned Staulya is in Bahudosha Avastha and Shodhana can be performed. Charaka considered Staulya as Shleshma Nanatmaja Vyadhi in Charaka Sutra 20 chapter 17 Maharoga Adhyaya, and Santarpana Nimittaja Vyadhi. There are mainly two parts of Shodhana, Bahya Samshodhana and Abhyantara Samshodhana. Bahya Samshodhana usually include Udvartana, which is having Udvartanam, Kafara, Mersa, Pravilanam, Stirikaranam, Manganam. As it has a Kaphamedara property, it is indicated. Coming to Abhyantara Shodhana, which includes Vamana, Virechana, Niruha, Shiro Virechana, Rakta Mokshana. Charaka has recommended Vamana and Virechana Kama for all Santarpanotta Vyadhis. As Staulya to come under the same category, Vamana Virechana therapy can be tried in Staulya. Bahya and Abhyantara. Snehana Karma. Snehana, coming to Snehana. Snehana Karma is always restricted for the patient of Staulya. However, on exigency, usage of Taila is recommended. For Snehapana and Abhyanga, following preparation can be used, which is Tila Taila, Sarshapa Taila, Trifaladi Taila, Panchatiktaka, Guggulu Gruta. Coming to Swedana, it is told that Swedana is one of the Chikitsa for Santarpanotta Roga, Santarpana Janya Roga. In Ashtanga Sangraha Sutra, for Staulya, Swedana is essential. Vagbata has indicated the use of Pinda Sweda on extreme requirement. Sagni Sweda and Niragni Sweda. Sagni Sweda, Nadi Sweda, Parisheka Sweda, Drava Sweda, Ushna Jalasnana. Niragni Sweda includes Guru Pravarna, Bahupana, Shuddha Nigraha, Atapa Sevana, Vyayama, Ahava, Krodha, Bhaya, and Upanaha. Vamana. Staulya is a Kafaja Nanatmaja Vikara, and Vamana is the first line of measure. However, Vamana is indicated for treatment of Meda Roga. Also, similar line of treatment is advised for disorder of Kleshma and Meda Roga as per Ashtanga Sangraha Sutra. Vamana is considered as the best treatment for Kapha dosha. Hence, Vamana can be used for the treatment of Staulya, but only in uncomplicated patients. Virechana. Clear indication of Virechana in Staulya is mentioned. Though Virechana has been forbidden for patients of Staulya, as Virechana is indicated for Pitta Adhika condition. In Sushruta Samhita, while describing Virechana Karma, Stula Prameha is considered as Durvirecha due to aggravation and dominance of Vedas. However, Tikshna Shodhana is instead line for treatment for Staulya. It has been included, as per Bhava Prakasha, it has been included for the management of Staulya by Bhava Mishra. Virechana Yoga like Trifala, Aragbada, Katukarohini can be used. Next, coming to Basti. As it is told by Sushruta and almost in all the classics, we will get reference regarding Lekana Basti, especially for Staulya. Other Bastis include like Bhadradi Astapana Basti, Aragadadi Niruha Basti, Dvipancha Muladi Basti, Kapha Mayagna Niruha and Anuvasana Basti, Eraunda Muladi Niruha Basti, and Gomutra Basti. Coming to Shirovirechana, Ayurveda texts have specified the benefits of Shirovirechana in Medoroga. Avapeda Shirovirechana is mentioned as a line of treatment for Abhishanna Meda Vyapta Sharira. Moreover, Kashana Nasya is indicated in the disorders of Kapha dosha, and Stavlya is enumerated as one of the 20 Kaphaja Nanatmada disorders. According to Bhava Prakasha, Trifaladya Taila has been indicated for Nasya Karma in patients of Stavlya. Coming to discussion, overweight and obesity can be compared with Stavlya, which is one of the Santarpanotta Vyadhi, and line of treatment for it is Apatarpana and Langana, which can be done by Shodhana and Shamana. Hence, an effort has to be made to set an Ayurvedic standard diet plan in the management of obesity. Conclusions: based on the avastha and dosha bahulyata, suitable Shodhana can be adopted. If necessary, Mrudu Vamana and Virechana can be performed so to avoid complication in Stavlya. Among all the Shodhana modalities, Basti Karma is more ideal and do not produce much complications compared to Vamana and Virechana. Repeated and regular Shodhana followed by controlled diet, regular exercise along with Shamana medication should be carried to combat Stavlya epidemic. Thus, it can be concluded that Shodhana measures have a very important role in management of Stavlya. Thank you, sir. Thank you all.
Thank you, Dr. Pranesh.
Thanks. So next I invite Dr. Arjun.
Yes, ma'am.
Doctor, please share the screen, doctor.
Yes, sir. 1 second. I'm sharing my screen.
Okay, doctor.
Is it visible, sir?
Yes, doctor, visible. Please chat, doctor.
Okay. Good evening, everyone. My name is Dr. Arjun K. Today I'm presenting a paper on role of Jalokacharana, a conceptual review. My name is Dr. Arjun. I am a second year PG scholar from Department of Shalyatantra from Sri Shivhari Medical College under the guidance of R.C. Kundi sir as well as Akshay Ganachari sir. These are my contents of today's presentation. Coming to its introduction, Jalokacharana has a complete chapter on it by Acharya Shweta, and it was extensively practiced by Dhanvantari Sampradaya, and it is mainly effective over the disorders of vitiation of blood. Then coming to Jalokacharana is a best parasurgical tool in painless bloodletting treatment. And next, it is indicated in like conditions like Jaloka is mainly for Pitta conditions, and blood vitiated by Vata is for Shrunga, and Alabu is used in Kapha conditions. And coming to leech, it is explained as leeches are something which is Shitadi Vasaha Maduraha Jaloka Vari Sambhava Tasmat Pitta Upasrushta Tu Hitasa Ta Savat Sechanaha. It lives in cold climate. Leeches emerges from water, sweet in nature, and it is best for Pitta vitiated doshas. Coming to leech classification, Raktamokshana classification is like Raktamokshana basically divided into Shastra as well as Shastrakrut, and Shastrakrut is divided into Shrunga, Jaloka, Alabu, and Shastra is divided into Shiraveda and Prachana. And today I am dealing with Jalokacharana. Its etymology and definition is like Shrushruti explained it as Jalamasam Ayurti, that is Jala is the Ayu for the Jaloka, as well as Jalamasam Okaiti Jaloka, that is Jaloka lives its entire life in Jaloka. Coming to Shabda Kalpaduma, he explains as aquatic Jaloka is aquatic animal which aims in expelling vitiated blood. And synonyms are like Jaloka, Jalayu, Jajini, Jajika, Jambuka, Raktapayini, Raktasamdanshika, etc. Next, Jaloka classification is like it is classified into 12 types, mainly 2 types, that is Savisha and Nirvisha. In Savisha, 6 numbers, and Nirvisha 6 classifications, total 12 number. And Savishas are like Krishna, Karpura, Laganta, Indayuta, Samujuta, and Kochana. As Nirvisha is Kapila, Pingala, Shankamuki, Mushita, and Nirvisha, and Savarika. Coming to Savisha are like these are types which has Savisha in it. So Krishna is something like Anjana Chunavarna, Tushira, Krishna. And Karpura is Vamir Matsavada, Ayana, as well as.
Hello, Dr. Arjun.
Yes,
Your voice is breaking, doctor. Can you please reconnect your headset?
one second. Actually disconnected, sir. Is it audible now, sir?
Audible, doctor.
Okay.
But some slight problems are there. Okay, continue, doctor. Please continue.
It's not audible to anything, sir.
Audible, doctor, but some vibrating sounds are there. So your voice is breaking.
Okay, one second, sir.
Not audible, doctor.
Hello.
Hello.
Sir, is it audible now?
Yes, doctor. Audible, doctor.
Okay,
Please
okay.
continue, doctor.
Okay. Next, the third type is Alagarda. Alagarda is Romashaha, Mahaparsha, Krishnamukhi, Alagarda, as well as Indrayuda is Indrayuda, Urdhva Rajabir, Shitraha, Indrayuda. That is, body is colored with like rainbow. Here the Indrayuda prognosis is it is asadhya. So if anybody is get bitten by Indrayuda, it is untreatable. Next, Samudrika. Samudrika is Ishad Asita Pitikaha, as well as Vichitra Pushpakriti, Samudrika, and Gochandana is Gorushnavad, Adobhaga, and Vidha, Dudha Bhujya, Unnamuki, Gochandana. These are the types of Sameeksha. Coming to its habitat is Savitsaha, Matsya, Kita, Dudura, Muta, Purusha, Kodasaka. That is, it lives in the water which is contaminated by putrid bodies, as well as color like a red, whitish, black color, and Jalokas are fixed side as well as heavy. Its lakshanas treatment are like that is lakshanas are like Shweta, Atimatra, Kandur, Murcha, Shwara, Daha, Chatir, Mada, Sadhana, etc. Basically are the similar lakshanas. Coming to treatment, Acharakota cells, Mahagata, Pana, Lekana, Nasya, and any Bishan, Nashaka Chikitsa, as well as Rakata, Pashima Chikitsa. Next, coming to this is the important topic, Nirvisha Jalaka. That is these are the Jalakas which we use in our practice. That is Kapilaha. It is like the sides are like Manashila Varna, and the Parsha is of Mudra Varna and Snitha in nature. Pingala is Kinchidra Varna, it is in nature, as well as it is Uttarkaya and Ashuda, it is fast moving. Next, Shankamukha is Ekudvarna, Shigrapayani, as well as Dirgha Kikshamukhi. Shankamukha and Mushika is color and shape is similar to Mushika, and over it's like Nishtadanda. Pundarika Mukha is it is Muktavarna, as well as it is Mukha is similar to Tulyavaka, Pundarika Mukha. Next, Savarika is it is Snitha, Padma Patravarna, Ashtadashangula, and it is indicated in lower animals. Coming to Nirvisha habitat, it is where it is lives in water which is decomposed by Padma, Uttalana, Lina flowers. And places it is indicated in Yavana, Pandya, Saya, Potana, where Yavana is our place, Pandya is South Indian plateau, as well as Saya is Western Ghats, and Potana is our last of West Bengal present. And these lakshanas are like Mahasharira, Balavata, Shigrapayani, Mahashana, and Nirvisha. These are the main lakshanas of Nirvisha Jaloka lakshanas. And based on its classification according to gender is Vagbhata divides into male and female Jaloka, where Sukumara, Tanutvacha, Alpashiraska is female Jaloka and complete opposite to its male Jaloka. And if it is indicated, female Jalokas are indicated in Alpa Dosha Avasthas, as male indicated in opposite to it. Indication is Drupa, Adya, Bala, Stavira, Biru, Durbala, Nari, as well as Sukumara and Paramasukumara conditions, Jalok has indicated. And diseases like Gulma, Arsha, Vidradi, Kushta, Vatrakta, Galaroga, Netraroga, etc. It is indicated. Samprapti Ghataka of Jalokachana is Dosha is like it is indicated in Pittaja Vikaras, Dratita Raktas, as well as in Sukumara Purushas. Dhatu is Rasa Rakta, Lasika, and Mamsa is involved. Prakriti for Sukumara, Bala, etc. patients. Rogha is like Gulma, Shaya settled. Kala is like it is used in Sharad Rutu. In winter season, it should be used at noon. Summer season, like cool timings. Rainy season during clear sky. And extreme hot and cold conditions should be avoided. Coming to its treatment is Purva Pradhana and Paschat Karmas, where Purva Karma includes its Sangraha, like collection of Jit. First, we have to collect it with the help of with a leather piece or with the meat. We have to collect the Jalokas, and collection is we have to collect it in Sharad Rutu, that is from October to November, and it's preserved in earthen pots with pure water with the lotus, as well as its food is like leaves of Kamala Nala, Shaivala, etc., and aquatic animals meat also is added. Water is changed for third day, whereas pot is changed for seventh day according to Shushata and fifth day according to Vagbhata. And it is unfit jaloka lakshanas are like sthula madhya, pariklishtah, prutu, mandavicheshtaha. And alpa paitva and savishas are unfit for jalokas. Next, shodhanas of leeches before procedure, shodhana of leech is conducted, where leech is sprinkled with mustard seed water, and it is kept in haridra jala for one murta. It's important is it removes vigyuta klama and mukta purisha jalaka. Next, patient is prepared like a patient who is fit for jalokachana is selected. Procedure is educated, then aseptic precautions are carried out, and the area is covered with the help of mud as well as cow dung. It is scraped. Next, pradhana karma, jaloka is held at the where it is indicated. Next, if the jaloka doesn't bite, then milk, blood or ghee drop is added. Even chedana or vedana is done if the jaloka doesn't bite. Even after the jaloka doesn't bite, then jaloka is replaced. As soon as the jalaka sticks on the area, its body resembles to ashwamukhavat ananam. That is the horseshoe shape, and a peristaltic movement is in its body. Then a wet cloth is covered over the jalaka and water is poured in simultaneously. Next, removal of leech after patient gets an itching or pain sensation, then the jalaka is removed with the help of saindhavla by pouring saindhavla lavana. Next, shuddha and ashuddha rakta difference is known as like if the leeches drinks actually only vitiated blood, if it starts just like the swan drinks like mixture of water and milk. Like Pashat Karma, Jalaka Vamana is conducted with help of body is spaced with Tandula and mouth is spaced with Thailand Lavana. Jalaka Vamana is conducted. Samek Vanta Lakshana is Jalaka moves freely inside after a pot, and it Durvanta Lakshanas are like it's dull and inactive. And if it is Durvanta Lakshana is not attended, then it leads to Indramada. Next, care of the patient like Samyak Yoga, Hina Yoga, Ati Yoga, and Mithya Yoga is seen, where Samyak Yoga conditions are treated with Shatadota Gruta and Shatadota Pichu, and Hina Yoga is Madhu is rubbed over it. Ati Yoga, Shita Jala is poured, as well as
Dr.
Mithya Yoga,
Arjun?
Kasha as well as. Yes, sir. I'll be finishing, sir.
Doctor,
This, leech is its kingdom. These are the actions of the enzymes which leech has like iridine, kallin, hyaluronidase, bedlin, etc. Coming to discussion, even Jaloka is effective in present era. It is used in patients who are frightened for surgical procedure, diabetic foot, DVT, gangrene conditions, easily available, as well as painless procedure. Next, it has biological procedures like vasodilators, anticoagulating effect, anti-inflammatory effect, local wound healing effect, anesthetic effect, antibacterial effect, etc. All these. Next, its limitations are like blood transmitted diseases, and complications are like allergic conditions, soreness, etc. Coming to conclusion, the clinician who knows about the leech habitat and its indication and its procedure, etc., will be well known in his practice. These are the references. Thank you.
Thank you, Dr. Arjun.
Thank you, Doctor. So next I invite Dr. Shruti.
Hello, Dr. Shruti.
Yes, sir. Am I audible, sir?
Audible, Doctor.
Shall I start?
Sure, Doctor. Dr. Shruti, your screen is not visible, Doctor.
Yes, sir. I'm making it visible. Just a second.
Okay, Doctor.
Visible now, sir?
Yes, Doctor. Visible, Doctor. Yes, visible, Doctor. Please continue, Doctor.
Okay. Good evening, everyone. Myself, Dr. Shruti. Yes, I am from the Department of Rachna Sharira, JMC Bangalore. And today my topic of presentation is Netra Mandala. I'll start with the contents. I am going to do the introduction, Netra Utpatti, Naina Budbuda, and I'll be explaining all the 5 mandalas of Netra. Introduction. Purusha is defined as a conglomeration of Atma, Indriya, Manas, and Artha. If any factor is missing, we can say there is a Vikriti in the Sankhatana of Purusha. Indriya or sense organs thus are essential for a Purusha to lead a healthy and fruitful life. Netra is one among Pancha Jnanendriyas. Sushruta in Uttara Tantra first chapter grossly elaborates the anatomy of Netra with distinct structures. He explains the features like Netra Utpatti,
Then the detailed explanation of Netra Rachana or the anatomy and Netra Rogas. Netra Utpatti. Each part of Netra is formed from a particular Mahabhuta such as Palam Bhuo, Agnito Raktam, Vatat Krishnam, Sitam Jalat, Akashat, Ashrumargascha, Jayante Netra Budbude. Further, he explains all the anatomical features of Naina in detail. The first one is the shape of Naina Budbuda or Netra Budbuda. Naina Budbuda, that is Vidyat Dvayangula Bahulyam Swa Angushtodara Samidam. Dvayangulam Sarvata Sartham Pishat Naina Budbudam. Suvrutam Gostanakaram Sarvabhuda Gunothavam. Here he explained the Naina Budbuda is Gostanakara and it is Swa-Angushta, that is, it will be having the measurement of one's own Angushta. Again, after that, he says the Drishti Mandala Vivarana, Drishtim cha atra tatha vakshe yatha bruyad visharataha. Netra Ayama Tribhagam to Krishna Mandala. So, in the Netra Ayama, 3 parts are considered to be Krishna Mandala and Krishna Saptam Ichandi Drishtim Drishti Visharada. That is, the 1/7th part of Krishna Mandala is called as Drishti. Coming to my topic proper, that is Netra Mandala. Mandalani cha sandhishta patalani cha lochane yadhakramam vijaniyat pancha shatcha shadevacha. So Netra is made up of mandala, sandhi and patala, which are 5, 6 and 6 respectively. So Shruta explains it in the order of outer structure to the inner ones, that is mandala, and to the innermost we have sandhi and patala. Mandala in this classification, and as I said now, we have 5 mandalas, that is Pakshma, Vatma, Shukla, Krishna and Drishti Mandala. And Pakshma Mandala. The word Pakshma can be correlated to eyelashes. That means structurally, it is nothing but hairy portions seen on eyelids. Pakshmani, Vatma Romani is what we get as a description. It is situated in the Pakshma Ashaya or Pakshma Sadhana. This is considered as Upadhadu of Majja also. Then in a normal state, the eyelashes are drawn outwards and help the eye from dust and debris. Then if we say the Netra Rogas related to Pakshma Mandala, even though Pakshma Kopa comes under Vatma Roga, the dosha here gets lodged in the Pakshmashaya. So we can discuss Pakshma Kopa in Pakshma Mandala. And you know, in Pakshma Kopa, there are Tikshna Khara, that is pointed and rough Pakshma will be seen and directing inwards to the eyeball, making a foreign body sensation. And other diseases like Pakshma Shata, Pakshma Uparoda are also seen in this mandala. Pakshma Mandala Rogas can spread to Vatma Mandala due to their close proximity. If I have to speak about eyelashes, that is, eyelashes are attached to the free edges of short, thick, and the upper eyelashes are longer than that of the lower eyelashes. The follicles of eyelashes are associated with 2 glands. They are the gland of Cs and gland of moles. Coming to some of the applied anatomy, we have madarosis, that is nothing but the falling of eyelashes, and we have trichiasis. It is abnormally or posteriorly misdirected lashes, which causes an irritation of foreign body sensation to the eye. Next is Vatma Mandala. Vatma Mandala are 2 in number, that is Urtva and Atha. They are the 2 eyelids of eye, which are the thin folds of skin completely acting by the functions of muscles around it. It is also called as Akshikosha due to its protective action. It is said that 2 Taruna Asthi are present in the Vatma. The Urtva and Adho Vatma meets at the joining point medially and laterally, that is the Kaninika and Apanga. Then the Vatma will be having the functions Nimesha and Unmesha. Then 21 Vatmagada Rogas are explained by Sushruta and 24 by Vakpata. And we, as I said, we correlate Vatma in modern anatomy to eyelids, and eyelids have different layers, superficial to deep, like the skin, subcutaneous areolar tissue, the layer of striated muscle, submuscular areolar tissue, fibrous layer, a layer of non-striated muscular fibers, and palpebral conjunctiva. And the eyelids are also known as palpebrae. And when it is open, we can see the palpebral structure called as the palpebral fissure between the margins. And there are angles present which corresponds to the junction of upper and lower eyelid, and they are called as palpebral commissure or camtine. And talking about the clinical anatomy of eyelids, we have internal hordeolum, external hordeolum, and meibomiitis. Meibomiitis is the inflammation and obstruction of the meibomian glands seen in the eyelids. Then we have entropion and ectropion. Entropion is the inward rolling rotation of the lid margin, and ectropion is the just the opposite of it, that is the outward rolling and rotation of the lid margin. Next, when I'm coming to the Shukla Mandala is also called as Shweta Mandala or Sita Mandala, present inside the Vatma Mandala, and it can be comprehended as the whitest sclera. Sclera forms the posterior 5/6 part of the fibrous tunic, and 11 rogas are explained pertaining to Shukla Mandala by Sushruta. So, talking about sclera, the whole surface of sclera is covered by a capsule called as Steinman's capsule, and this is covered anteriorly by bulbar conjunctiva, and its inner surface lies in contact with choroid. We also have a structure that is episclera, which is the superficial aspect of sclera, which is rich in collagen, and it's very dense in nature, and it covers the sclera proper. And if we are talking about the clinical anatomy of sclera, we have the episcleritis, which is the first disease, that is the inflammation of the episclera, and it is usually associated with rheumatoid arthritis. And scleritis, the second one, is a more deeper condition where there is inflammation of sclera. This is a bilateral condition, and it commonly affects females more than males. Then we have the staphyloma, a condition characterized by the ectasia of outer coats like cornea or sclera, or both of them, with an incarceration of the uveal tissue. Then I'll move on to Krishna Mandala next. According to Sushruta, it is the 1/3 part of the visible eye. As I told earlier, Netra Ayama Tribhagam to Krishna Mandala Muchade. That is the dark corneal part of the eye. As per modern parameters, cornea forms the 1/6 part of the eyeball. And 4 rogas are explained by Sushruta, which affect the Krishna Mandala. When talking about cornea, cornea is a transparent structure, a vascular part of the eye, which has a watch glass-like structure. And we know it has got the layers like an anterior epithelium, Bowman's membrane, central stroma, and a new layer, a new addition has been done very recently, that is the Duas layer as the 4th layer, and Descemet's membrane and endothelium. Then the main clinical anatomy of cornea is keratoconus. We get keratoconus. Then we have corneal ulcers happening, which are due to other underlying diseases. Then viral and bacterial infections of cornea are also very common, like herpes zoster viral infections. This is the cornea. Then the Drishti Mandala, as the name says, this mandala is responsible for visual perception. Krishna Saptam Ichandi Drishtim Drishti Visharadam. This is the 1/7 part of Krishna Mandala. According to Susruta Uttara Tantra, 5th chapter, Drishti is defined as Masura Dala Matram tu Panchabhuta Prasadajam. It is having the matra of Masura Dala and has the properties of all the Panchamahabhuta. Tadyoda Vispulingadam Idhyam Tejo Viravyayam. Avritam Patalena. It is covered with Avrita Akshno Bahyena Vivarakratyam Shita Satmya. It is more it has more affinity towards Shita. Niranam Drishtim Ahu Nayana Chintaka. And this is the area of visual pathway or visual perception, and here we have mostly neurological aspects here. That is from the optic nerve, it reaches the optic chiasma, then to the optic tract, and from here it reaches the lateral geniculate body, and there are from here there are the optic radiations reaching to the visual cortex. It is the anatomy of the visual perception. And if I have to say some of the clinical anatomy of the visual field, if there is an injury to the optic nerve, there is total blindness of the blindness in that eye. And if there is a lesion in the central part of optic chiasma, we get a tunnel vision, which is also called as hemianopia. And if there is a lesion in lateral part of the optic chiasma, we get unilateral hemianopia on the side of the lesion. With this, I conclude my presentation, sir.
Thank you, Dr. Shruti.
Thank you, sir.
Next, I invite Dr. Adiviyavanatha for the paper presentation.
Namaste. Am I audible?
Audible, Doctor. Please share the screen, Doctor.
Is it visible?
Not visible, doctor.
How about now?
Doctor, your voice is breaking and your screen is visible. Your PPT is not visible, doctor. I think it has some network issues. Hello, doctor. Can you hear me?
Hello.
Hello, doctor.
What now?
Yes, doctor. Visible,
Yeah,
doctor.
I can. Screen visible? Audio?
Yes, doctor. Yes, doctor. Audio is visible. Screen is visible, doctor. Please continue.
Okay. Okay. Namaste to all present here. My name is Dr. Adi Vishwanatha Gupta CB, studying in second year, PG scholar from the Department of Shalyatantra, SDM College of Ayurveda, Hassan. I have been guided by Dr. Gopi Krishna Vijay, HOD Department of Shalyatantra, SDM College of Ayurveda, Hassan. My topic for today's presentation is Jatyadi Taila, Vranabasti in Dushtavrana for varicose ulcer, a case report. Varicose vein are the part of penalty we pay for the adoption of an erect posture. In Ayurveda, the comprehensive management of all vranas, that is wounds, is exclusively described by Acharya Sushruta under the Shashti Upakrama, that is the 60 procedures. Amongst these 60 upakramas, local application of medicated oil, that is the use of thaila, extensive use of thaila, is one of the most important upakrama. While describing types of vrana, Acharya Sushruta also mentions the term dushta vrana, which means having the clinical features which resembles a non-healing ulcer, which requires an effective treatment, which does vrana shodhana, also vrana ropana. Hence, it is necessary to go for a method. An attempt has been put forth to evaluate the efficacy of Vranabasti. Since it is a case study, this was a patient, and the right side, you can see the image of the varicose ulcer, that is the Dushta Vrana. He had the following complaints since 1 year. Severe pain and burning sensation at wound site, that is the medial malleolus of right lower limb. Pus discharge, extensive pus discharge was seen from the wound. Itching sensation all around the wound. Because of the wound, he was unable to walk. Dimensions of the wound are 14 to 12 centimeters length by breadth. He had not taken any medical advice and he directly came here for treatment. That means prior to this, he had not approached any doctor, and he has come here directly for the treatment. This was the procedure that was done, Vranabasti. Patient was advised to lie down in supine position. In Vranabasti, a wall, just like in Janubasti, a wall is erected around the wound with Masha Pishti, about 2 centimeter height and thickness of about 0.5 centimeter. In this bowl, Jatyadi Taila is taken. In a bowl, Jatyadi Taila was taken, warmed on hot water, that is indirect heating. Lukewarm oil, this well on the wound by using when this oil got is my voice audible?
Yes,
Am I
doctor.
audible?
Please continue.
Okay. So this lukewarm oil was poured into the well on the wound by the use of a spoon. When the oil got cold, it was taken out and warm oil was poured again, just like we do in Janubasti, the Janubasti procedure. This process was done for a duration of 30 minutes for 28 days and these were the photographs taken. So this was when he came and during the procedure and at the end of 28 days. You can see the edge of the vrana. So the result include, as soon as this Vranabasti was started, the patient got relieved of pain. His discomfort level was also reduced. After Vranabasti for 1 week continuously, discharge and foul smell of the wound got reduced. Gradually, size of wound also got reduced from 14 into 12 to 8 into 4 centimeters. After 28 days of Vranabasti, he was completely relieved and satisfied with the treatment. Even though you can see the wound, it was not. I mean, the previous when he approached us, there was copious pus discharge. At the time of discharge, that is at the end of 28 days, the depth of the wound has also decreased. Discussion effects on Vrana Vedana, that is pain and tenderness, was completely reduced at the end of treatment. Pain, which was present at the beginning, was completely reduced at the end of 2nd week as purulent discharge decreased because of Shodhana properties of Thaila. Effect of Varna, that is change in color, occurred when Dushta Vrana got converted into Shuddha Vrana, which was due elimination of doshas out of the body. Effect of Vrana Srava, at the end of 2nd week, the purulent discharge from wound completely stopped due to Shodhana and Ropana properties of the Thaila used. Effect on Vrana Gandha, the foul smell at the beginning of treatment was completely reduced at the end of 1st week. The smell was present because of pus. Since the pus discharge also decreased, the smell also gradually vanished. Effect of Vrana Akriti on the 28th day, like you have seen, the Vrana was almost healed. This may be due to the Shodhana property of Thaila. Thank you.
Thank you, Dr. Adi Vishwanatha. Next, I invite Dr. Bhagyashree Patil for the paper presentation. Dr. Bhagyashree Patil. Hello, Dr. Bhagyashree, are you there?
Hello, good evening, sir.
Good evening, Doctor. Please share the screen, Doctor.
Hello,
Hello, Doctor.
my screen is visible.
Not visible, Doctor.
Is it visible, sir?
Yes, Doctor. Now visible, Doctor. Okay, Doctor. Please start, Doctor.
Good evening, respected sir. Myself, Dr. Bhagyashree Patil, 2nd year PG scholar, Department of Shayyamutra. And my today's topic of presentation is Ksharakharma in umbilical granuloma. Introduction. Granuloma is defined as focal compact collection of inflammatory cells in which mononuclear cells predominantly will be present and usually forms as a result of persistence of a non-degradable product or as a result of hypersensitivity responses, and it may be due to chronic infection of umbilical cicatrix also, and which causes granulation tissue to pout out of the umbilicus, leads to formation of umbilical granuloma, which is not the most common umbilical abnormality in neonates. It may also present in children also, and it is due to overgrowth of umbilical tissue during healing process. And in Ayurveda, which is correlated to Pindalika, this is one of the complication of improper cutting of umbilical cord, or it can be taken as Nabhigata abscess, that is extra growth of the umbilicus. Since it is a case presentation, here patient which is 8 years old male, complaining of swelling on the umbilicus with discharge and occasional bleeding from the umbilicus from birth. Like umbilical granuloma, main features will be red swelling around the umbilicus and which bleeds on touch. And history of the present illness was, according to the parents of the child, the swelling was consistently present and had no known aggravating and relieving factors, and he had no other past and associated illness. Personal and birth history, appetite was good, bowel and bladder habits were regular, sleep was sound sleep, and which is a full-term normal delivery. And like baby when born, who was cried immediately after birth, and no obvious congenital anomalies. Clinical findings on examination: a single swelling on umbilicus measuring about 1 into 0.8 into 0.5 centimeter was present, which was cherry red in color, and serous discharge was present. Soft, non-tender and moist swelling it was, and surrounding skin which was occupied with unhealthy accumulation of chronic discharges which was present. In the diagnosis, based on the history and clinical presentation, the case was diagnosed as umbilical granuloma, which can be correlated with Spindalica or Nabhigata ulcers. And management, what we did in these cases, under aseptic precautions, Apamarga Pratisarniya Kshara, which is alkaline preparation having the Acaranthus aspera plant, was applied on the umbilical granuloma, and Kshara was applied after cleaning that site with povidone iodine solution and left for 2 minutes, and then it was washed with normal saline. And the procedure was repeated on the second and third day of the first procedure, and the patient was discharged after 3 days of procedure. And after 7 days, we were told for follow-up. This was the photos where before treatment there was a red swelling we can see, and when we have applied Kshara, it became blackish discoloration, and after that at the end of the 7th day, there we can see no swelling is present. And observation: after the application of Kshara on the first day, there was not any significant change observed except the change of color from cherry red to blackish brown, and mild burning sensation was complained by the patient. After application of Kshara, which was relieved, that burning sensation was relieved after washing with normal saline. And on the second day, the size of the mass was slightly reduced and mild discharge was present. And on the third day, the size of the mass was significantly reduced with complete cessation of discharge. And mild burning sensation was complained by the patient after application of Kshara, which was relieved after washing it with normal saline. And on the 7th day, the mass was completely dissolved with the dry surrounding area. There was no moist area. And on the entire course of treatment, we didn't give any antibiotics and analgesics. Results: at 7th day, from the first day of the Kshara application, it was completely healed, and umbilical granuloma was successfully treated with CHATUSAMA. Discussion: an umbilical granuloma is a common condition that can develop in a neonate's umbilical stump. It can be easily treated on outpatient basis, and as this was a rare condition which was not resolved until the age of 8 years and not relieved by any ointments which were mentioned in conventional system of medicine, like application of silver nitrate and dry dressings. And according to conventional system of medicine, they may suggest for umbilectomy or excision of the granuloma. But in Ayurveda, Ksharakharma is indicated for such type of problem. And Kshara, by virtue of its alkalinity, cauterizes the swelling and induces aseptic fibrosis after coagulating the protein, which then results in resolution of the swelling. Because of the Chedana, Lekhana, Bhedana properties of Kshara, the unwanted growth present in the umbilical region will be swept away. Conclusion: Ayurvedic method of Ksharakharma successfully treated a case of umbilical granuloma in an 8-year-old male child. Thank you.
Thank you, Dr. Bhagyashree Patil. Next, I invite Dr. Bhagya Gayatri Gangaram for the paper presentation. Dr. Bhagya Gayatri.
Sir, am I?
Okay, doctor. Your voice is clear, doctor. Please share the screen, doctor.
It is showing, sir, that you can't start the screen sharing because another participant is sharing already.
Please retry, doctor.
Okay.
The screen is visible, doctor. Please chat.
Okay, sir. One minute, sir. Good evening, everyone. Myself, Dr. Bhagya Gayatri Gangara. Today, my presentation topic is importance of Anuvasana Basti in geriatric disorders with special reference to late onset multiple sclerosis. Introduction. As Ayurveda have classified our Vaya according to 3 phases. First phase is Balya Avastha, that is up to 30 years. Second phase is Madhyama Avastha, that is 30 to 60 years. And last phase is Vriddha Avastha, that is after 60 years. And here I'll mention that Vriddha Avastha characteristic. Like the Vriddha Avastha is characterized by the Dhatukshaya, and Indriya perception will be reduced in the Vriddha Avastha. Strength and speech also will be reduced in the Vriddha Avastha. So when we'll see for the geriatric disorder, it defined as aging is a progressive generalized impairment of the function resulting in a loss of adaptive response of the stress and growing risk of the age associated with the diseases. And the causing factor are environmental factors such as a lack of exercise, poor diet, cigarette smoking, and heavy alcohol consumption are though to play a large part. So genetic factor also may affect that in geriatric conditions. And last, like a healthy lifestyle remains worth when encouraging even when old age has been enriched with the good health. So generally we'll see in the geriatric phase, we'll see the changes according to different systems like in CNS, presbyopia, muscle weakness, or the waist. Maybe that can be due to neuronal loss, anterior horn cell loss, or different causes are explained here. Next is a respiratory system, which is like increased risk of the infection or reduced vital capacity or the peak expiratory flow. And maybe the cause is reduced lung capacity, increased chest wall rigidity. Next is the cardiovascular system. Mainly we'll see the symptoms like reduced exercise tolerance, increased risk of atrial fibrillation, increased risk of the postural hypotension, and maybe the cause are reduced maximum heart rate, dilation of the aorta. And when we'll see for the symptoms of the renal system, impaired fluid balance, impaired drug metabolism and excretion, and that cause may be loss of the nephron, reduced GFR. Next, when we'll see that symptoms of the late onset multiple sclerosis is maybe it is due to inflammation or demyelination or the gliosis that can be relapsing or the progressive. And the symptoms generally present with the patient is weakness of the limbs, fatigue, disturbance of the gait, pain, bladder dysfunction, constipation, depression, emotional change, etc. And when we consider that in our Ayurveda, as it can be considered as a prana avruta vyanavata, kapha avruta apana, or mutra avruta apana, lakshana can be correlated. That is, sarva indriya shunyatvam, smriti balakshayam, guru varchasa pravartanam, mutra pravrutti, basti admanam. And for that, Ayurvedic management can improve the quality of geriatric life. So usually when a person will come with the multiple sclerosis, he will present with the weakness of the limb, pain, constipation, depression, fatigue, bladder dysfunction. And also that can be understood that a lakshana of the avrutavata as well as vata pitta vriddhi or kafakshaya. Now we'll see the management of the geriatric condition with the Anuvasana Basti. So why Anuvasana Basti? Because in geriatric phase, there will be the Vata Vritti will be there. And for a Vata, Anuvasana Basti is the Pradhanatama Chikitsa. As it have the Snigdha, Ushna, Guru Guna, and it totally acts opposite to the Ruksha, Shita, Laghu Guna of Vata. Second one is like it is a Samshamana and Sangrahana. Also, Anuvasana Basti helps in a vritti of the Varna, Bala, Arogya, and Ayusha. And it is also as a Vishesha Chikitsa of the Vata. as Vata is a causative factor for the Roga in a Shaka, Kushta, Marma, and Sarvanga Vata. When we'll see the multiple sclerosis, all the Shaka, Marma, Kushta, all are affected. So we'll see how Anuvasana Basti will act. Given Anuvasana Basti given through the Gudamarga will spread through the siras and nourishes all the dhatus. In turn, it does the nourishment to the persons, like how watering tree in the roots will nourish the tender leaves, fruits, flowers, etc. How it will act on the Vata dosha, as Vata dosha with the Ruksha, Sita, Lagu Guna, and Anuvasana Basti with the Snigdha, Ushna, and Guru Guna acts as a Brahmana, nourishes the dhatu, and maintains the health. And how it will act on the symptomatic treatment, like constipation, pain, weakness, fatigue, etc. Lakshana gets developed due to the Vata Prakopa, and Anuvasana Basti is the Vishesha Chikitsa for the Vata Prakopa Lakshana. Mode of action of the Anuvasana Basti, as short chain and medium chain fatty acids are present in the ghee, milk, oil, which are used in the Basti as a Aushadha, and these two fatty acids are absorbed through the wall of the colon, as they do not require bile salts or the pancreatic lipase for the absorption. So coming to conclusion of my presentation, according to Ayurveda, Ayurvedic classes during the Vriddhavastha, that is to after 60 years or the above that, Vata dosha will be predominant and can cause many Vata Vyadhi. As Vata is having a Yogavahi Guna, in Vikruta Avastha, it can vitiate other dosa as well as the Dhatu and may lead to the various Vyadhi, which could be Avrana Janita, Kevala Vataja or Sannipataja. Anuvasana Basti is a Vishesha Chikitsa and one of the best possible treatment in such condition where Vata dosa is predominantly present. As Basti is having a capacity to do the Dhatu Poshana, it can be useful in a debilitating or emaciating condition such as a multiple sclerosis. Hence, Anuvasana Basti is practice can be essential treatment modality to win over the Vata dosha in a Vriddhavastha. As coming year on 1/5 of the population of the India will be elderly. So Anuvasana Basti will act nice. Thank you.
Thank you, doctor.
Thank you, Dr. Bhagya.
So next I invite Dr. Chaturbuj.
Hello.
Hello, doctor.
Doctor, you are audible.
I am audible. Okay.
Please share the screen, doctor. Hello, doctor.
Sir, is it visible
Not visible, doctor.
now?
Not visible, doctor.
Okay, sir, I will send you PPT. Can you display it?
Okay, doctor.
Okay.
Hello, Dr. Chaturbuj.
Sir. Once you check, sir.
Doctor, please chat the screen.
Okay. Good evening, everyone. Today, my presentation is on efficacy of Sarasutra in the management of the Charamikila, a case study. Myself, Dr. Chaturbuj, designation second year PG scholar, Salatantra. So in my PPT, there is a content in that rational case description, methodology, results, and discussion and conclusion. Rational, this case study deals with the application of the Sarasutra in the management of the Charmkila without any surgical intervention. Charmkila is nothing. It is a sentinel pile, is a tag, skin tag in the lower margin of the anal fissure, either 6 o'clock or 12 o'clock. Maybe it will occur lateral side also, but most common site are 6 o'clock and 12 o'clock. Mostly in male, it is at 6 o'clock, and in female, it is at 12 o'clock. So in Charmkila, edematous and it is commonly edematous and associated with the chronic fissure in the
chronic fever in ano. So symptoms are it will cause discomfort, itching, and sometimes it will lead into the abscess formation also. So Sarasutra minimal invasive parasurgical procedure, which is a very cost effective. Case detail, general description, age of the patient, 48-year female. She came to OPD with the present complaint, hard stool with mass per rectum associated with the pain and burning sensation since 3 months. In OPD level, when we ask the personal history, diet non-vegetarian patient and appetite of the patient is good, bowel constipated, and micturition regular, and sleep adequate and sound sleep will be there. On examination, general examination, pallor, icterus, cyanosis clubbing, lymphadenopathy, everything is negative, absent. On the examination of a BP, 128 is there, pulse rate 76, respiratory rate 16 minutes per minute, temperature 97.2 degrees Celsius. Systemic examination, CNS, CVS, RS, all are normal within the range, and per abdomen, soft non-tender, no organomegaly will be there. On local examination, per rectal examination, inspection, chronic fever with sentinel tag at 12 o'clock, DRE normal tonicity, proctoscopy we didn't did, and when on second sitting, there is a normal tonicity, no abnormality detected. Diagnosis is charm killer, sentinel tag at 12 o'clock. Methodology which we used, Sarasutra ligation followed by the Stimudutela pichu. Orally medication we give tablet anuloma 2HS before food, and triflagugulu tablet. And we advised to the patient for SIDS bath with the triflachurna. And patient is asked to come to OPD for follow-up every week until a sentinel tag cut through. So when she came on first sitting, there is a tag is there at 12 o'clock. On first sitting, we tied the Sarasutra, and when she came for follow-up, that will become edematous and slightly cut. On second sitting, it will become more edematous and cutting mostly. So in third sitting, next slide. Third sitting, it completely cut through. And on the ending, means on continuously we are advising to the patient for Yashtumatala pichu. Discussion and conclusion. Sara is having property of Charana, Sadan, and Bhedana, Lekhana, Chedana, and Tridoshgana. Sarasutra, which we are using, that is classically prepared. Apamarga 11 coatings, Nui Sira 7, and Haridra 3 coating will be there. In surgical management, it will expensive and need a long time for the recovery. And in Sarasutra ligation on sentinel tag piles, it is safe and ambulatory. So patient can move at without any restriction. OPD level procedure, we can do it very safely. Thank you.
Thank you, doctor. Next, I invite Dr. Nivedita for the paper presentation. Dr. Nivedita, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Yes. Is it visible, sir?
Yes, doctor. Please start, doctor.
Good evening, everyone. Myself, Dr. Nivedita MN, second year PG Scholar, Department of Kaya Chikitsa. My topic is mode of action of Basti under the guidance of Dr. Vasanta B. Coming to the etymology and definition of Basti, etymology is Vas Nivase Vas Achadane. That means Basti means to reside, to dwell, to cover, or to coat. The definition comes like when Basti given, it will reach Nabi, Katipashva, Kukshi. From these areas, the virya of Basti reaches all over the body and churn dosha sangata and eliminate the vitiated dosha along with Purusha. Introduction. Basti is considered as important Panchakarma therapist, and it is one among Samshodhana and possesses multidimensional action. Basti as Chikitsartha, the main cause of diseases of Shaka, Koshta, Marmurdva, Sarva, Vayanga, and reason for
Vikshepa and Sanghata of Vindmutra Pitta, and also the diseases of disease caused by the Pitta and Kapha is the Vata is considered as a main cause, since Pitta and Kapha are Pangu in nature. So Basti is called as the best treatment for Vata. So when Vata is controlled, half part of the Samprapti Vigatana is over. So Basti is considered as a Chikitsartha. Advantages of Basti over Virechana. In Virechana drugs, it is lightly non-palatable because of its Katukshara and Ushna Guna, and some patients are shows intolerance and unwillingness. But in Basti, it does action of both Santarpana and Apatarpana, and it is free from Upadrava, and it can be easily administered in children and in old age. Advantages of Basti over oral therapy. In Basti, we can spare stomach from the action of drug, reduces first pass metabolism in liver, quicker therapeutic action can be seen, large quantity of drug can be given, and in children it can be easily administered. Ingredients of Basti. Madhu, Saindava, Sneha, Kalka, and Kwata. Madhu, it forms a homogeneous mixture with Saindava, and it has a pre-digested sugar, and it is easy to digest and readily absorbed by the body. Saindava, because of its Sukshma Guna, it enters Sukshma Srotas. Because of its Tikshna Guna, breaks morbid Mala and Dosha Sangha, and its Snigdha Guna helps in liquefying Dosha. Presence of sodium in Saindava helpful since because sodium channel is commonly used for absorption of substances. Sneha, it protects the mucous membrane from the untoward effect of Tikshna Dravya in the Basti. It increases the permeability of cell membrane and helpful in elimination of dosha and mala. Due to Snehatva Guna, it lubricates srotas and helps in easy removal of mala by srota vishodhana. Kalka, this helps in attaining particular consistency responsible for retaining Basti, for which it is used. Both Kalka and Kwata can be selected on the basis of dosha, dusha, and srotas, and their main function is samprapti vigatana of roga. Method of preparation of Niruha Basti. All the ingredients of Niruha are not water soluble, so a special sequence and method of their mixing is to be followed to make a good homogeneous mixture. First Madhu, then Saindava, then later Sneha, Kalka, Kwata should be mixed in order, churned to make a homogeneous mixture, kept on hot water bath to warm it to the body temperature, that is up to 36 to 40 degrees. Position, why we need to follow left lateral position. Agnisthana is on the left side above umbilicus, and Stulantra with continuation of Buddha is also on the left side. So on lying left lateral position, Basti duct can reach up to Stulantra and also Agnisthana. Importance of lukewarm temperature of Basti Dravya. This helps in breakdown of waste material in JIT and also decreases the tone and peristalsis of gastrointestinal muscle, which increases the holding capacity of a Basti Dravya for desirable period and desirable effect. Time of administration of Niruha. This is usually explained to administer in the Madhyana Kala, that is 10 a.m. to 2 p.m. This is because the appetite usually starts here and will not be present in excess, and dosha will be in less Utkleshita Avastha, and also Kleta Shoshana take place when sun is powerful. Why Anuvasana not given in empty stomach? Because if given in empty stomach, Sneha by Sara and Duraga and Sukshma Guna quickly goes upwards. By this, there is no Vata Nashana Kriya occurs because Sneha doesn't stay in Pakvashaya. Agni Nasha occurs because of large quantity of Sneha covering the Agni. And the reasoning is that when we administered after food, the pyloric sphincter closes after meal, and this causes retention of Sneha in Pakvashaya. Why Niruha should be given in empty stomach? If Niruha is given after meals, then Basti Dravya mixes with food, then brings down the food. Or Basti will take the Mala to Amashaya. By this, the Stambana of Mala and Anna occurs, leading to Alasaka, Visuchika, and Chardi. So reasoning is that when Basti Dravya administered in empty stomach, it does not develop gastrocolic reflex, and ultimately no evacuation of Basti Dravya from colon will happen. Basti should never be given at night time. This is because at night time, there will be reduced metabolic activity, absorption and metabolism of Sneha does not occur properly. It leads to dosha utklesha. Action of Niruha Basti in the Pakvashaya. So mainly Niruha will be told, and in first Niruha will act mainly on the Vata, second Niruha will act on the Pitta, and third Niruha will act on the Kapha dosha. Sushruta is also told about the fourth Niruha Basti, which should be administered when there is a Krura Kosta, if it is improperly administered, or if Suniruda Lakshana is not observed in Krura Kosta. Mode of action of Basti according to Ayurvedic. When administration of Basti Dravya via Basti Netra, it penetrates up to Pravahini and Visarjini Valley. It traverses all Antra and reaches Pakvashaya. The Amsha of Jataragni is present in Pakvashaya as Katu Avastha Paka takes place here. This little Agni has only Shoshana property and avoid any complex digestion chain formation. Finally, Basti Dravya is reached its Pakvashaya and Virya of Basti medicine spreads all over the body through Sukshma Srotas. Similarly, explaining the mode of action of Basti, a tree when cut from its root has no chances of survival. Similarly, Basti due to its potency can expel the dosha situated in the Katiprushta costa from its root, hereby nullifying any chances of recurrence of diseases. As a review, he says that Guda is the moola of body where all siras are located. The sneha administered through Guda reaches up to the head and nourishes the body. Anatomy, it is large intestine is mainly divided into anus, rectum, and colon. Colon is mainly divided into ascending, transverse, and descending colon. So ascending colon and the part of transverse colon is supplied by superior mesenteric artery, and a past part of transverse colon and the descending colon is supplied by the inferior mesenteric artery. Mode of action of Basti, absorption mechanism. The GIT is lined with epithelial cells. Drug must pass or penetrate through these cells in order to be absorbed into circulatory system. One particular cell barrier that may prevent absorption of a given drug is cell membrane. And cell membrane being a bilipid layer, it absorbs only lipid-soluble drug. For absorption, the drug should be unionized, uncharged particles should be present, lipid-soluble should be there. And also the drug should possess alkaline substances. Absorption mainly occurs through two routes, that is transcellular route and paracellular route. Transcellular route depends on lipophilicity and thus Sneha Dravyas used in the Basti promote this type of absorption, whereas paracellular route drug diffuses through space between epithelial cells.
Hello, doctor. Hello, Dr. Nivedita. Are you there? Okay, next I invite Dr. Ameya for the paper presentation.
Thank you, doctor. Whether I'm audible?
Dr. Ameya, audible, doctor. Please share the screen, doctor. Hello, Dr. Ameya. Hello, Dr. Ameya.
It's not able to.
Doctor, you have any problem with screen sharing, doctor?
Yes, doctor. 1 minute, doctor.
Don't worry, doctor. I will share for you, doctor.
Okay.
Please start, doctor.
Okay. Good evening, everyone. I welcome you all for my presentation entitled Surgical Complications of Diabetes Mellitus and its Management. Myself, Dr. Ameya PV, second year PG scholar, Department of Shalatandra, STM College of Ayurveda, Udupi. Coming to introduction, diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose, which in turn damages our heart, blood vessels, eyes, kidneys, and nerves. Most common type is type 2 diabetes. Usually in adults, it will occur when the body becomes resistant to insulin or doesn't make enough insulin. Type 1 diabetes, it is known as juvenile diabetes or insulin-dependent diabetes. It's a chronic condition in which the pancreas produces little or no insulin by itself. This is the global incidence rate of diabetes. This is the incidence rate of diabetes in India. These are the complications of diabetics: retinopathy and blindness, cerebrovascular disease, heart attack, permanent kidney damage, diabetic foot infections, and peripheral neuropathy. Among these, surgical complications are abscess, carbuncles, balanitis, diabetic foot, and gangrene. Coming to first complication, abscess. An occasional complication of diabetic foot infections, usually involving osteomyelitis and significant soft tissue injury. Clinical features are rubor, calor, tumor, dolor, and functionalisa. Coming to investigations, routine blood investigation with blood sugar estimation, routine urine examination with urine sugar estimation, swab test, CT scan, conventional radiography. Treatment, it is said that where there is pus, let it out. First of all, drain the pus by Hilton's method. Second is administration of antibiotics according to cultural and sensitivity reports. Next is Hilton's method of incision and drainage. It is done in 4 steps. First one is incision. Second is
Hello, Dr. Ameya. Dr. Ameya, are you there? Okay, next I invite Dr. Jeenu for the paper presentation. Dr. Jeenu, are you there?
Yes, sir. Good evening.
Hello,
sir.
doctor. Hello.
Hello, Dr. Ameya.
Yes, sir.
Dr. Jeenu, one minute, doctor.
Okay.
Yes, sir.
Dr. Ameya, please continue, doctor.
Okay. Next complication is carbuncle. Sir, I am audible, sir.
Yes, doctor, audible, doctor.
Carbuncle is a group of multiple boils which occurs in diabetic patients over the back, nape of neck, and hands. It is an infective gangrene caused by Staphylococcus aureus. It is an indurated tender swelling appears which later on becomes separated. It may spontaneously break down, discharging pus and leaving multiple sieve-like openings and ashy grey slough. Later, the openings coalesce, leaving an excavated ulcer. Considerable constitutional symptoms occur. Coming to treatment, a large cruciate incision is made extending up to the margin of the inflammatory zone. Sloughs should be cleared with a piece of gauze. 4 skin flaps are excised. Wound is covered with a Vaseline gauze. Based on the cultural and sensitivity reports, antibiotics is administered. Next complication is balanitis. Balanitis is an inflammation of glans penis. Most common cause is the poor hygiene of an uncircumcised penis. Diabetes may cause balanitis. More likely, the increased glucose on the skin can stimulate bacterial and fungal growth. Treatment is dorsal slit followed by circumcision. Coming to diabetic foot, let's see what is a diabetic foot ulcer. Diabetic foot ulcer, it is an open sore or wound that occurs in approximately 15% of patients with diabetes, commonly located on the bottom of the foot. Diabetes is a leading cause of non-traumatic lower extremity amputations. This is a picture of diabetic foot with ulcer. Causes: ulcers form due to poor circulation, foot deformities, friction or pressure, trauma, duration of diabetes. Patients can develop neuropathy. It often occurs without pain and one may not be even aware of the problem. Signs are changes in skin color, changes in temperature, swelling in the foot or ankle, pain, open sores in the feet which are draining, ingrown toenails, corn or calluses, dry cracks in the skin, especially around the heel region. Coming to the classification and staging, this is the Wagner's classification of diabetic ulcer. Grade 0 is intact skin, that is impending ulcer. Grade 1 is superficial. Grade 2, deep to tendon bone or ligament. Grade 3 is osteomyelitis. And grade 4, gangrene of toes or forefoot. And grade 5 is gangrene of the entire foot. Next is the complications, skin and bone infections, that is osteomyelitis, pyogenic infection of the bone, and abscess, as I mentioned earlier. Some infections eat into bones or tissues and create a pocket of pus called an abscess. The common treatment is to drain the abscess. It may require removal of some bone or tissue. Gangrene, diabetes affects the blood vessels that supply fingers and toes. When blood flow is cut off, tissue can die. Next complication is deformities. Nerve damage can weaken the muscles in the feet and lead to problems like hammer toes, claw feet, or pes cavus, prominent metatarsal heads. Next complication is charcot foot. It is one of the rare complications, but one of the serious one. It affects the bones, joints, and soft tissues of the foot or ankle. The bones become weak and can break, and the joints in the foot or ankle can dislocate. This is the picture of a diabetic foot with gangrene. Diabetic gangrene causes are sugar-laden tissue or diabetes. This lowers resistance to infection. Atherosclerotic changes of the arteries, especially in lower limb of popliteal arteries and its branches, are more prone to arterial occlusion. Diabetic neuropathy impairs sensation and thus involves the lower limb to more injuries and infections. Clinical features, two types, dry gangrene and wet one. Dry gangrene usually seen in old diabetic patients and wet gangrene seen in young diabetic patients. This is the difference between dry gangrene and wet gangrene. Coming to diagnosis and treatment, the faster the healing, the less chance for infection. Prevention of infection, taking the pressure of the area called offloading, removing dead skin and tissue called debridement, applying medication or dressings to the ulcer, managing blood glucose and other health-related problems. Risk factors are smoking, alcohol consumption, high cholesterol, elevated blood glucose. Management of diabetic wound, remove callus, wound drainage, give rest to ulcer by immobilization and application of plaster cast. Infections are treated by wound debridement, institution of proper antibiotic, multiple insulin injections to achieve good control of blood glucose, exercise, cessation of smoking. Attempt to convert wet gangrene to a dry one by repeated dressings and proper antibiotics. Once gangrene sets in, decide for amputation. Wound debridement, process of removing dead tissues from the wound. These four factors helps in the wound management. That is time, T for tissue management, I for inflammation and infection control, M for moisture balance, and E for epithelial or edge advancement. Coming to amputation, it is the excision of the part of the limb or a limb as a whole as a life-saving or limb-saving process. There are two types of amputations, open method or guillotine method. All of the tissues from the skin to the bone are cut at the level of the ankle without creating flaps of soft tissue. Next is closed method or flap method. It is of three types, circular, semicircular, and oval. These are the guillotine amputation. These are the flap type amputation. Prevention, proper foot care, wearing of correct footwear, regular foot inspection, avoid walking barefoot, avoid using worn-out footwear. Gold standard of wound care, lowering blood sugar, appropriate debridement of wounds, treating any infection, reducing friction and pressure, restoring adequate blood flow. Thank you.
Thank you, Doctor. Next, I invite Dr. Jeenu for the paper presentation. Dr. Jeenu.
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Is it visible, sir?
Yes, Doctor. Visible. Please start, Doctor.
Okay. Good evening, everybody. Myself, Dr. Jeenu Kamboj, PG Scholar, Department of the PANCHAKARMA. My topic is Concept Evaluation on Working Principle of Neurobusti Dravya Absorption in Human Body. These are the content. Introduction. Bhakti Chikitsa is regarded as a prime treatment modality among the Panchakarma. It is having not only curative action, but also preventive and promotive action. It is the best treatment for alleviating the vata, as we have read in the Agra Dravya, Bhakti Vatharanam. Bhakti is defined as a procedure which expresses itself with its virya and prabhava. Those are beyond our thinking and effect. Among the three dosas, Vat is the prime dosa which has the capacity to move from one place to another. Vat is responsible for moving Pitta and Kapha from one place to other. Therefore, it is responsible for all the diseases, either the Shasagata, Koshgata, Marmgata, Urdhvagata, Adogata, Sarva Avedata. Basti is considered as the most important treatment for the Vata, so Basti is considered as Chikitsa. When we administer Basti, it reaches first to the Kati Pradesha, then Nabhi Pradesha, then Tukti, and then the Parshva. From these areas, the virya of the Basti reaches all over the body and turn the dosha samgatan and eliminate the vitiated doshas along with the puri. Basti exerts its action mainly by the pH, endoclonic, and chronic, diaclonic. Endoclonic is action inside the colon, and chronic is action on the tissues of the colon, and diaclonic is the systemic action. There are different types of the Basti. We have red, like the Niru Basti, Anuvasan Basti, and the Utta Basti. Here we'll discuss only about the Niru Basti. It is in this, Kasai is the main content. It is the one in which medicated decoctions are inserted into the anal canal by the Basti. Nowadays, we are using the rubber catheter. The essential and the commonly used ingredients are the Kasai, Madhu, Sandal, Snake, and the Kal. Masters, cheese, smooth amlakanji. They're also used as a vap dravya to alter the quantity, quality, and the action of the Basti. Various Niru yogas in specific diseases, like the Chandanadi Niru Basti in ATISAR, Rasnadi Niru Basti in Pranesh, Mustadi Yapan Basti in Unmad, Eran Muladi Niru Basti in Nadman. Many are given in the classics. To understand the mode of the action, we understand in different ways. When the Basti we administer, it first reaches to the Pakwatya, which is the main seat of the Vata dosha and destroys the Vata dosha, and which is the originator of all the diseases. By subsiding the Vata, all the diseases located in other parts of the body also become pacified. Just like cutting the roots of a plant, the stem, branches, sprouts, fruits, leaves, etc. also get destroyed. So in 3 ways we'll discuss. By first, the action of the Basti Dravya. Second, according to the Ayurvedic classics. And third, by the modern aspect, absorption of the Basti Dravya. First, by the action of the Basti Dravya, essential Dravyas we have already done. First is the Sandal. We already know that Sandal has different gunas like the Suksam Guna, Tiksham Guna, Snigdha Guna. By the Suksam Guna, it reaches up to the micro channel of the body. By the Tiksham Guna, it breaks down the morbid mala and the dosh sangati. And with the Snigdha Guna, it liquefies the dosha. So the presence of the sodium in the Basti Dravya may play an important role for the drug absorption of the drug as the sodium channel. Then we'll come to the Madhu. We already know that it has rich in various minerals like the antioxidants. It makes a homogeneous mixture with the sandalwood. It acts like an appropriate vehicle for the other substance in the Basti content, which it acts as a platform for the other drugs. Then coming to the Sneh medicated Telam Zritam, that has the property Snigdha Guna, which increases the permeability of the cell membrane and becomes helpful in elimination of the dosha and mala. By its Guru Snigdha Guna, it liquefies the dosha and breaks down the compact mala. Therefore, it reduces the Vata Dishti, softens microchannels, destroys the compact mala, and remove the obstruction of the channel. Then, apart from all these functions, it also protects the mucous membrane from untoward effect of irritating drugs in the Basti Dravya. Coming to the Kalka, Swat, and the Vapa Dravya, they are the main constituents of the Basti Dravya. They serve the function of the Utlation, Doshaharan, Saman. Selection is on the basis of the dosha, and Srotism. The main action is Samprapti Vidhatan of the Roga. Then coming to second point, according to the Ayurvedic classic, different similes has been beautifully explained in the classics, which are the easy way to understand the mode of the action. First given as sun located high in the sky dries up the moisture of the earth. In the same fashion, the sea situated in the Pakwasya due to its tension draws the doshas present in the body. Second one we have is, just as the tree irrigated with water at the roots changes old blue leaves into the beautiful tender leaves during the course of the time, roots produce flowers on the fruit. Similarly, a person changes by administration of the untreated type of the medicated anemia. The third one we have is, when a cloth is immersed in the water mixed with a dye, the cloth will take the color of the dye only from the water. Like that, the given Basti will take out the vitiated dosas from the body. This is the Basti Karmasta given according to the Vidhya Bhagavad. First, the virya of the Basti will will be reached into the Apan Vayu, nourishes there, then to the Saman Vayu, then to the Vyan Vayu, Udan Vayu, Prana Vayu, and here then the normalcy of the pit and the kapha. Then the cervicerid portion. Absorption and influence of the Basti mechanism that can be understood as the three absorption mechanisms to the enteric nervous system and to the system biology theory. Absorption of the mechanism that we can understand in the four ways: drug absorption mechanism, to the electrolyte mechanism, fat absorption, influence on the bacterial flora. This is the anatomy of the rectum to understand the mode of action. The drugs absorbed here are drained by the submucous venous flexure, which we already seen in this picture. They are drained further by the rectal vein and then to the superior rectal vein, middle rectal vein, and inferior rectal vein. From the superior rectal vein, it reaches to the portal vein, then to the liver, and from the middle and inferior rectal vein, it reaches to the internal iliac vein, and then to the inferior vena cava, then to the whole system circulation. The nervous system that can be divided into three parts: CNS, ANS, and ENS. It consists of the brain and spinal cord. It consists of organs that are innervated by the sympathetic and parasympathetic, and ENS. It is a separate. It is a separate entity which controls the activity of the gastrointestinal tract, including the stomach and the intestine. ANS has an independent nature. This we can understand as gastrointestinal tract is under the control of the sympathetic and the parasympathetic control. For example, during sympathetic nervous system activity, digestion is slowed, while the vagal nerve stimulation, parasympathetic nervous system activation increases the digestion. However, it was found that the stimulation of the enteric nervous system can change the gastrointestinal activity independent of the autonomic nervous system activity. Then third, we have the system biology theory. This term is used to describe a number of the trends in the bioscience research. This theory believes that all the organs are interconnected at molecular level. Any molecular incident is transformed at cellular level, then tissue level, and ultimately at organ level. But whatever the effects of the Basti are on the gastrointestinal system, it will definitely affect another system and helps to get the bodily internal homeostasis. Conclusion: Basti is the most important form in the Panchakarma, as it is phrased as a Ardhachikitsa and its multiple effects. The mode of action of the Basti is more complicated and very difficult to explain with the available most modern technologies, but our classics explained it in a simplified language with a certain beautiful simile. Although the rectum is not a usual site for absorption of the ingested nutrients, drugs absorbed by rectum may be absorbed here. Thus, drugs introduced by this route may have systemic effects as well as local effects. The water-soluble substances may be easily absorbed as the water moves in both the directions across the mucous membrane of the small and large intestine. As short-chain fatty acids are also absorbed from the colon mucosa under the effect of medication can be made to absorb the unusual substances also. As the organs related to the Basti karma are the mind, it can be inferred as one of the reasons for the mode of action of the Basti. Nadi and its relevance in Ayurveda may be another reason for the systemic action of Basti karma. We can only postulate certain hypotheses about the mode of action of the Basti. It may be absorptive mechanism, neural stimulation, chemical or mechanical stimulation. Thank you.
Thank you, Doctor. Next, I invite Dr. Nayana for the paper presentation. Dr. Nayana, are you there?
Yeah.
Okay, Doctor. Please share the screen, Doctor.
One minute.
Okay, Doctor. Doctor, you have any problem with screen sharing, Doctor?
Is it visible?
Not visible, Doctor.
Okay. Now,
Yes, Doctor. Now visible.
Good evening. Myself, Dr. Nayana, second year PG scholar from the Department of Prasantra and Sriroga. My topic is impact of diabetes mellitus on hypothalamo-pituitary-ovarian axis. The contents are diabetes mellitus and pathophysiology, insulin mechanism, insulin resistance, HPO axis and hormones, type 1 diabetes mellitus and HPO axis, type 2 diabetes mellitus and HPO axis, risk factors. Introduction. Diabetes is a chronic metabolic disease characterized by the elevated blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. The name diabetes mellitus was coined by Thomas Willis, who discovered sweetness of urine in 1674. Diabetes means to pass through, mellitus is honey. The three etiologies are genetics, lifestyle, and environmental factors. The triad of diabetes mellitus are polyuria, polydipsia, and polyphagia. What is diabetes mellitus? Diabetes is caused due to either the pancreas not producing enough insulin or the cells of the body not responding properly into the insulin produced. There are three types of diabetes mellitus: type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes mellitus. Pathophysiology. General. Insulin is the principal hormone that regulates the uptake of glucose from the blood into cells of the body, especially liver, adipose tissue, and muscles. Therefore, deficiency of insulin or insensitivity of its receptors plays a central role in all forms of diabetes mellitus. The body obtains glucose from the three main places. First one is the intestinal absorption of food, the breakdown of glycogen, the storage form of glucose found in the liver, gluconeogenesis. Insulin and the mechanism of action. Insulin is a peptide hormone secreted by beta cells of pancreatic islets of Langerhans. Functions are: it inhibits the breakdown of glycogen or process of gluconeogenesis. It can stimulate the transport of glucose into fat and muscle cells. It can stimulate the storage of glucose in the form of glycogen. Insulin resistance. Definition. Insulin resistance is the decreased ability to peripheral tissues to respond to insulin. The causes are genetics, obesity, hyperglycemia, age, and medications. Hypothalamo-pituitary-ovarian axis. At the level of hypothalamus, GnRH activates the anterior pituitary, thereby release the gonadotropins like FSH and LH. After the follicular phase, estradiol together with inhibin gives negative feedback to hypothalamus to suppress the FSH. Ovulation occurs by the release of LH surged by positive feedback of ovary. Corpus luteum regression takes place in the luteal phase. Progesterone will help in the growth of endometrial lining, later proceeds to menstruation in the absence of fertilization. Diabetes mellitus and reproductive health. Type 1 diabetes mellitus. It causes delay in puberty, menstrual irregularities, early menopause. Type 2 diabetes mellitus. It causes menstrual irregularities, PCOS, premature ovarian failure, infertility. Type 1 diabetes mellitus and puberty. Insulin and leptin are metabolic factors circulating in the periphery which participate in the hypothalamic control of metabolism and reproduction. In normal individual, fasting and postprandial insulin concentration reach a peak in the mid to late puberty. In mid-puberty, insulin sensitivity decreases by 30% compared to pre-pubertal and adult subjects. In insulin-dependent diabetes mellitus, increasing insulin resistance much greater than normal at all stages of puberty. It may lead to delayed menarche. Diabetes mellitus with low BMI are more likely to have menstrual irregularities. There are catabolic processes in young diabetic girls, and nutritional restrictions lead to intracellular starvation. It will lead to disruption in the hypothalamic pulsatil secretion of GnRH, resulting in decreasing in gonadotropin secretion and delay in menarche. Type 1 diabetes mellitus and reproductive age. Insulin, when we are giving insulin to prevent diabetes complications, it will lead to increase in insulin in the body, hyperandrogenism, insulin resistance, increase in LH to FSH ratio, later by anovulation. Insulin resistance and ovarian factors. Insulin stimulates androgen secretion via insulin and insulin-like growth factor 1 receptors on cells. LHSR enhances this phenomenon. Insulin also enhances follicular development and ovarian steroidogenesis via insulin receptors in granulosa cells. thereby the growth of pre-ovulatory follicles. It suppresses the apoptosis and atresia in ovarian growth and eventual cyst formation. Type 1 diabetes mellitus and menopause. Type 1 diabetes may be associated with higher incidence of premature menopause. Causes are anti-ovarian antibodies, prolonged hyperglycemia, hyperandrogenism. Pathophysiology of type 2 diabetes mellitus in HPO axis. Type 2 diabetes mellitus leads to insulin resistance, thereby hyperinsulinemia, altered level of IGF-1 and IGF-1 and SHBG. Stimulates increased androgen secretion at the adrenal gland and ovary. It will lead to anovulation or hypoandrogenism. These are the risk factors of diabetes mellitus. Obesity. Adipocytes contain aromatics that both assist in the production of conversion of steroid hormones, mainly androgen and estrogen, thereby early menarche. Obesity decreases LH, leading to impaired luteal phase. Leptin is the adipokine secreted primarily by adipose tissue. It acts to stimulate energy expenditure and suppresses appetite via signaling at the level of hypothalamus. Leptin has a permissive action for pubertal progression. Hyperleptinemia, it will lead to early menarche. Hypoleptinemia leads to delayed menarche. Why menstruating women are safe? Most of the diabetic female patients are postmenopausal women. Women are least affected by the systemic illness during their reproductive age. In women having regular menstruation, it will maintain the lipid profile by reducing LDL cholesterol and increasing the level of HDL cholesterol for the process of steroidogenesis. Relaxes blood vessels and normalizes the blood flow. Reduces the risk of heart diseases, hypertension, and stroke. These are the articles I quoted for this presentation. Conclusion. HPO axis is the regulating system of woman reproductive health. Any alternation in this regulation lead to menstrual irregularities, later leading to the disease like diabetes mellitus and vice versa. Insulin resistance is the main cause of diabetes mellitus. Proper diet and exercise with a healthy mental status will keep these risk factors away. Thank you.
Thank you, Doctor. Next, I invite Dr. Drakshani Shanawat for the paper presentation. Dr. Drakshani Shanawat, are you there? Dr. Drakshani Shanawat, are you there? Okay, next I invite Dr. Adira Singh for the paper presentation. Dr. Adira, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Okay, sir. Is my screen visible, sir?
Yes, Doctor. Please chat, Doctor.
Very good evening to one and all. I'm Dr. Adira Singh, second year PG scholar, guided by Dr. Gopi Krishna as professor, Department of Roganidana and Vikriti Vijnana, SDM College of Ayurveda and Hospital, Hassan, Karnataka. Today, the topic of my presentation will be critical analysis of the concept of Roga Marga. So, Roga Marga, as we know, is made up of two words, Roga and Marga, from the dhatus Ruch and Mrich, meaning breaking up of strength of channel and passage. The occurrence, progression, and recurrence of Vyadhis can be described through Roga Marga. And as the classic says in the Trisreshani Adhyaya, it is of three types, Bahya, Abhyantara, and Marmasti Sandhigata Roga Marga. And Acharyas have correctly described the structures and also the diseases that come under each Roga Marga specifically. Now, today we'll be seeing how we can analyze this in the contemporary science. So there's a concept called as compartmentalization. The reference goes from Guyton's physiology. So according to this, the body can be divided into 4 different compartments. That is alimentary tract or gastrointestinal tract, intravascular compartment, interstitial compartment, and intracellular compartment. We'll see one by one. First is the alimentary tract, which starts from mouth to anus, fragmented into several compartments by sphincters. And the food that we intake goes from pharynx to stomach within seconds, and it is stored in the stomach for about 2 hours. Chyme takes about 6 hours to reach the cecum. And through this process, the non-absorbable macromolecules are converted into absorbable micromolecules. And after this, it enters the intravascular compartment by either the capillaries or through the lymphatics, depending upon the size of the molecules. So the next is thereby from alimentary tract, it gets transferred to intravascular compartment. Intravascular compartment is where the transfer of nutrients takes place. Through capillaries, it enters the liver, and then from there through inferior vena cava to the heart, and then capillaries. If the molecules are large enough, like proteins and chylomicrons, then they enter the lymphatics through thoracic duct and then bloodstream at the junction of left jugular vein and left subclavian vein. And from there, through superior vena cava, it enters the heart and then again to the capillaries. And from here, the next compartment, it enters the next compartment, that is interstitial compartment. What is this interstitial compartment? It's the fluid in between the group of cells. This compartment receives nutrients from intravascular compartment and sends to the interior of the cells. And from there, it sends back the metabolites from inside of the cells to the interstitial fluid. So thereby from interstitial compartment, next is the intracellular compartment. It is a fluid portion present inside every cell. Contains various micronutrients, electrolytes, and cell organelles. Now, let us see the pathophysiological events that take place. When any heavy food or food that is difficult to digest is taken, then there's impairment of digestive fire, and thereby it will lead to proliferation of microorganisms. And when there's proliferation of microorganisms, initiation of inflammatory reactions takes place, and there's formation of antigens. But since there's loss of appetite, the digestive enzymes will not be in their active form. And if they're not in their active form, the denaturing of antigens will be restricted to an extent. And if that is restricted, it will cause damage to the alimentary mucosa. And thereby, complete digestion of food does not take place, and partially digested food will be transferred into the interstitial space of gastrointestinal lumen. How does the mechanism of manifestation of disease takes place? These antigens from the interstitial space travel through the lymphatics and enters the bloodstream. From the bloodstream, it circulates all over the body till the capillaries at various parts of the body and enters the interstitial compartment. Further, it moves into intracellular compartment and produces different signs and symptoms. Critical analysis. Now we'll see how we can correlate this Roga Marga, what can be correlated. The alimentary tract compartment can be considered as Mahasrotas, that is the Koshta or Abhyantara Roga Marga extending from mouth to anus. Capillaries of GIT extending till the capillaries of cardiovascular system. That is the intravascular, interstitial, and intracellular compartments outside the bones and except the bones and joints can be considered as Marga containing Raktadi Dhatus and Twak. That is the Bahya Roga Marga. The intravascular, interstitial, and intracellular compartments inside the bones and joints can be taken as Marmasti Sandhigata or Madhyama Roga Marga. Discussion. Understanding Roga Marga in terms of compartmentalization opens newer horizons in understanding how the different processes involved in Shodhana Chikitsa might be affecting different compartments in order for the elimination of vitiated doshas from the body. We'll see. Deepana Pachana. So starting Shodhana Karma starts with Deepana Pachana, and Deepana Pachana, the action can be taken as Ama Pachana in the Koshta. How can we understand this? This can be understood as the digestion of undigested food particles in the mucus coated layer in the alimentary compartment. Next is Snehapana, which softens the mucus layer of GIT for easy movement of the particles. Coming to Bahya Snehana with procedures like Abhyanga, softens the intracellular layer and creates an easy media for transportation of substances across the interstitial, intravascular compartments and then into the GIT. Action of Swedana can be understood as liquefaction of the added substances in the intracellular compartment and facilitating their movement into interstitial compartment and then into intravascular, from where it enters the alimentary tract and gets eliminated out of the body. So when we consider the Sadhya Sadhyata, in classics it's mentioned that Bahya Roga Marga is considered as Sadhya. Why so? Easy penetration of prophylactic drugs through intravascular, interstitial and intracellular compartments explain the easy curability of diseases affecting these compartments. Madhyama Roga Marga is considered to be Kritra Sadhya. Penetration of drugs through these compartments, that is outside of the bones and inside the bones and other hard tissues, are comparatively difficult, thus leading to bad prognosis. Next is the Abhyantara Roga Marga. It's considered as Sukha Sadhya, Kritra Sadhya, Yapi or Asadhya according to the Roga Lakshanas, explaining prognosis of diseases affecting alimentary tract depends on the severity of the disease. Conclusion. While the concept of Roga Marga showcases the wide array of disease pathologies, different compartments makes the picture even more clear. Understanding the mechanism of manifestation of diseases as mentioned in our classics and in contemporary science, analysis of both makes the decoding pathophysiology much easier, allowing for ideal planning of treatment. Thank you.
Thank you, Dr. Adira. Next, I invite Dr. Gopal Shaharam Lohande for the paper presentation.
Hello.
Hello.
Can you hear me, sir?
Yes, doctor. Please share the screen, doctor.
Hello, myself Dr. Gopal Lokhande, PG second year student. The topic is a review on recent advantages in the management of fistula in ano, a disease in which deformity in the around baga, mainly pubic region, perineum and genital area, Buddha, anal region and basti is called the bagandara. When the blister remains unpaired, it is called pidika. When the same get separated, it will be called bagandara. Study shows that the prevalence of fistula in ano is 8.6 cases per 1 lakh population. In men, the prevalence is 12.3 cases per 1 lakh population, and in women, it is 5.6 cases per 1 lakh population. Goal of treatment of bagandara is preserving anal functions, permanently eliminate abscess formation, and to promote active healing. Fistula surgery is most common cause of fecal incontinence. To avoid these complications, new methods of surgery adapted all over the world. Aim to evaluate the literature regarding recent advantages in the management of fistula in ano. Objective to review available literature regarding fistula in ano and its management. To study the detailed literature regarding fistula in ano in classical texts and in modern science. Methodology. Various classical and modern literature are searched to review the different surgical and parasurgical procedures used for treatment of bagandara, fistula in ano. Ancient methods of surgery of bagandara, fistula in ano. Shruta mentioned chavan as a treatment of bagandara. Shataponak bagandara. The Langalaka, Ardha Langalak, Sarvatobhadra and the Gotirtha forms of incisions should be different shapes incision in case of multiple opening Shataponaka. Paristravi Bagandara. The incision should be made in the shape of lip of the dead palm, Ardha Chandra, half moon, moon's disc, and the needle's mouth, or with the downward mouth. After that, the ulcer should be purified with mild cleaning and disinfecting the remains like Anutela, Yavakarma, and etc. Shar Sutra therapy. Shar Sutra therapy is a simple and safe minimum invasive parasurgical technique for treatment of fistula in ano. Described in ancient classicals of Ayurveda is being participated as a primary method of treatment in all types of fistula in ano, including complex and recurrent fistula. Shar Sutra is a unique medical set-on helps in both cutting as well as drainage of fistula tract. It is an alkaline base. It may pH is 9.4. Recent method of surgery in Ayurveda, IPTA, interruptions of fistula tract with the application of Shar Sutra. The novel technique of IPTA for the treatment of fistula in ano is a modified technique of Shar Sutra therapy. This technique is being participated in the treating all type of fistula, including complex and recurrent fistula. In this technique, interceptions of proximal part of fistula tract is done at intrasphincteric plane along with application of Shar Sutra from the site of infections to the infected crypt in the anal canal. This technique is aimed to eradicate the infected anal crypt without damage to anal sphincters by using Shar Sutra. Methods of surgery according to modern science, fistulotomy. It is applied mainly in the intrasphincteric fistula and transsphincteric fistula involving less than 30% of the voluntary musculature. The goal of the fistulotomy is to prevent the recurrence of perineal sepsis while minimizing dispersions of sphincters, morphology and functions. Fistulectomy. Excision of the fistula or fistulotomy was to be satisfactory method for treatment of fistula in ano. Its use is no longer recommended. Larger wounds are created significantly. Prolonged wound healing create a greater separation of muscles and occurs, and there is great risk of injury or accident underlying muscles. thereby increasing the risk of incontinence. Recent methods of surgery according to modern science. Seton. The seton is used to drain pus, allow stage division and deliberately cut through the sphincters. The problem of preserving anal incontinence and treating the fistula is more complicated, even managing high transsphincteric fistula. If the tract is seen to cross the sphincter's muscle at the high level, the use of lay open technique is combination with insertions of seton is safer. This allows the tract to become more superficial, converting a high fistula into a low one. Ligation of intrasphincteric fistula tract means lip technique. The outer opening is cannulated with an injecting catheter and hydrogen peroxide is instilled. One identification the internal opening within the anal canal, a probe is placed from outside in the left in place. A curvilinear small incision is made over the intrasphincteric groove between the internal and external sphincters, and the plane is advanced to the fistula tract without dividing any of the sphincter muscles. The tract is then debrided or scraped from the internal opening and the external opening gently to get rid of inflammatory tissue. The tract is then divided into the intrasphincteric groove by choose to the internal opening and from outside along the external portion of the tract. The fistula is then divided between ties. The internal opening is then sutured closed. The external opening is left open to dry. Video assisted anal fistula treatment means WAP. Correctly located the internal fistula opening and possibly secondary tracts or abscess cavitated. The anal canal is held open using a speculum, and irrigation solution is used to give a clear view of the fistula tract. Light from the fistuloscope can be seen from outside the anal canal at the location of internal opening of the fistula. The surgeon uses the unipolar electrode under video guidance to cauterize material in the fistula tract. Necrotic materials is removed at the same time using the fistula brush and forceps, as well as by continuous irrigations. Internal opening is closed from inside the anal canal using the stitch and staplers. Result and conclusion. The advanced surgical techniques used in Bhagandara to overcome the demerits of previous surgical procedures. After referring various ancient textbooks and modern books, the various treatment methods of parasurgical and surgical procedure are effective with minimal complications and recurrence with early recovery of patient. Each procedure has its own merits and demerits applicable in different type of fistulae. In modern, according to review of literature regarding Bhagandara, disease is described is notorious disease because after surgery like ancient methods, fistulotomy, its main complications develop are large wound, long period of wound healing, recurrence and incontinence. Hence, nowadays overcome the above drawbacks, new treatment methods, surgical procedures are available. In Ayurvedic Shar Sutra therapy, the level of action of time duration of this technique to heal fistula tract varies from 4 weeks to 8 weeks and act by cutting and healing the tract simultaneously. IPTAG is modified technique of Shar Sutra therapy for long tract fistula in ano. As it is said, cost effective, less time taken in wound healing, minimum scarring of tissue, minimum changes of fecal incontinence, and successful treatment of fistula in ano with minimum chances of recurrence. In modern science, cutting seton are effective in treating complex fistula in ano, including those that have failed to respond from other forms of surgery. It avoids preliminary internal sphincterectomy, may prevent deteriorations of incontinence. The intrasphincteric ligation technique of the fistula tract is done at intrasphincteric groove, hence it prevents both internal and external anal sphincters, which avoids fecal incontinence. The WAP technique performed under direct vision, which helps to identify possible secondary tract.
Hello, doctor.
Yes.
You are exceeding the time limit, doctor. Can you speed up your presentation?
Okay, so chronic abscess. This technique is splinter saving and surgical wounds are small. The techniques described here are the modifications of classical procedure which acts as a different level and procedure intended effect of healing the fistulous tract with reduced complications and recurrence. The new techniques are effective in the managing Magandhara fistulae ano. Thank you.
Thank you, Doctor. Next, I invite Dr. Kriti Deepak Kumar Patel for the paper presentation. Dr. Kriti Deepak Kumar Patel, are you there?
Yes, sir, I'm there.
Okay, Doctor. Please share the screen, Doctor.
Yeah, is it visible?
Not visible, Doctor.
If you have is it visible now?
Yes, Doctor, visible. Please start, Doctor.
Yes. Good evening, one and all present over here. Myself, Dr. Kriti Patel, second year PG scholar, Department of Dravya Guna from Parul Institute of Ayurveda. My presentation topic is critical analysis on Guru Guna and its utility in Chikitsa. Indian philosophy and Ayurvedic treatises were contemporary composition, hence the influence of philosophical principles certainly reflected on Ayurveda, in addition to the principles of Ayurveda its own. Ayurveda adopted and modified philosophical ideas from darshanas for understanding and supporting its own concepts. In Charaka, it is said that Guna remains samavayi with the Dravya, it is nischeshta and is akarana. 20 Guruvadi Gunas are mentioned in Ayurveda. Guru Guna is first described under Guruvadi Guna. In the original Samhitas, the word Guru is derived from the Sanskrit root Gru Girane. A quality which is responsible for heaviness or gravity is called Guru. Acharyas defines Guru Guna as a property due to which substance able to cause Brahmana in the body, cause nourishment like Varaha, cause Sadha, Upalepa, Tarpana in the body. Cause Dehavriddhi, pacifies Vata, does pushti of body, increases Shleshma responsible for Chirapaka, is opposite to Lagu property and is natural property of Prithvi and Up Mahabhut. Concept of Gurutva. Gurutva is the cause of Brahmana and Tarpana. Brahmana is due to Guruta of Dravya and is the action of Prithvi Mahabhut. Brahmana is of two types. One, Sharirik, in which Dehavriddhi is caused, that is Mamsam Brahmaniyana. Second, Manasika, in which nourishment of mana is caused, for example, Vidhya Brahmanyana. Tarpana is the guna of Tripti, which is the action of Jala Mahabhut. Relation of Dosha, Dhatu, Mala and Guru Guna. The Adhisthana and Guru. Dosha, Kapha, Dhatu, Rasa, Rakta, Mamsa, Meda, Majja and Shukra. Mala, Purisha, Rasa, Madhur, Kashaya and Lavan. Guna, Manda, Sthira, Shlakshna. Due to the Ekartha Samavaya Sambandha. Virya, Shita, Vipak, Madhur, Karma, Brahmana and Tarpana. Physiological role of Guru Guna. The Guru Guna in the body executes various forms of karmas which are very much helpful for the functional assessment of the Guna. Guru Guna increases Kapha and pacifies Vata. It does Brahmana of Dhatus. It is responsible for the weight gain and nourishment of the body. It does Malavritti and produces Upalepa in the Shrotas. As Virejana Dravyas are Guru, it brings Mala in downward direction. It decreases the Agni and further causes Chirapaka. It causes Glani and Shaithilata in the body. Guru Guna does various karmas like Brahmana, Balakrit, Tarpan, Gaurav, Shthairya, Samghata, Upachaya, Purana, Vajikarana, Samsleshana. Pathological role of Guru Guna. According to Acharya Charaka, Ati Sevana of Guru is the cause of Santarpanajanya Vyadhi. Guru Guna is included in the list of Rasavaha Shroto Dushti Hetu. By Rasavaha Shroto Dushti, it can be the cause of various diseases like Ashraddha, Aruchi, Asyavirasya, and so on. Guru Guna is also included in the list of Mamsavaha Shroto Dushti Hetu, and by Mamsavaha Shroto Dushti can be the cause of Adhimamsa, Mamsar, Buddha, etc. Discussion. Knowledge of the fundamental principles of Ayurveda is essential to find out appropriate hetu, to decide types of dosha dusha involved, to diagnose the disease, to select appropriate drug for the treatment. Out of various principles, guna is most important, primary theory for prevention, diagnosis and management of disease. The term guna has utility in understanding the body constituents as well as to recognize and assess the drug action. Treatment principles of Guru Guna in Chikitsa. Prithvi and Jala are the two factors which are responsible for the increase in Gurutva. Hence, in the Rasavaha Shroto Dishtis, like Aruchi, Gaurava, Tandra, and so on, where mainly Kapha dosha gets increased, Dravyas like Lagu, Ushna, Tikshna, Vishada, and Sara properties can be given. Dravyas like Indrayava, Patola, Katuki can be given in this condition. In the Mamsavaha Shroto Dishtis like Kanda, Kandamala, etc., Dravyas having Tikshna, Ushna, Sukshma, Lagu properties can be given. For example, Nimba, Patola, Triphala, Mridvika, Musta, Kushta can be given in this condition. Indications of Guru Guna: person who is emaciated, injured, old-aged, who have less strength, who is habituated of daily access walking, who indulges regularly in sexual activities and alcohol consumption. In Grishma Ritu, person who is having Shosha, Arsha, Grani and have Karshana due to any disease in Vataja Vikaras. Guru Guna in Ahar. Guru Dravya should be taken in Arthas of Vidya. In Hemanta and Shishir Ritu, Ahara which are Matra Guru, Dravya Guru and Sabhava Guru should be taken. Guru Ahara examples are like Sharkara, Kshira, Sarpi, Mamsa, etc. Godhuma, Masha, Matsya, Trapusha, Ervaruka, Alabu, Shringataka, Vidarikanta. Kharjura, Falgu, Talafala, Bhavya, Arukam, Madhura, Paravata, Narikel, Amrata, Tanka, Jambu, Shleshmatak, Vata, etc. Conclusion: among various principles explained in Ayurveda, Guru Guna is the most important primary theory for prevention, diagnosis, and management of many disorders. Guru Guna is involved as the cause in many disorders. Knowledge of Guru Guna as Hetu helps in Nidana Parivarjana, which is the first line of treatment. Guru Dravya has been indicated and contraindicated in several pathological conditions. Acharyas have given different treatment principles for treating the Guru Guna vitiated disorders. One should use them with the help of Yukti and Anumana. These are the references. Thank you.
Thank you, Doctor. Next, I invite Dr. Jagrati for the paper presentation.
Yes, sir. I will continue with this, sir.
Okay, Doctor.
Good evening, everyone. Myself, Dr. Jagrati Go, second year PG scholar, Department of Dravya Guna, Parul Institute of Ayurveda, Parul University. Introduction. Maturi Pivitstanya Yat Param Driha Vridhai. The baby gets nutrition from mother during pregnancy through Ahar Rasa. Hence, the breast milk produced by Ahar Rasa of mothers naturally acceptable to the baby. So, it is the only best food for the child. Acharya Shushruta has given more importance to psychological causes in Stanyakshay. Causes for cessation of milk production: absence of affection for child due to krodha, shoka, bhai, chinta, srama, langhan, etc., lack of sleep, lack of healthy balanced diet, less intake of water, disease condition like anemia, alcohol consumption, smoking consumption, etc. Now, these are the samprapti. Due to all Snidant factors, Rasa Dhatwagni Mandya and Rasa Dhatukshay, this leads to Stanyakshay or Stanyan Nasha. Now, these are the Ekal Dravya like Krishna Jirak, Mithika, Shwet Jirak, Mithika. Those are the pictures. Now, these are the Dravyas like Alabu, Shashtik, Ikshu, Tanduliyak, Shwet Jirak, Krishna Jirak, Shunthi, Yava, Godugdha, Mamsaras, Jivanti, Vidvika, Masha, Rajmasha, Vedmika, Karpas, Bija, Nishvapa. Now, these are the Ekal Dravyas or Ahara should be given to the Sutika. Now, why it should be prescribed, we're gonna discuss in discussion part. Now, Apanvayu plays a vital role in delivery of fetus. Due to labor pain in delivery, Shutika loses strength. Due to excessive bleeding and delivery of fetus causes aggravation of Vata. Rasa Dhatwagni gets Mandya and thus leads to Rasak Dhatukshay. Patyahara helps in rejuvenation process and reducing the all Dhatukshay, normalcy of Vata in Sutika. Maternal Ahar influences the nutritional composition of breast milk as well as production of milk. Ahar having nutritive value, being rich in carbohydrate, amino acid, iron, calcium, phosphorus should be given. Shashtik, Ikshu, Tandulia, Godugdha, Mamsa, etc. This Ahar having Madhu Rasa, Shita, Vidya, Madhu Vipaka, Guru, Snigdha Guna. This leads to Vata Pitta Shaman, Valya Brahman, Kapha Vardhak, Jivaniya Rasayan in Shrutika's body. Now, Shatapushpa, Mithika, Lasun, Alabu. This drug having the Lagu Guna Ushna Virya Katu Vipaka and having the property of Deepan Pachan, this leads to enhancement of the Dhatwagni of Rasa Dhatu. Now, Kafavardhak Ahar, Madhur Amla Lavan Rasayukt Ahar will help in increase the breast milk of Sutika. All these ahar help in improve Rasa Dhatu Agni to nourish Rasa Dhatu to increase the quality as well as quantity of Stanya. As Stanya is the Upadhatu of Rasa Dhatu, so Rasavardhak Ahar will benefit improvement of Stanya. Now, conclusion part is based upon the previous description. It can be concluded that Patyahar in Stanyajan and Kal plays a significant role to increase the breast milk, also enhance the quality and quantity of breast milk. There are also Stanya Shodhangan, Stanya Janangan, and many more Aushadhis to correct the Stanyakshay. But this Patyahar can be used daily in lactating women in Stanyakshay condition and also regain the body strength lost during pregnancy and labor. Thank you. So these are the references. Thank you so much.
Thank you, Doctor. Next, I invite Dr. Neha for the paper presentation.
Yes, am I audible?
Audible, Doctor.
Yeah, okay.
Your screen is visible,
Is it-
Doctor. Please start.
Okay, okay. Yes, so this is Dr. Neha Shivde, MD Scholar of Dravya Guna Vignan from Sumatibai Ayurveda Mahavidyalaya, Hadapsal, Pune. The topic of my presentation is Ayurvedic aspect of polycystic ovarian disease and syndrome. This is the outline of my presentation. We'll first introduce with PCOD and PCOS, the difference between both. Then modern aspect of PCOS. Then Artava and Rajotpatti, Apatarpana and Santarpanjanya Samprapti. Then importance of Medha Dhatu and Rakta Dhatu, and clinical features according to Ayurvedic aspect and treatment plan. So the most important thing is that we get confused between the disease and syndrome. So we'll deal with this now. So PCO is numerous cyst. Cyst is sac filled with fluid in ovaries. Here D stands for disease and S is for syndrome. So when the PCOD is combined with metabolic disorder, which can cause infertility, and then it is known as PCOS, that is polycystic ovarian syndrome. And the and the most important difference is in PCOD, we are having immature follicles, and in PCOS, no follicle development at all. Then clinical features of PCOS. The three important clinical features are elevated androgen levels, which leads to hirsutism and acne, alopecia, etc. Then menstrual irregularities. Yes.
Doctor, your slide is not moving, Doctor.
Okay. Now?
Not moving, Doctor.
Okay. Now?
Yes, Doctor. Now moving. Please continue, Doctor.
Yes. So clinical features of PCOS. First one is elevated androgen levels, which leads to hirsutism, acne, and alopecia. Then menstrual irregularities, that is amenorrhea, then or heavy bleeding during menses or dysmenorrhea. And ovarian cyst. This ovarian cyst is also of two types. First is morphological and then is biochemical. Morphological is polycystic ovarian pattern, and biochemical is due to hyperandrogenemia. Hyperandrogenemism is the clinical hallmark of PCOS, which we should remember. Then pathophysiology, Dr. Naina in previous few presentations, she explained hypothalamic pituitary axis defect, then what is insulin resistance and all. So I'm not going to in detail with this. The other thing which I want to highlight here is PCOS is also related with genetic disorder, and these are some genes which is related to PCOS. This is insulin resistance. I'm not going in detail. Yes, modern treatment plan is weight loss, anti-diabetic, mostly metformin is used. Then statins, hormonal replacement therapy, and laparoscopic ovarian drilling. The point which I want to highlight here is this intervention destroys androgen producing tissues, which should lead to androgen levels. Yeah, so 70% of the PCOS women are obese, but we should not fail to get that 30% are of normal weight or underweight. Also in our science, we always deal with Santarpanjanya and Apatarpanjanya diseases. So we'll go with the Apatarpanjanya Samprapti of PCOS and then Santarpanjanya Samprapti of PCOS. Artha and Raja, we know that Artha or Raja, anyone is Upadhatu of Rasa. And so we should think of rasa in any of this samprapti. Apatarpanjanya samprapti, the most patients are krusha patients, and as we know that rasa raksham shramashosa glaniya shabda asahishnutta, which is rasakshay lakshana. And also Sushruta has stated that rasanimitta eva stholyam karsham cha. Then we'll go with the Santarpanjanya Samprapti. The main factor here is Kapha Meda Vardak Hetu 7. Then accumulation of Prithvi and Aap Mahabhut. We know that Panchabhutic composition of Meda Dhatu is Prithvi and Aap. So this Prithvi and Aap get accumulated in Artha Vas Strotas, and thus Strotorod, and thus the follicle is not developing properly. Importance of Meda Dhatu. Medava Sroto Dushti Lakshan includes Ashtavan Indit Purush and Stulan Krushar, few of them. Then also Sushruta states Rasanivittam Eva Stholyam Karsham Cha. And here in Tika of Dallanacharya, it is explained that that this is due to Dhatvagnir Abhipakadam. So from the above statement, it can be concluded that Stholya and Karsha are due to vitiation of Dhatvagni, and mostly Agni of Meda Dhatu, which vitiate Jataragni, and thus Rasa and further other Dhatvagnis. So this Samprapti is in Pratiloma Gati and vitiation of Rasa Dhatvagni and Dushti of Artha. So the symptoms are Anartha. Here is the Samprapti of Medorog. Then is importance of Rakta Dhatu. It is always we know that Artavam is Agneyam, and Sushruta in Shonita Varanini Adhyay, he has explained that Rasa Dhatu is from Tejo Bhutah. That is Samyak Parinatasya Tasya Tejo Bhutah Sara. That is Rasa Dhatu is also developed from Teja. So when Rasa is converted into Rakta Dhatu with the help of Ranjak Pitta, the byproduct is Raja, or we can say Artha, which is Yoni Pravritta Rakta. Here also it has explained that Stri Yoni Pravrittasya Rakta, that is Raja Sadnyam. Rutu Kalajam Raktameva Raja Sadnyam Uchate Ityartha. That is when in Rutu Kal, which the Raja, which is we can say menstrual bleeding, is Rakta. So Raja is nothing but Rakta only, but just because it is just a byproduct of Rasa Dhatu, we can say Upadhatu, and Rakta Dhatu is directly. So we should, in the treatment plan, we should think of Teja, Teja Mahabhut, and conversion of Rasa. Then clinical features will amenorrhea, dysmenorrhea, ovarian cyst, and hirsutism. So amenorrhea is the clinical feature which is due to apan dushti, improper artha nishkraman kriya. As we know that apan, the main functions of apan vayu are shroni pasti meteoricocha, shukra artha, shakrun mutra, garbha nishkraman kriya. So here artha is not properly nishkraman kriya is hampered. Then dysmenorrhea is dysmenorrhea due to vayu. Then ovarian cyst, accumulation of Prithvi and Aap constituents. As we know that Meda Dhatu is of Prithvi and Aapa Mahabhut Pradhan Dhatu. So partially development or no development of follicles, which is due to Prithvi and Aap Mahabhut. Then hirsutism. As we all know that Nakha and Rom are mala of Asti Dhatu, and involvement of Meda Dhatu, will hamper the proper nourishment of Asti Dhatu, and thus Asti Sar is formed Asti Sar is less than Asti Kitta, thus increasing formation of Asti Mala, which is Nakha and Roma. Then we'll go to the treatment plan. We should note that Apatarpanjanya Samprapti and Santarpanjanya Samprapti should treat differently, and we should rule out first that which one patient comes with Apatarpanjanya and which patient comes with Santarpanjanya. So in Apatarpanjanya, Bruhan Chikitsa is the most important thing. Then is Basti Chikitsa, we can use Tiktakshir Basti or any Bruhan Basti. Then Rasatarpaniya Chikitsa and Rasatirpaniya Chikitsa is most important thing. Here Madhura and Amla Rasa can be used. Madhura Rasa is Tarpan, Madhur Rasa is Tarpan, and Amla Rasa is Muda Vatanuloman. So this rasa should be this rasa should be given to the patient. Then Guru Snigdha Guna. So few drugs which I mentioned here are Vidrum, then Mandur, then Madhumalini Vasanta, which will help to develop Dhatvagni. then Narayani, Atmagupta, Ashwagandha. Then we should rule out stress factor. Stress factor is another main factor for PCOS, and we can use a drug Tapaswini, which is also Sneha Dravya. Then Vatanuloman Chikitsa is important. We can use Gruta, Erentus Neura Aragvat, and Rakta Prasadak Dravya. Other than this, we should rule out Krimi. So if Krimi is the thing, then we should treat separately. Then in Santarpanjanya Chikitsa, it's Karshan, then Vaman Virajan, Medogna Chikitsa, Guru and Pachan Dravya, Rasa Pachak and Meda Pachak. So as Rasa Dhatu is Upadhatu of Rasa, we should use Rasa Pachak to normalize the Rasa Dhatvagni and Meda Dhatvagni. So we can use Indraya, Patal, Chitra, Kirata Dikta, Shunthi, Musta, Guduchi, Vidanga, Raktachantan, Barun, and so on, many drugs. As per the Rasadravyas, Arogya Vardhini, then Labhu Malini Vasanta, Sud Shekhar, Chanda Prabha, and Punarnava Mandu, and Vatanuloman. So, yes, this is the treatment plan. Thank you.
Thank you, Doctor. So next I invite Dr. Vijay Raja. I invite Dr. Vijay Raja.
Hello, doctor. Hello.
Yes,
You're audible,
you're
doctor.
audible.
Is my skin visible, doctor?
Not visible, doctor.
Now, doctor?
Yes, doctor. Now visible, doctor.
Okay.
Please start, doctor.
Okay, sure. Thank you. Good morning, all. I am myself Dr. Vijay P, final year PG scholar, Department of Kaya Chikitsa, Amrita School of Ayurveda, is here to present a successful case report on gut microbiota modulation in IBS condition through our very own Grahani Roga treatment protocol. Before moving on to the exact disease proper, I would like to throw light on the historical relevance of gut. Hippocrates has been quoted as saying, "Death sits in the bowel, and bad digestion is the root cause of all evil" in 400 BC. This shows the importance of gut in human health, which has been recognized centuries before. This image shows the various factors which are involved in the pathophysiology of IBS, which includes chronic stress, depression, anxiety, disturbed gut-brain axis, dysfunctional microbiota, immune activation, visceral hypersensitivity, which altogether leads to abdominal pain or discomfort, bloating, and altered motility, which are seen as cardinal features of IBS. Starting with the core presentation by mentioning the patient details. So this 25-year-old female patient came to our OPD with the complaints of lower abdominal pain, loss of appetite, and alternative bowel habits, that is constipation and diarrheal patterns, since 6 months. She also complains of burning sensation during intake of spicy food items for the same time period. Next is history of present illness. So this 25-year-old female patient was apparently asymptomatic before 6 months. Gradually, she started experiencing burning sensation over throat after ingestion of food, aversion towards food, and faulty bowel habits, which increases during intake of spicy non-vegetarian food items. She also notices abdominal pain at the level of hypergastrium. It usually starts on morning time and relieves by defecation. Pain is of flicking type and it is not radiating nature. Pain aggravated by the intake of spicy non-vegetarian food items, and this pain is associated with altering bowel habits. Occasionally, the form or consistency of the stool are also varied. Sometimes the abdominal pain is very severe and it hampers the daily activities of the patient. So, for the above complaints, she visited Kaya Chikitsa OPD of our college. Moving on to the general and systemic examination of this patient. On general examination, no abnormal findings has been reported. On systemic examination, there is no visible scars. Tenderness with a grade of 2 present at the hypogastrial region. So, by these findings and history, we diagnose this patient with IBS mixed type based on the Rome 4 criteria for IBS, that is, patient presents with alternative patterns of defecation. While looking into the Ayurvedic examination, the Prakriti is a Vata Kapha type and the Vikrita dosha as the dosha predominancy. Special mention to be given to the Ahara Shakti since it is Avara in this patient. Similarly, in Asatana Pariksha, also, Mala is Vikrita in nature. So, under Ayurvedic lens, we can diagnose this patient as Grahani Roga with its cardinal feature according to Susada Acharya as Pakvam Vasarajam Puti Muhur Baddam Muhur Dravam. Next is the Chikitsa protocol which we postulated for this patient. Starting with Deepana Pachana with Vatsaradi Gana Churna due to its Ama Adisara Nashana property. with a dosage of 5 grams BD before food, followed by Dadimadi Grida Snehapana due to its Agni Deepana action, followed by Tilataila Swedana and Virechana with Avipati Churna with a dosage of 40 grams along with honey, which is followed by Samchachana Karma, and finally Samana Aushadha with Priyangamashari Ganachurna due to its Pakvatisara Nashana property with a dosage of 6 grams BD with Takra before food for 30 days. So in this patient, we went for 5 assessments, 4 scales and 1 gut microbiota assessment. So firstly, Bristol stool count scale. Before treatment, it alternates between 2 and 6, and after treatment, it got changed to scale 3. On the right, you can see the Bristol stool count scale, which we used in this patient. And secondly, visual analog scale. Before treatment, it was 6 and it got reduced to 1. And thirdly, IBS symptom severity scale. It got reduced to 16 from 285. Similarly, IBS quality of life scale also got reduced to 47 from 105. Finally, the gut microbiota assessment. So the stool culturing and assessing is done by the microbial load before and after treatment. So before treatment, it was 238, and after treatment, got reduced to 156. So this is the biochemical kit used for identifying lactobacillus species. Initially, all the 12 pits will be purple in color, and after the bacterial inoculation for 24 hours, there is a change in color from purple to black in 1, and effervescence is detected in pit 2. So this infers to the presence of Lactobacillus acidophilus, since these 2 tests are positive in this particular species. Next is the general look into the serial dilation technique and plating procedure, which we undergone in this case study. We went for trial and error method and fixed 10⁻³ serial dilution as apt one for this study. So this is a bacterial kit after assessment. To our surprise, we got completely new species after treatment. After treatment, patient was positive for Bifidobacterium bifidum, which is considered as best among the common cell bacteria in our gut. So this is the final assessment showing the difference between the colonies before and after treatment. Next is the discussion on mode of action. So under Ayurvedic view, the treatment protocol starting with Deepana Pachana with Bachadari Churna acts by its Virushna property and increases the Agni Bhushta Guna and corrects the disordered Agni. Deepana Muda Vatan Lomana and Vata Kafagara Karma of Dadimadi Grida corrects the Mandagni. Virechana with Avipati Churna acts by Indriya Prasada, Kosha Shuddhi and Pittahara activity. Finally, Grahi and Purisha Sangrahaniya Karma of Priyangamashadi as Shamana Oshadi treats the Pitta ATISAR condition, and Takra by its probiotic action alters the gut microbiota. In modern view, the chronic treatment protocol acts by 4 ways. They are by reducing the abdominal pain by its anticholinergic and calcium channel blockade property. Intestinal motility is altered by the antidiarrheal and anti-secretory effects, thus regulating the gut. Quality of life is improved by just like the action of TCS in IBS D condition and SSRIs in IBS C condition. And finally, antibacterial actions against Staphylococcus aureus and Escherichia coli and the probiotic activity restores and modulates the dysbiosed gut. As concluding remarks, we found the chronic treatment protocol is very effective in the gut microbiota modulation in IBS patients and can be used in treating IBS condition widely in the future. So at last, I would like to conclude by saying we should feed our microbes with love, just like nurturing our pets, and respect them. Thank you all for patient listening. Thank you.
Thank you, Doctor. Next, I invite Dr. Sonali Nayak for the paper presentation. Dr. Sonali Nayak, are you there? Hello, Dr. Sonali Nayak, are you there? Okay, next I invite Dr. Tejasini for the paper presentation. Dr. Tejasini, are you there?
Yes, sir.
Okay, Dr. Sonali, please share the screen, Doctor.
Sir, Dr. Soli. Yes, sir.
Okay, Doctor.
Shall I start, sir?
Please share the screen, Doctor. Okay, Doctor, please start, Doctor. Your screen is visible, Doctor. Please start.
Okay, sir. Good evening. Myself, Dr. Sonali, first year PG scholar, Department of Vidhya. I am here to present topic on application of RAHUL and Dhupana in pediatrics. Their contents, aim and objective, introduction, RAHUL in classical text, Raksha Vidhi, Dhupana, research article, conclusion and reference. RAHUL and Dhupana
in Ayurveda. These are used to stabilize the baby and prevent it from infection. This protects neonatal period, which is a high risk period for different infections. Proper light have been thrown on modalities to get rid of these infections. Raksha Karma protective measure provide physical and psychological protection. Being a Vedic period, importance to protective measure, and there is a complete sukta dedicated for Rakshagna Karma. Rakshakarma in classical text, he is mentioned and Charak Sarirasthana, and according to Acharya Susruta, Sashti Upak, according to Susruta Sarirasthana's 10th chapter, and according to Acharya Bhagavata, Brana Shradhana Jatakarma, and according to Kashyapa, Dhupan Adhyaya in Kalpasthana. These all are categorized by Raksha Vidhi. Parivarana, mentioned by Acharya Charaka, drugs used Adhani, Pilu, Khadira, Karkandu, Parusaka. All drugs should be hanged in all four corners of Sutikagara. It acts strong aromatic smell, air purifier, and ensure heat resistance. Parikirana, mentioned by Acharya Charaka, drugs used Sarsapa Bija, Atasi, Tandula, Kanakilaka. All drugs are separated on the floor Sutikagara. It prevents micro and macro organisms. Nidhapana, mentioned by Acharya Charaka and Acharya Bhagavata, materials used mushala, and mushala is kept inverted at door. Rakshagna Dravya Potali should be hanged at the door. It prevents fear of enemies, for example, animal trap. Bali and Homa, mentioned by Acharya Charaka, Homa helps to purify the air and Bali helps to prevent entry of microorganisms. Tandula Bali Homa twice in a day. Food or animal offered kept in Bali attracts microorganisms in the environment and later it is thrown out of the village will make that area free microorganisms. Santi Karma, by the fascist who knows Atharva Veda, should perform sacrificial oblation twice a day for 10 days. Example, Agnihotra Homa. Vastra and Shishu Sharia, mentioned by Acharya Susruta, Acharya Bhagavata, and Acharya Kashyapa. Koshma Vastra is used to wrap the baby, and bed is covered with Koshma Vastra. And Dhupana with Yaba, Sarsapa, Atashi, Hingu, Gugula, Bacha, Jatamanchi, Golomi, Ashoko, Rohini. These all are drugs, and Ghruta are Dhupana is done. And Dhupana with feather of Kaka along with Tribrut are mentioned at Acharya Bhagavata. Koshma Vastra maintain the baby temperature, keeps the baby warm, and minimum chance of allergic manifestation. Next, Jolana. Jolana mentioned by Acharya Charaka and Acharya Susruta, drugs used Kanakarika and Tinduka constantly fare is light inside the Sutikagara. Lamp light with Sarsapa Taila inside the room and constant temperature maintained inside the Sutikagara act as hypothermia to the baby and keeping the air free air. Dharana, mentioned by Acharya Charaka and Acharya Bhagavata, drugs used Sarsapa, Atasi, Bacha, Kushta, Hingu, Lashuna, Tandula, Gugula, all are drug potentially is made and it is tied in the neck of the child and mother also hanged at the door. According to Acharya Bhagavata, drugs are Jivaka, all are drugs tied. These drugs are strong aromatic smell, it's an antiseptic and bactericidal agent. Parivijana, mentioned by Acharya Susruta, drugs usually Pilu, Badara, Nimba, Parusaka act as antiseptic air purifier. Dhupana. According to Acharya Susruta has mentioned, Dhupana of Sutika Gara should be done with Rakshagna Dravya. And according to Acharya Bhagavata has mentioned, Dhupana, Vastra and Maja. And Rajamandra and Yogaratnakara, Dhupana with feather of kaka, deep with gogruta on either side. And Dhupana has got disinfect and antiseptic benefits. Next, Jagarana, mentioned by Acharya Charaka and Acharya Bhagavata, the attendance should be available round the clock for 10 or 12 days. According to Acharya Bhagavata, has mentioned to take special care of the baby child on 6th day, because 60 day Sashti Graha is coming. Mantra mentioned by Acharya Charaka and Acharya Bhagavata, Mahamayura mantra and according to Acharya Bhagavata, and entering the word Bhu. Bhu is very powerful meaning, should daily repeated to prevent a death-like condition of the baby. And according to Prayoga Sagara, priest after reciting the mantra Vasudeva should take the asha of medicinal drop in the hand and smear over head, face, neck, body of the baby for protection from evil spirit. Next, money dharana, mentioned by Acharya Charaka and Acharya Bhagavata, tied with certain amulets, and amulets will have both medical and spiritual effects, and protect the child from drushti dosa. Horns of like are made into locket and tied over the neck of the children. Dhupana karma. Next, coming to Dhupana karma, it is one of the natural and traditional method for controlling infection, and Dhupana karma has been remained a part of several auspicious rituals of Indians from beginning of Vedic period, mentioned for maintaining both external and internal environment. And for Brahna Rupana Dhupana is done, disinfecting Bhesaja Kara, Sutika Kara, Kumara Kara, all are Dhupana karma is done, and total 94 formulation are mentioned in Bruhatrayi. Importance of Dhupana karma mentioned as a separate chapter in Kashyap Samhita. Dhupana
Hello, doctor. Hello, Dr. Sanali. Hello, doctor.
should always possesses Dhupana Dravya with him, and attributes of Mahabhuta, Agni and Vayu, Ishada, most of the Dravya and preventive and therapeutic on the basis of Karma Dhupa, Pratidhupa, Anudhupa, on the basis of mode of use internal and external, and on the basis of source Thavara and Jangama. Next, etiology,
Hello, Dr. Sanali.
Dhupa. Yes, sir.
Doctor, you are exceeding the time limit. Can you speed up your presentation?
Okay, sir. Okay, sir. Rakshagna Dhupa and Swastika Dhupa, Gana Dhupa, Punya Dhupa, Varuna Dhupa, and Sri Dhupa on the basis of area exposure, Sthanika and Sarbanga. Form of drug, Churna and Kalka. Collection of drug done Pushya Nakhetra, south or north east direction. And probable of mode of action in human, dilation of blood vessel, oxidation of blood, and adequate tissue perforation and oxygenation, and reduce inflammation, itching, and elimination infection in environment, antimicrobial effect, and air purifier. Fumigation is a process where fumigant, a chemical at required temperature and pressure, can exist in a gaseous form in insufficient concentration will be lethal to pest organism. Thoroughly clean windows, doors, floor, wall, all are washable equipment with soap and water. Close windows and ventilators tightly. If any opening are found, seal it. Personal care during fumigation. Adequate care must be taken during wearing PPE, that including face protection, goggles, and masks or face shield, gloves, head cover, and rubber boots. Research article, Microbial Growth Innovation by Aparajita Dhuma Churna, in vitro evaluation of antimicrobial activity of Dhupana drugs on staphylococcus. Conclusion, Rakshakarma and Dhupana are known since ancient time. The classical indication of Dhupana in epidemics suggests exploring its role in managing the outbreaks of many new emerging diseases, and the despaired description makes the need for a proper complication of the related facts. These are references. Thank you.
Thank you, Doctor. Next, I invite Dr. Tejaswini for the paper presentation. Dr. Tejaswini, are you there? Hello, Dr. Tejaswini, are you there?
Yes, sir.
Your screen is visible, Doctor. Please chat.
Good evening, everyone. Myself, Dr. Tejaswini, first year PG Scholar, Department of the Kaumara Bhratya, guided by Dr. Veena K.H., Associate Professor, Department of Kaumara Bhratya, Shri B.M.K. Kankanwadi, Ayurvedic Mahavidyalaya, Shapur, Belagavi. My topic name is Suvarna Bindu Prashana. These are my contents. Aim and objectives: to study about the classical review on the Swarna Prashana, ingredients, method of preparation, probable mode of action, and benefits of the Swarna Prashana. Introduction. The usage of the metals and the mineral was well known to the mankind since the thousands of years. God has been used the status of the most precious metal and one of the most ancient metal. Even it is used for the preventive and curative purpose. In Ayurveda, administration of the gold particles in children is considered to be unique practice termed as Swarna Bindu Prashana by the Acharya Kashyapa. There are various formulations of the gold and even along with the herbal drugs explained by different acharyas for prolonged usage in the children. Swarna Prashana in children can be mainly implicated in two contexts of Ayurveda: Lehana, that is supplementary feed, and Jata Karma Samskara, newborn care. Method of preparation, according to the Kashyapa, he mentioned in the Lehan Adhyaya, 18th chapter of Sutrasthana, keeping the child face towards the east direction, gold should be rubbed on the washed stone with a little quantity of the water and then churned with the madhu and grita given to the child for the licking. According to the Sushruta, Sushruta has mentioned Swarna Prashana under the Data Karma Samskara after the Shitodaka Mukha Parisheka. The baby should be made to lick leha with the ring finger, that is anamika, composing of the madhugrata and the swarna bhasma. These are another 4 preparations of the swarna bhasma according to the Sushruta: Suvarna, Kushta, Madhugrata, Vacha, Mathyakshataka, Shankapushpi, Madhugrata, Suvarna, Arkapushpi, Madhugrata, Suvarna, Vacha, Suvarna Bhasma, Khaidarya, Shweta, Durva, and Grita. According to the Vagbhata, he explained in the during the after delivery, during first 3 days, milk won't establish. That's why he mentioned on first day to lick the Swarna Basma along with the Grita and Madhu by chanting all the 3 times in the day. In Ashtanga Sangraha Uttarasthana, Vagbhata has also mentioned Swarna Prashana in Jata Karma after the Snana. He also mentioned the some major drugs: Aindri, Brahmi, Shankar Pushpe, and Vacha. All drugs together in Hareno quantity and mixed with honey and ghee. by chanting this and by touching tips of kushagrass, it is held in the ashwatha leaf, which is made up of the gold. It is to be given to the child. According to the BHESHAJA Ratnavali, under the context of Bala Rogadikara, he mentioned under Ayusha Janana Leha, Kushta Vacha Abhaya Brahmi Swarna Bhasma are taken to be in equal quantity, triturate and taken in 35 milligram, Madhu 2 milligram, Ghogruta 1 milligram, mix it well and feed it to the baby. According to the according to the Arogya Raksha Kalpadruma, he also mentioned under the Jata Karma after the Snana. According to the Ravanakrita Kumara Tantra, he also mentioned four Swarna preparation with Midya drugs. These are the Rasa Panchaka of the Grita, Madhu and Swarna Basma. All are having the Madhura Rasa predominant and Shita Virya and Madhura Vipaka, and these Prabhavas are Grita Karma is Samskarasya Anuvarthanam, Madhu is Rakta and Pitta and Rakta Kapha Shamaka, Suvarna Basma having the Pridosha Shamakar act as Rasayana, Brahmana, Rasarakta Vardhana, Vrishya, Hrudya, Netrya, Medya, Vishapaha, Ayushya, Varnya, Deepana, Atikesha and Balya. These are all pharmacological properties of the drugs. All these drugs prabhava are balya and rasayana. Principle of mode of action, Vadikshamatva, to increase the oja by increasing the shukra dhatu either by rasayana or vajikarana. Swarna Bhasma has moisturizing and unctuous effect on the body as its madhura help as balya, brahmana, rasayana, ojo vardaka. It also possesses free radical scanning activity, thus it acts as antioxidant, antidepressant, anti-cancerous, antibacterial property and act as nerve stimulant. All major drugs having the specific effect on the mental performance by producing the neuronutrition effect and improve the cerebral metabolism. The pharmacodynamic action of the major rasayana having the Shita Virya and Madhura Vipaka promotes the kapha and enhances the dharana karma, thus supports the dhriti, smriti of the child. Charaka considered oja as bala and he mentioned three types of the bala, sahaja, kalaja, yuktikrita. Swarna prashana may consider under the yuktikrita bala. Dose of the Swarna Prashana, according to the Sushruta Anamika Pramana, 1 Gunja, that is 125 milligram as per age. Vagbata 1 Harenu Pramana, BHESHAJA Ratnavali, Bala Rogadikara, 1 by 32 Rati, that is 3.9 milligram. Falashruti of Swarna Prashana, feeding of the god increases the intellect, digestive and metabolic power, increases the strength, gives the long life, it is auspicious. It is virtuous and it is Rusya, increases the complexion and eliminates the grahas. Masad Paramedhavi, that is by feeding the gold by 1 month, child becomes extremely intelligent and he is not attacked by diseases. And by feeding for 6 months, one is able to remain whatsoever he hears. Contraindication to Swarna Prashana. As such, there are no contraindications for Swarna Prashana, but it is better to avoid during the acute and chronic infectious conditions, fever, diarrhea, vomiting, and other ill conditions. In Lehana procedure, Niramayascha, that is healthy children, are one of the main indications practically and as per research point of view. Healthy children are the only the indications. If we administer it irrespective of the disease condition, assessment of result will be very difficult and chances of error and critics will be more. Time of administration, Pusha Nakshatram. Sushruta says all this Varna preparation should be taken on the day of the Pushya Nakshatra for adding the special effect, and Swarna preparations are more useful and powerful when it is administered on the Pushya Nakshatra day. Swarna Prashana is modified as per the convenience of the people. Selected the day of the holy star every month, and periodically it is maintained. Generally, public is also sensitive regarding such issues, and a holy day gives mental satisfaction. Current practice in our college, each 6 ml Swarna Bindu Prashana contains 6 ml of the Ghrita and 100 milligram of the Swarna Bhasma. We will give by birth to 10 years. By birth to 5 years, we will give in the drop form, and 6
Hello,
to...
doctor.
Yes,
Doctor,
sir.
you
Yes,
are
sir.
exceeding the time limit, doctor. Can you speed up your presentation?
Okay, okay, sir. After 6 years, we will give in the form of avaleha. These formulation we will consider in kapha prakriti. If kapha dosha is predominant, then we will give honey double quantity, and swarna bhasma 1 drop. And in samadosha avastha, we'll give all equal quantity. These are previous work done. Conclusion: the ingredients of the swarna immune system towards the disease become very powerful. This gives strong protection from the infection. It saves from the diseases that occur due to the seasonal changes. It also saves us from the different kinds of the allergies. Grasping power, sharpness, analysis power, recall, memory becomes very strong. Improves the digestion power, antitoxic power increases. Hence, fighting against the poisons in any form of becomes strong in the child. Overall, it makes the child healthier than the most other children who are not taking the Swarna Prashana. These are classical references. Thank you.
Thank you, doctor. Next paper presentation. Hello, doctor. Are you there?
Hello, it is Dr. Ayyana.
Yes, Dr. Ayyana. Please share the screen, doctor.
Okay.
The screen is visible, Dr. Ayyana.
Yeah. Good evening. I am Dr. Ayyana. I am working as Associate Professor in JSS Ayurveda Medical College, Mysuru. And I am here before you to present a clinical study. The clinical study titled a double-arm open-label randomized clinical study on the effect of Yavapaniya in the management of Yakrutodara with special reference to non-alcoholic fatty liver disorder. So this is a study which has been sanctioned by the Rajiv Gandhi University of Health Sciences for the research purpose, and it was carried out in our hospital. So these are the contents of the presentation. And as we all know that Yakrutodara is one among the Ashtodaras explained by our Acharya Sushruta. And Udara is always considered as Ashtamahagada, which shows the importance, chronicity, and difficulty of managing the disease. Acharyas have also described various treatments in managing such diseases, and Ayurveda has proved its efficacy in managing these chronic ailments. So when we compare the signs and symptoms of Yakrutodara described in Ayurveda, it can be correlated with non-alcoholic fatty liver disorders, so popularly known as NFLDs. So the liver involving in almost all biochemical pathways and is essential for the overall well-being of the individual. But because of the metabolic syndromes, which includes cluster abnormalities like increased abdominal fat, poor ability to use the hormone insulin, high blood pressure, high blood levels of triglycerides, and drug-induced liver injuries have led to many liver disorders. And according to WHO surveys in 2014 in India, liver disease is the 10th cause for death, comprising of 2.44% to total deaths. And non-alcoholic fatty liver disorder is one among the liver disorder which is increasingly common in the prevalence rate, and it's almost 9% to 32% of the general population in India. And use of the herbal medicines for prevention and control of liver disease is the focus of alternation throughout the globe. The reason being its high efficacy, less expensive when compared with the cost of the conventional drugs, adverse drug reactions, and their inefficiency. And Yava Panyakshara is one of the formulation explained by Acharya Sushruta in the management of Yakrutodara, having the properties like Chedya, Bhedya, Lekya, Deepana, Pachana, Tridoshadna, and helps to improve the Tridoshada Jushti, Sroto Dushti, and causes Agni Dipti. And Charaprayaga is also indicated in Udara. Hence, this drug has been taken up for this present study to evaluate its efficacy with the Ekritodara with comparison with the Leave 52DS. So Leave 52DS, as you all know, it is the brand medicine of Himalaya Drug Company, and they had done a study on this Ekritodara, or not Ekritodara, in specific to non-alcoholic fatty liver, with the use of Leave 52DS. So it is considered as a standard drug, and we have compared our Yava Panyakshara with this. The object of the study is to evaluate the efficacy of Yava Panyakshara in the management of the Ekritodara. So the disease review, the Yava drugs and how has been very detailedly dealt in the classics, and we have seen those things. So the study was designed in such a way that 60 patients were divided into two groups. So group A patient of this group was treated with Yava Panyakshara, and the group B was treated with Leave 52DS. It's all like OPD and IPD patients of JSS Ayurveda Medical College and Hospital Mysuru was considered, and also the patients were referred from other practitioners, hospitals, institutions to JSS Ayurveda Medical College. So before the study, the consent was taken, and the inclusion and the diagnostic criteria mainly was like USG of the abdomen and pelvis, where they will be giving the gradings of the non-alcoholic fatty liver like grade 1, grade 2 and all. And along with that, some of the subjective parameters also we have taken that we'll see in the coming slides. So the people or the patient subjects included in this inclusion criteria were between the age of 30 to 70 years irrespective of gender, religion, and socioeconomic status. Subjects fulfilling signs and symptoms of Ekritodara like Ekrit Vriddhi, Udara Shula, Agni Mandya, Rochaka Vipaka. So along with the USG of the abdomen, subjects having these symptoms were considered for the study, and previously diagnosed subjects of Ekritodara was also taken. And in the exclusion criteria, we had like removed all the subjects having uncontrolled diabetic mellitus, hepatitis A, B, C, and HIV among the pregnant and lactating women, and other diseases of liver like alcoholic fatty liver diseases, malignancy and liver cirrhosis, fibrosis of liver, hepatocarcinoma were all excluded. And any other diseases or conditions that intervene the treatment like ischemic heart disease, chronic renal failure, myxedema, nephrotic syndrome, or any other carcinomas were excluded. In this, like before the study, if the needed, the blood investigations were done along with the lipid profile, LFT, HIV and HbA1c. Radiologically, usage of the abdomen was done. So this Yava Panyakshara was proclaimed from the renowned pharmacy with GMP certified pharmacy. The drug was made into capsule. So 50 grams each capsule was made, and it was divided in the two subjects. So 1 gram of Yava Panyakshara was divided into two doses, with and Ushna Jala Zanupana was given for 30 days. So follow-up period was 60 days. The first follow-up was done after 30 days, and assessment was done based on the subjective and objective criteria before, during, and after the treatment. The subjective parameters were Agni Mandya Vipaka, pain, the symptoms, and the objective parameters were USG of the abdomen. So the present study, 60 patients with established diagnosis of Ekritodara filling the exclusion criteria were put into trial. Patients were randomly categorized into Group A, Yava Panyakshara, and Group B, Leave 52DS. In each group, the age of the patients and all the demographic details was taken along with the USG reports. The signs and symptoms are compared between the groups. After the treatment, patients follow-up was done. Following pages describes the statistical analysis. So here we can see that the Yava Panyakshara on Agni Mandya, it has given a highly significant. So using Wilcoxon's test, the improvement after the treatment is 53% is significant. After follow-up, the improvement is 87%. That is also highly significant. So effect of Leave 52DS on Agni Mandya is also like it was statistically significant. Using Wilcoxon's test, the improvement after the treatment is 50.9%, and it is significant. And after the follow-up, the improvement was 73%. The details shown with the statistics. So the next effect of Yava Panyakshara in the pain, also a statistical analysis showed before the treatment, the mean rank of the pain was about found to be 3, and after the treatment it was reduced to 1.7, and the follow-up mean was 1.3. And using the Friedman's test, it was found to be highly significant. Using the Wilcox test, the improvement after the treatment is 66.5% is highly significant, and after follow-up, the improvement is 93.5% is also highly significant. So details will be shown in the table as well as in the graph. It is expected. With the LEAV52, again, it is also statistically significant. So using the Wilcox test, the improvement after the treatment is 62.9% is significant, and after the follow-up, the improvement is 76.5% is significant. The details are shown in the graph. And again, coming to the effect of Yavapanichara on Avipaka in group A. So statistical analysis showed that before the treatment, the mean rank of Avipaka was found to be 3, and after the treatment, it was reduced to 1.73, and after follow-up, the mean rank was 1.27. And using Friedman's test, it was found to be highly significant. So next, even in the LEAV52 DS on Avipaka, statistical analysis showed that before the treatment, the mean rank of Aruchi was found to be 2.97, and after the treatment, it was reduced to 1.73. And after the follow-up, the mean rank was 1.3, and using Friedman's test, it was found to be highly significant. So coming to the overall effect of Yavapanichara with the USG of abdomen in the group A, statistically showed that before the treatment, the mean rank of USG of abdomen was found to be 2.47, and after treatment was reduced to 1.77. And after the follow-up, the mean rank was 1.77, and using Friedman's test, it was found to be significant. Using Wilcox test, the improvement after the treatment and after follow-up is 88.6%, which is significant. Effect of USG of abdomen in LEAV52 DS, like it was statistical analysis showed that before the treatment, the mean rank of USG of the abdomen was found to be 2.37, and after the treatment, it was reduced to 1.97. And after follow-up, the mean rank was 1.67, and using Friedman's test, it was found to be significant. And using Wilcox test, the improvement after the treatment is 50% is not significant, and after follow-up, the improvement is significant. So the details are shown in this graph. So this is a graph representing on the Agni effect of the pain and on the USG of the abdomen. Coming to the overall effect, statistical analysis showed that in group A, before the treatment, the mean rank was found to be 3, and after the treatment, it was reduced to 1.8, and after the follow-up, the mean rank was 1.2, and using Friedman's test, it was found to be highly significant. And overall effect of LEAV52 was statistical analysis showed that in the group B, before the treatment, the mean rank was found to be 2.93, and after treatment, it was reduced to 1.93, and after follow-up, the mean rank was 1.13. And using Friedman's test, it was found to be highly significant. Using Wilcoxon's test, the improvement after the treatment is 46.03% is highly significant. And after follow-up, the improvement is 91.6%, which is also highly significant. So this is the comparison of the overall effect of the group A and group B. On analyzing before and after treatment effects using Mann-Whitney's test, the mean rank after treatment of group A is 12.97. and that of group B is 18.03, which is non-significant. On comparing the mean rank after follow-up, the group A showed 12.87 and group B showed 18.03, which is even non-significant. So considering both, it can be analyzed that there was no significant difference in treatment observed between the two groups. But when we compare the individual criteria, percentage and the relief of pain, group A stands better than the group B, that is Yavapanichara provides better result in Agni-Madhya, pain and Ruchi. And Aruchi, that is symptomatical. So to assess the association between the improvement status and the group, chi-square test was used and it is found to be non-significant. Also, we can observe that with Yavapanichara, complete improvement is seen in 80% of the patients, whereas complete improvement is seen only in 47.6% of the patients with LEAV52 DS, had moderate improvement with Yavapanichara, and 26.7% had moderate improvement with LEAV52 DS. So there is no statistically significant difference between Yavapanichara and the LEAV52 DS. So this is the comparison of the overall results of the group A and group B. Coming to the discussion part, the study showed that the patient with Yakritodhara was suffering more from Agni-Madhya, Avipaka, Aruchi and Duk. So the disease Yakritodhara was found to be more prevalent in the age group of 40 to 50 years in males with non-vegetarian diet and more seen in sedentary lifestyle as described in contemporary science. Textbooks and research articles, hence more awareness to be created among the public as a preventive measures to avoid sedentary lifestyle, maintain healthy diet and regular exercises. In Yakritodhara, Tridosha involvement is seen as the Chara is Tridoshagna Having the Ashtagunas, it helps to remove the Tridoshita Drushti and other vitiations to come down quickly, so considered as Ksharashteshta. The collection of the drug Yava was easier and the procedure conducted was safe, cost-effective, and minimal hospitalization required. There were no adverse reaction either observed or reported during the study period. So the effect was probably due to the properties of Tikta, Katurasas, Deepana, Pachana, and Ushna Virya, if specifies Vata, and render it useful, reducing the symptoms of Agnimatya, Ruchi, or Vipakaru, as they specify the doshas, and also it is known for its Udara Roga Hara, Pliha Vriddhi Hara, and Vedana activity. The high levels of serum triglycerides and cholesterol levels, these findings implicated dyslipidemia in the pathogenesis of fatty liver to NASH, well, apparently related to the increased risk of advanced fibrosis. In clinical trials, provided the highest level of evidence for the value of cholesterol lowering outcome of these studies suggested that these interventions may be too little. So lipid lowering trials tend to be conducted in high-risk populations so that differences in event rates can be detected over relatively short time intervals. To compare to live 52 years, it is a single drug formulation, minimum days of treatment with less quantity of the treatment is required. And to conclude, in the study, there is no statistically significant difference between the Yavapanichara and 52 years. The treatment modalities of Yavapanichara is efficacious in treating Ekratodara in its own perspective on the basis of parameters. If we take before and after the treatment, it is having a better results in the patient of NSLD. The same treatment can be extended to a larger group of subjects in multi-center level is necessary to uphold the results. So with this, I conclude. So these are the references of the study. Thank you, one and all.
Thank you, Doctor.
Thank you, Dr. Ayana, for the presentation.
So next I invite Dr. Prerana Santosh. I invite Dr. Prerana.
Prerana, are you there? Hello, Dr. Prerana Santosh, are you there? Hello, Dr. Prerana Santosh, are you there? Okay, next I invite Dr. Harishankar for the paper presentation.
Good evening, sir. Am I audible?
Audible, Doctor. Please share the screen, Doctor.
Yes, sir. Sir, screen is
visible, Doctor. Please start. Screen is visible, Doctor.
Myself, Dr. Harishankar PV, second year PG scholar from Department of Shalyatantra, and I am presenting on the topic regarding the management of traumatic bilateral ischial abscess or Gudaka Vidradi with incision or Bhedana and Kshara Sutra technique. It's a case report which we have done in our hospital. Patient was admitted in our hospital with the chief complaints of pain and swelling in the perianal region since 10 days. And there was also foul smelling pus discharge from the anal region since 5 days. And we have asked him the history of his presenting complaints. And he told that he has a history of fall from about a height of 10 feet, evoking an injury at the perianal site. And at that time, he did some conservative management by using antibiotics and anti-inflammatory drugs from a local physician. But at that time, he got some relief and it again reoccurred. So after that, he was admitted in our hospital for the further management. The surgical and food allergy history were nil and all the family members were healthy. And we have done the examination. And in that examination, we have found that all vitals like blood pressure, pulse, and other systemic examinations were normal. And during local examination, we found that there is reddish discoloration around the perianal region and the ischiorectal fossa of both sides. And there was induration along with tenderness at both ischiorectal fossa. And digital examination was done. The tenderness along with opening and foul smelling pus discharge was seen at posterior 6 o'clock. Posterior matlab 6 o'clock position inside the anal canal. And we have sent the patient for MRI fistulogram. And in that, it was suggested that high-level fistula nano with an intercommunicating horseshoe-shaped bilateral ischiorectal collection and supralevator extension was found. And we have diagnosed it as grade 5 fistula. Hello. Hello. Hello, sir. Hello. Hello, sir. Am I audible?
Hello, doctor.
Sir, am I audible?
Audible, doctor.
Yes,
Please
sir.
continue,
Yes.
doctor.
And now we will come to management. As usual, we have planned for an operative management. So all the precautions or post pre-operative things we have done. We have taken the consent of the patient and proper investigation was done. And with proper sterile condition, patient was shifted to the theater and painting and draping was done. And we planned for the Bhedana karma. For that, Anlomagati Bhedana on the left ischiorectal fossa was made. And we have removed all the pus and everything from that with that incision. And all the locules were broken and all the pus collection was drained out. And the similar thing was done on the next, the right side also. That right and left ischiorectal fossa we have opened, and the whole the pus which was collected in that were drained out. And after that, already we have found the evidence for the internal opening at the 6 o'clock position. So connecting the internal opening with the opening we have made, we have applied the Kshara Sutra. And after that, the Jatyadi Taila 5 ml was instilled through the anal route. And patient was, after that, and in the post-operative period, patient was advised for the Avgaha Sweda by using the Panchavalakala Kashaya. And along with that, daily Jatyadi Taila installation was also done. Along with that, proper cleaning and dressing of the wound was also done. And along with these, during the post-operative time, we have given the proper Shamana Aushadhis also. And when it comes to discussion, the acute phase of anorectal abscess gets complicated into fistula in ano. And there are so many current surgical treatment methodologies like fistulectomy is there, fistulotomy is there, and destruction of the fistula tract by carbon dioxide laser beam is there. But the major problem of these procedures is mainly the reoccurrence, because the proper or the incomplete removal of the tract, if it is occurring, means the chance of reoccurrence is very high. And extensive mutilation of the anorectal and ischiorectal area will be there. And prolonged hospitalization is one of the other problems that is faced by the patient for these surgical procedures. And Avagaha Sweda that we have given during the post-operative period, which helps in maintaining the hygiene of perianal region, and it also reduces the inflammation, pain, and it also relaxes the spasm of the sphincter muscles. When it comes to the overall thing that we have done, that first is the Bhedana, which is done to facilitate the drainage of the pus, and the Avipadikara Churna we have given for the patient so that the stools, proper Vadanlomna will be there and the stools won't get constipated. And we have also given the Tribhala Guguru and Gandhaka Rasayana, which is having the Lekhana and the Shodhana properties. And the Kshara Sutra, as we all know, it is attributed with the antibacterial effect, and it cuts the tissues and augments healing. Means it cuts along with the wound, it get heals also, and it acts as a chemical cauterization. And the drugs delivered layer by layer to the local pathological tissue planes and debride the unhealthy granulation. And we'll conclude now. The Kshara Sutra therapy, most appropriate for healing the fistulous tract, offers an effective, ambulatory, and safe method. And the case was managed with the I&D followed by Kshara Sutra application. And the dressing was performed along with the proper cleaning of the wound with the betadine, hydrogen peroxide, and all. And the wound was packed with the Jatyadi Taila. Healed completely with normal scar formation, and no reoccurrence of fistula was observed in a follow-up period of 1 year. In the first picture, we can see this is the time where operation was completed. And in this, after 15 days of operation, the wound was like this. After 21 days, the wound was like this. And after 32 days, the wound was completely healed. Thank you.
Thank you, Dr. Harishankar, for the presentation.
Yes, sir. Thank you, sir.
Next, I invite Dr. Varsha Venkatesh for the paper presentation. Dr. Varsha, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Sure, sir. Yeah.
The screen is visible, doctor. Please chat.
Hello, everyone. Myself, Dr. Varsha Venkatesh, second year PG scholar, Department of Panchakarma from Dr. B&M Ayurvedic Medical College, Vijaypura. The topic is Rukshana in Panchakarma. Today, I'll be telling briefly about the introduction, indications of Rukshana Karma, properties of Rukshana Dravyas, Rukshana in Panchakarma, Samyak and Atiyoga Lakshanas, then discussion, conclusion, and references. Introduction. Ayurveda treatment comprises of two major specialities. They are Samshodhana and Samshamana Chikitsa. There are mainly three types of karma in order to achieve Samyak Shodhana and for Prakriti Stapanartha, that is, getting back to the normalcy. Those three karmas are Purva Karma, Pradhana, and Paschat Karma. Purva Karma includes Pachana, Deepana, Snehana, and Svedana, whereas the topic I have chosen, Rukshana, is considered as the Vishishta Purva Karma before the administration of Shodhananga Sneha in specific conditions. Rukshana Karma, it's one among the Shadvida Upakramas. They are Langana, Brumhana, Rukshana, Snehana, Svedana, and Stambana. The quality which is devoid of stickiness and devoid of sneha, that is sneha shunya, is considered as rukshana. Drugs depleting the fat, moisture content of the body and which causes dryness in the body are called as rukshanas. Rukshana can be classified into two types. There are Bahya Rukshana and Abhyantara Rukshana. Bahya Rukshana includes the external procedures like Valuka Sveda, Atapa Sveda, Udvartana, Lepa, Ishtika Sveda, etc. Abhyantara Rukshana includes Takrapana, Ushna Jalapana, Kashayapana, etc. Indications of Rukshana Karma. Abhishyana Mahadosha, Marmastha Vyadayascha e Urusthamba Prabhrutayo Rukshaniya Nidarshitaha. Abhishyana means Drava Pradhana Shleshma Vikaras. For example, Prameha. Mahadosha is Bahudosha conditions like Prameha, Udara, etc. Then Marmastha Vyadi, any Vyadi that is in the Trimarma regions. One among the example is Rudroga, and at last Urustamba. In all these conditions, Rukshana Karma is indicated. Other indications are Krimi Roga, Nitya Sneha Purusha, etc. If Rukshana is not performed in these conditions, then it results in Sneha Vyapat. Now let's move on to the properties of Rukshana Dravyas. They are Lagu Ruksha Kara Tikshnam, Ushnam Stiram Apichilam, Prayashaha Katinam Chaiva, Yad Dravyam Taddi Rukshanam. Rukshana is achieved by Sneha Abhava. Properties are Ruksha, Lagu, Kara, Tikshna, Ushna, Stira, Apichila, and Katina. According to Vagbhata, he says Viparithartha guna of Sneha is responsible for Rukshana. And according to Arunadatta, he says Lagu, Ushna, Stira, Ruksha, Tikshna, Stula, Katina, and Sandra are the gunas of Rukshana. He also says that Rasa also matters in the Rukshana Karma, that is Katu, Tikta, Kashaya Rasa Pradhana Dravyas also acts as Rukshana. Among all three, Kashaya Rasa is considered to be the best Rukshaniya and Tikta is considered as the least Rukshaniya. Ruksha Basti, here we will be dealing now about Rukshana in Panchakarma, wherein all it is utilized in the branch of Panchakarma. Ruksha Basti, mainly used in Santarpana Janya Vikaras, in Niruha Basti Vidhya Adhyaya of Sharangadhara Samhita, he explained various Basti combinations for Rukshana effect. Example, Lekana Basti using Trifala Kwata, Gomutra, Madhu, Kshara, and Ushna Dravyas. As Prakshepaka Dravyas, it can be efficiently and effectively used for the purpose of Rukshana Karma. Ruksha Virechana, according to Sushruta, the person having Snigdha Sharira, one whose body has aggravated doshas, are treated with Ruksha Virechana. Ruksha Nasya, Acharya Kashyapa has classified Nasya into two main groups. They are Shodhana and Purana. In this Shodhana Nasya,
This Shodhana Nasya brings the Rukshana effect through their Prithvi, Vayu and Agni Mahabhuta Pradhanata. And Vamana, which is already indicated in Bahushleshma and Medasavastha. And in Svedana, Ruksha Sveda can be utilized as a part of Svedana Karma. Rukshana can be utilized in Sneha Vyapat Chikitsa also, that is Atiyoga of Snehana. Then Samyak and Atiyoga Lakshanas of Rukshana Karma. Samyak Lakshana says, Vatamutra Purushanam Visargi Gatra Lagave Hrudayodghara Kantasya Shuddhav Tandra Klamegate Svede Jate Ruchau Chaiva Kshut Pipasa Sahade Kritam Langanam Adeshyam Nirvetye Cha Antaratmani. Atiyoga Lakshanas goes like this. Parva Bedo Angamardascha Kasaha Shosho Mukasyacha Kshut Prayasho Aruchis Trishna Daurbalyam Kshotra Netrayoho Manasaha Sambramo Abhiksham Urdhva Vatas Stamo Rudi Dehagni Balanashascha Langane Atikrite Bhavet. Discussion. Best example of Rukshana is considered to be Uddalakana among all. Other aharas which acts as Rukshana are Trifala, Yava, Shilajat, Takrapana, Pinyaka, Sattu, Gomutra. Udvartana, in which mainly Udgarshana type, which is usually done with a Sneha Aushadha Churna, and Viharas are Madhya Nitya Sevana, Vyayama, Vyavaya, Chintya, Shoka. Not only the procedure aspect, Rukshana can also be done based on Dinacharya aspect. At home, they are Vyayama, Udvartana, Tambula Sevana, Dhumapana, etc. They are also considered as Rukshana. Langana can be done without the help of any dravyas, but Rukshana can only be done with the help of Rukshana dravyas. Vagbhata says Virukshano Langanavat Atikruta Lakshana, which means Virukshana Lakshanas are similar to Langana Lakshanas. That is, Samyak Rukshana Lakshana is equal to Samyak Langana Lakshana, and Atiyoga or Ayoga Rukshana Lakshanas are equal to Atiyoga Ayoga Langana Lakshanas. Conclusion. Panchakarma is a procedure in which Utklishta doshas are expelled through the nearest route after Snehana and Svedana. It is then followed by Shamana therapy. This we all know. Certain specific conditions need special preparation for this Shodhana procedure, and Rukshana is one such procedure in order to achieve the normalcy. Rukshana Dravya, due to their Ruksha Ushnadi gunas, help in liquefying and clearing the obstruction in Srotas. Rukshana karma can be applied in many other conditions based on the yukti of the Vaidya. When the Rogi is presented with Mamsala, Medura, Bhurishlishma, Mahadosha conditions, one must undergo Rukshana before the Shodhana Karma. And these are the references. Thank you, one and all.
Thank you, Dr. Varsha. Next, I invite Dr. Prerna Santosh Pendekar for the paper presentation. Dr. Prerna Santosh, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor. Your screen is visible, doctor. Please start.
It is visible?
Yes, doctor, visible.
Good evening, everyone. My today's topic of seminar is ulcer and its management, a case study. The treatment and healing of wound are some of the oldest subjects discussed in the medical literature. The same events in the same order occur in every healing process, regardless of the tissue type or the inciting injury. Knowledge of wound healing allows surgeon to manipulate wounds to achieve optimal result in short period. In Ayurveda, non-healing ulcer can be correlated with Dushtavrana. Application of Ranarupaka Malhar and Pichu of Ranarupaka Taila for Shodhana and Ropana and Vrana Dhavana done with Panchavalkala Kashaya with Gomutra in Dushtavrana is one among the 60 Upakrama of Rana. Ranarupak Gomutra, Panchavalkala Kashaya, Dhavana, Ranarupak Taila, Haritra, Madhu Pichu and Ranadupana is indicated for Dushtavrana in Vrana Chikitsa Adhyaya, Chikitsa chapter 1. Of Sushruta Samhita has Shodhana, Ropana and properties along with the Tridoshahara properties, thus considered as a good curative measure for local treatment of Dushtavrana. A case report of neurogenic ulcer successfully treated by local application of Vranaropak Malahar, Panchavalkala Dhavana, Vranaropan Taila Pichu, and Vranadupana has been presented here. Introduction. Vrana is seen as a debility and scarring disorder usually seen in affecting the human being at any age. Vrana is the condition associated with Dhatu Nasha and characterized by Vedana, Srava, and Vikriti. Acharya Sushruta has described Shashti Upakrama for management of wound to achieve good approximation, early healing without complications and acceptable scar. Among these, Pranaropaka Malahar, Pranaropaka Taila Pichu with Madhu, Haridra, Panchavalkala Kvata with Gomutra Dhavana, and Dhupana with Panchavalkala Bharad. Haridra, Tharu Haridra has its own specific indication in the management of prana. As per modern, ulcer is a break in the continuity of covering epithelium, either skin or mucous membrane due to molecular death. Its parts of ulcer: margin, edge, floor, base. These are parts of ulcer, edges of ulcer, types of ulcer. These are some pictures of ulcer. Pressure sore, stages of ulcer, feature and investigations, treatment. Next case study, moving to case study. A patient name of Mohan Sukhadev Kumbar, age 41 years, sex male, occupation ex-military man, address Belanki. Date of first visit in surgery department was 16/5/2022. Date of recovery 6/7/2022. Chief complaints with duration: right lateral side of foot, numbness since 2 years, imbalance during walking since 2 years, non-healing wound on heel of right foot since 1 year, back pain at lumbar since 8 months. Present illness: patient was apparently all right before 2 years. Then he had done spinal surgery for his back pain. After 1 year of surgery, he had developed above complaints. Suddenly, he had taken various treatments from various pathy, including homeopathy and allopathy for it, but didn't get relief. Therefore, for a proper Ayurveda treatment, he came in our college. It's ADMC, Ashta. Family history: no any family history, no HTN DM. Next, general examination. Pulse rate is 76 per minute and BP 120 per 80 mm of Hg. And local examination: wound at heel of right foot measuring about diameter of 2.0 centimeter and depth 2.5 centimeter. First discharge through opening was present. Numbness was present. These are surgical history investigations. Then cause: extreme pressure application on foot due to prolonged standing work in his field as farmer. Diagnosis according to Ayurveda is prognosis. It is a Kashtasadhya Vrana. And diagnosis according to modern medicine is neurogenic ulcer. Treatment: oral medication. He was on oral medication, Mahavat Vidvansaras 1 TDS, Panchatikta Kruta Gukud, Chandraprabhavati, Dhanadanyari Kashay, capsule Vatari plus, Cap Dhanvantari, Ashwagandharishta, and tablet Palsinuron. And Sarvanga Abhyanga with Dhanvantaram Tel and Balatel, Nadiswet, and Niroha Basti. For local application, we have done Ranadhavana with Panchavalkala Kvat and Gomutra, Ranadupana, Haridra and Daru Haridra, Panchavalkala Bharad, Ranaropak Malahar, and Pichu of Haridra and Vanaropak, Taila and Madhu. Investigation done by patient: X-ray of right ankle joint, MRI of spine, and blood investigation. Blood investigation, HB 11 gram, RBC 4.39, WBC 9700, platelet count 2,83,000. BSL fasting 92 mg and postprandial 129. Observation from first day. On first day, patient visit to Shalakadar department 17.5. Wound size was 2.0 centimeter and 2.5 centimeter in depth. Discharge was present. No any sensation. Slough was present. On day 8, wound size was 1.8 centimeter in diameter and 2.3 centimeter in depth. Discharge was present and slough was present. No any pain, no any sensation. Next, he visited to 26 May 2022. New wound formed due to taking Dupana extreme close to Dupana Patra. And burn skin near a wound is removed and then dressing done as usual with above mentioned drugs and procedure. The ulcer size 1.8 centimeter in diameter, 2.3 centimeter in depth. Slough was slightly present and discharge was slightly there. This was on 11th day. On 13th day, day 15th, on day 17th, day 25th. On 11/6/2022, leash therapy was done for making wound healthy and promotes healing by taking out infected or dushit rakta using jaloka. On day 29, wound size was 0.8 centimeter in diameter, 1.2 centimeter in depth. Slight pain, slight sensation was there. No any discharge. Again, leash therapy done on 16/6/2022 for making wound healthy and promotes healing by taking out infected or dushit rakta using jaloka. On 32 day, wound size 0.6 centimeter in diameter, 0.8 centimeter in depth. Slight pain, slight sensation, discharge was not there. On 36, 0.4 centimeter in diameter and 0.5 centimeter in depth. Slight pain, this is, yes sir?
Sorry, doctor, you are exceeding the time limit. Can you speed up your presentation?
Yes, sir.
Okay.
Discussion. Vranadhavana with Panchavalkala Khwata with Gomutra. It will work in Shodhana and Ropana of Vrana, and Vranadupana with Haridra and Daru Haridra with Panchavalkala Bhara. It will promote healing. Next on 6/7/2023, ulcer heal completely. Conclusion. Conclusion. Akshidanta nasa apanga shotra nabi jatara sevani nitamba pashva kukshi vakshaha kakshasthana sandhi bhavagata safena puya rakta anila vahino अतः शल्याच्या दुह चिकित्सा अधोभागाच्या उद्वभाग निर्वाहिनो रोमात उपनख मर्म जंगास्ति संशिताः च भगंधरम अपि च अंतर्मुख सेवनी कुटकास्ति संशिता. These are the references. Thank you.
Thank you, Dr. Prerna. Next, I would like to invite Dr. Ranjita K for the paper presentation on the topic Pradhivisha. Dr. Ranjita, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Yes, sir.
Screen is visible, doctor. Please start.
So that is not the one, sir. Sir, can you please share my screen? This is one more which is opening.
Okay, doctor. Doctor, please start the session, doctor.
Yes, sir. Good evening, everyone. I'm Ranjita, from first year PG scholar from the Department of Agada Tantra from SDM Hassan. My today's topic is Prativisha. These are the contents. Introduction. Prativisha is one among the Chaturvamshati Upakrama management, which is mentioned by Acharya Charaka. Prativisha means administration of other variety of visha as an antidote for the existing poisoning. These are few examples where Stavara Visha is used as a Prativisha for Jangama. Example, in the case of Alarka Visha, we can use Arka Shira and Datura as a Prativisha. In Mushika Visha, Jaipala Bija can be used. Sarpa Visha, Gunja and Jaipala Bija are used as Prativisha. And in Vrishika Visha, Vatsanabha Lepa or Karpasadi Lepa can be used as Prativisha. The main concept of Prativisha is Acharya Charaka explained about 24 upakramas for Visha Chikitsa, and Prativisha is one among them. Acharya Chakrapani commented on Prativisha as Prativisham Vistara Prayojanam, which means that Prativisha Prayoga involves the use of Visha Dravyas to nullify the effect of another Visha. And according to Acharya Charaka, Vishapanam Dustanam Vishapite Dashanam Cha Ante. It means that if a person has been afflicted with poison caused by the bite, then he should be made to drink the poison orally and vice versa. So it can act as a counter poison. The derivation of the word Prativisha is taken from Shabdakalpadhruma, which means Tanmanam Kayati Prakarshiti iti. It means the one which pulls out the poison which is present in the body. It is mainly indicated in the cases where the effect of the poison does not subside by mantras or administration of any aushadas, and after the lapse of 5th Vega and before the commencement of 7th Vega, in all other emergency conditions where other treatment fail. Is contraindicated after the commencement of 7th Vega in the case of doubt whether the person is poisoned or not during Varshakala, and the person is suffering from any disease of Pitta Roga, hunger, thirst, anger, to the pregnant women and children, those who are emaciated, and those who are suffering from diseases of vital organs. There are three, the method of administration is mainly divided into Purva Karma, Pradhana Karma, and Pashat Karma. Purva Karma is it should be administered in the condition when the person has been purified by the Shodhana Karma, and the person who has consumed Hit Ahara, and the person who is Satvika in his mind. Pradhana Karma, the Prativisha should be administered according to the poison conditions in appropriate doses. The time of administration is mainly during Shita Kala and Vasanta Kala, and only in the case of emergency condition, it can be advised in Grishma Kala. Pashat Karma, after the administration of counter poison, the patient is made to drink Grita. Patya and Apatyas to be followed. Apatyas are Katu, Amla, Lavana, Taila, and Rukshahana to be avoided, and Apatya Viharas are Diva, Sopna, Atapan, Anila Sevana. The dose, Chaturbihi Shashtirbhir, Hina Madhya Uttamaha. Hina Matra is of 4 Yava, Madhyama Matra is of 6 Yava, and Uttama Matra is of 8 Yava. According to Ashtanga Sangraha discussion, Prativisha is an important treatment measure in emergency conditions and in severe cases of poison. The mode of action of Prativisha can be understood by its Guna Karma, as it possesses Sukshma, Vyavai, Vikasi, Lagu, etc. properties, which enables it to penetrate into the Sukshma Shrotas and act very quickly. Conclusion: Prativisha is the administration of Visha with opposite mode of actions to nullify the action of existing Visha. It should have the affinity for the same system on which the poison is affected. For example, the Datura is used as a Prativisha for Alarka Visha. Here both Visha and Prativisha act on nervous system. Prativisha is administered at the last stages of poisoning where the chances of survival is rare. Thank you.
Thank you, doctor. Next, I invite Dr. Sonal Jagannath Digale for the paper presentation. Dr. Sonal Digale, are you there? Dr. Sonal Digale, are you there?
Yes, I'm there.
Okay, doctor. Please share the screen, doctor.
Yes.
Your screen is visible, doctor. Please chat.
Yeah. Just a minute. I'm not able to forward the. Okay. So Ayurveda has the Ayurveda has the nice concept of Trisutri Ayurveda in the treatment of the diseases, that is Ahara, Vihara, and Aushadhi. So in that, Ahara plays the important role in the treatment as well as in the prevention of the diseases. A proper diet keeps the strength of seizing the disease progress. Acharya Kashyap explains Ahara as Mahoshada in Akhilasthana. Bheshaje nopapannanno api niraharo na shakyate tasmad bhishaka viraharo mahabheshajamutrate. It is not possible for a person to continue his life without food. Even if he is on the medication, the patient will not recover without proper food. That is why Ahara is known as Mahabheshaj, or it is called as Mahabheshaj by Acharya Kashyap. Buddha Vaidya also supports it by quoting the famous verse Pathe sati gadarthasya kim aushadha nishevanehi Pathe sati gadarthasya kim aushadha nishevanehi. If there is proper diet and lifestyle, there is no need of medicine, and if there is not proper diet and lifestyle, there is no use of medicine. So why Acharyas has given so much of importance for this Ahara? Because this Ahara is it protects proper Ahara protects the Agni, and we know the Vikara is Vikara Dhatu Vaishamya. If the body tissues are not in the balanced state, it is a disease state. So proper Ahara will keep all the three doshas, three malas, and saptadhatus in balanced state. And therefore, Acharya Charak has mentioned medicated gruels, that is Yavagu, in the Samsarjan Kram, and also for the some curable disease known as Yavagu, they are 28 in numbers. Acharya Kashyap also has mentioned Yavagu, Odan, Mandapiya, Vilipi, and 24 types of Yushas, considering the protection of the Agni and curing the disease through the diet. In Sharangar Samhita, the methods of the preparation has been mentioned in details. So the method of preparing the Yavagu is explained in Sharangadhara Samhita. So if the Tanduladik is 1 part, water has to be taken 16 parts and boil it to reduce to the half and strain it. And add the other ingredients like the Aushadhi Dravya, like Maricha, Pipali, Sunthi, and then cook it till it becomes thick gruel. Sadhyam Chatupalam Dravyam Chatushashti Parejale Shodhanartha Nishishtena Yavagum Sadayat Ghanam. So in Madanapal Nighantu also it is explained that Yavagu Shadagune Toye Sannidha Viraladrava. According to Madanapal Nighantu, rice is cooked in 6 times of water, then it is called as Yavagu. And when it is cooked in 4 times of water, it is called as Vilepi. When it is cooked in 14 times of water, it is used. It is known as Peya when it is used along with the rice particle, and when the rice particles are separated and the only liquid is taken, it is called as the Manda. Yavagur, Grahini, Trushna, Jwaragni, Basti-doshini. These are the qualities of Yavagu. It is Jwaragni, Basti Shodhini, and Grahi also. So also one more important point to know about Yavagu is when rice is used to make this gruel, it is known as Yavagu. And when other ingredients like dal and moong and fruits and vegetables are used, it is known as Yusha. The Yavagu made from the broken rice is restrained for the people in action. It is not recommended, and Acharya has advised not to use it. The Yavagu, which is very thick and cold, and which has more rice and has sliminess, that is Pishchilata and Vishadaguna, and which is not pleasant to the heart in taste, it is considered as faulty and is again restrained for the patients. Ahastaharya peya sadyevagu parigraha. Due to the liquidity, the peya can't be eaten with the hands, and yavagu has the consistency so that it can be eaten with the hands. So it makes us to understand what should be the consistency for the yavagu. The components of the yavagu can be classified under the two categories. One is Virya Pradhan medicinal components, and the second one is Rasa Pradhan food components. The Virya Pradhana Aushadha Dravya can be classified further according to their Virya Bheda. That is Tikshna Virya, Madhyam Virya, and Mrudu Virya. Tikshna Virya, for example, Suddhi Pipali, Madhyam Virya like Bilva and Agnimantha, and Mrudu Virya like Amalaki, etc. So according to the Virya, the quantity can be used in preparation considering the Bala, Vaya, and Agni of the person in making the Yavagus. Now, here in front of you, there are 28 types of Yavagu mentioned by the Acharya Charak in different diseases. Shura Navashaka Yavagu, which in which Aharadravya is Tanduladik and Aushadhi Dravya is Pipali, Mula, Chavaku, Chitrakana. It improves the digestive fire, reduces the pain. Then the second one is Pachani Yavagu, which is the Tandula Adi is cooked in Mattha, that is Takra and Anara Rasa, which because of its Amla Rasa, it helps in digestion. In that, Aushadhi Dravya is used Kapitha, Bilvamajja, and Changiri. These all are, Changiri is also Amla Rasa Pradhana. So that is how it helps in digestion by its Rasa. The Grahini Yavagu also has Ahara Dravya like Tanduladik, and the Aushadhi Dravya is used is Laghu Panchamoda, and that is how it is helped in it helps in Vataja Atisar. Pitta Shleshma Atisar Nashak Yavagu contains Dadimarasa along with the Tandula, and in the medicines Shaliparni Bala Bilvamajja is used, and then it helps in Pitta Kapash Atisar. Then Rakta Atisar Nashak Yavagu. In that, half water and half ajadugdha is used to cook the tandula, and then Ribera, Utpala, and Nagarmutha, that is Mustaka, Prishniparni is used because of their cool and Kashaya Rasa. It helps in Rakta Atisara. Amatisara Nashak Yavagu, that is it is cooked in Dadim Rasa, and as it has Kashaya Rasa, the Aushadhi Dravya is used Ativisha and Sunti, and because of the Nagar, that is Sunti, it helps to reduce the Atisara. Then Mutra Krucha Nashak Yavagu, which is used, cooked with raba, that is Fanit, and Aushadhi Dravya is used is Gokshur and Kantakari. We know that Gokshur and Kantakari, Gokshur is a Mutral Dravya, and it helps in a Mutra Kricha. So next Yavagu is Kriminashak Yavagu, which is cooked in Mattha, again Takra, and the Aushadhi Dravya is used is Vidanga, Pippali, Mula, and Sajjik Shara, and that is how it is Krumigna. The medicines are Tikta Ushnavirya Dravya, Krumigna Dravya. The Pipasa Nashak Yavagu is cooked in Madhu. It is cooked, and after cooking, when it cools, the Madhu is added. Because Madhu is never heated, and the Aushadhi Dravya is used is Mrudvika, and that is Draksha, Anandamula, Laja Pippali, Madhu Nagarmotha, and it helps in Trishna Shamana. Vishanashaka Yavagu.
Doctor?
Next, Tanduladika is used, and the Bakuchi is used.
Hello, Doctor.
Yes.
Doctor, you are exceeding the time limit, Doctor. Can you speed up your presentation?
Yes, it is second last slide, sir.
Okay.
Yeah. So Bakuchi is used, and it helps the Visha. It helps to reduce the Visha effect of the Vishas. Bruhani Yavagu, which contains the Varaha Mansa, then Karshaniya Yavagu, Snehani Yavagu, Rukshani Yavagu, Shvasakashak Navagu, and as we know, the medicinal parts are used are the medicines which will help in that this particular disease. So these 28 types of Yavagus are these are very wonderful things because as we discussed above, the ahar plays very important role in the Vyadhi shaman, that is disease. And when the ahar itself becomes the aushadhi, then that is a very positive thing. The unique feature of Ayurveda in treating the disease is considering the diet to protect the Agni is very important. And all the medicines used in the 28 types of Yavagus are Vyadhi Virodhi, and therefore they are useful in the treatment of the diseases. It helps the patient to recover fast and other diseases also. Yavagus can be used with Yukti, with the above basic guidelines in other diseases also, which are not mentioned in above by Acharya Charaka. Thank you.
Thank you, Doctor. Next, I invite Dr. Darthi Budihal Bare for the paper presentation.
Yeah, I'm audible?
Audible, Doctor. Please share the screen, Doctor.
Okay.
Screen is visible, Doctor. Please start.
Okay. Slides are changing?
Yes, Doctor.
Thank you. Good evening all. I'm myself Dr. Dharti from the Department of Kaya Chikitsa Rasayana and Vajikarna. I'm here to present on a topic Garbhadhana Vidhi in regard to PCOS. Introduction. Preconception care is a set of interventions that are to be provided before pregnancy to promote the health and well-being of a woman and couples, as well as to improve the pregnancy and child health outcomes. It aims to improve the maternal and child health and prevent and control the diseases occurring at the various stages. To ensure that woman and her partner are in optimal state of physical and emotional health at the onset of pregnancy. In Ayurveda, it relates to the Garbhadhana Vidhi. Ayurveda describes the Garbhadhana Vidhi, which is the means of conception, as a set of ritual and guidelines to be performed before to conception in order to acquire the desired progeny. The preparation of achieving a healthy progeny starts before the selection of partner. It is said that the couple should be of different gotra, of proper age with maturity of all dhatu, and should not be suffering from diseases. Further, the couple should undergo shodhana therapies like vamana, virechana, and basti to ensure the shuddhata of bija, kshetra, and manas. In recent times, pregnancy complications are unpredictable as women is exposed to pollution, stress, hormonal changes, diet and lifestyle changes which affect the health of the mother and child. PCOS is one of the burning issue in women of childbearing age, with the prevalence rates ranging from 3.7 to 22.5% in India and 4 to 20% globally. PCOS is a group of disorders identified by clinically or biochemical abnormality of menstruation, hyperinsulinemia, and hyperandrogenism leading to infertility. PCOS in an Ayurvedic viewpoint, PCOS can be considered as Santarpanutta Janyavadi. Dushita Vata and Kapha dosha, along with irregular Ahara and Vihara, leads to disturbance in the enzymatic reaction, leading to incomplete metabolism and hormonal imbalance. This hormonal imbalance due to hyperinsulinemia and hyperandrogenism, which in turn leads to abijata or nashtartava, that is anovulation, or anarthava, amenorrhea, asrigdara, paving way to vandyatva. PCOS can be due to kapha avarna or involvement of kevala vata. Kapha avarna here we can consider as because we of our lifestyle or junk food, and kevala vata like when we are very anxious or like diet conscious, there will be a vata aggravation due to not taking of ahara, which will primarily cause obstruction of vata and pitta marga. Thus, release of mature ovum and menstrual blood is obstructed. PCOS and Garbhadhana Sambhava Samagri, how these are related. For achieving a healthy pregnancy, women should possess Garbha Sambhava Samagri, that is Ritu, menstruation period or ovulation, Kshetra, it is considered uterus, Ambu, nourishment, and Bija, ovum and sperm. Ambu punaraharo pakajo vyapi rasadhatu. Function of rasadhatu is prenana. Prenana refers to nourishment and normal functioning of system. Mother's nutritional status affects the pregnancy directly as well as the affects the fetus. Due to Mithya Ahara Vihara and Avara Ahara practices, there is reduction in Rasadhatu circulation and reduction in nutritional status. Therefore, it is important to restore the Rasadhatu in PCOS, which help in proper nourishment of the dhatus. Ritu, formation of garbha takes place in the ideal time and environment of the uterus. For sperm to fertilize womb, women should be in fertile period or ovulation phase. In PCOS, as there is no ovulation due to immature follicles, not able to release the womb to conception to occur, that is absence of pushpa. In preconceptional care, we can screen the women with PCOS and take appropriate measures for ovulation to occur. Bija. For healthy garbha to be formed, it is necessary that bija should be healthy in terms of quality and quantity, enriched with good qualities. Bijam pumsaho shukre bijam striya artava. It is quoted by Dhallana. Disorders of ovulation occur for about 30 to 40% of all cases of female infertility. Ovulatory dysfunction is seen in PCOS due to disturbance in HPO axis leading to anovulation. Hetam Garbhashaya refers to anatomic adequacy of the reproductive organs. It is necessary for the woman to maintain the healthy reproductive organs in PCOS, which shows changes due to hormonal imbalance. PCOS and mental health. For proper conception, Manas, that is even Acharyas claim that Somanasyam Garbhadharanam Shreshtam, that is calm mind is most essential factor for Garbhadhana. In women with PCOS, suffer from anxiety, depression, social phobia, panic disorders, etc. And the meta-analysis demonstrates significantly increased risk of depression, anxiety, bipolar disorders, OCD, and somatization in women with PCOS. These all can be managed by proper counseling and lifestyle modifications like yoga, pranayama, and dhyana. What line of treatment we can follow in PCOS to achieve healthy pregnancies can be lifestyle disorder, by changing the lifestyle, like lifestyle modification with yoga, pranayama, dhyana also. And as PCOS is one of the lifestyle disorders which can be managed by Nidana Parimarjana, as it is Santarmona Janya Vyadhi, Shodhana therapies like Vamana, Virechana, Basti treatments can be adopted based on the Avastha. Shamana Aushadhi and Rasayana to restore and maintain the normal physiology. Proper diet along with lifestyle modification with yoga, pranayama, dhyana will be more beneficial. Conclusion: quantum of preconceptional care is taken under Garbha Samskara and classics. Due to increased prevalence of PCOS, it is found mandatory for every couple to undergo Garbha Samskara therapy to achieve healthy and breast progeny, as Shodhana acts on dhatu level or DNA level. As studies shown that Shodhana like Vamana, Virechana, Basti act at dhatu level or DNA level helps in reducing the oxidative stress, acts on free radicals to achieve the good quality bija. Thank you. I acknowledge my guide, Dr. Asha Hermet ma'am and Reshma Salimani ma'am for the guidance.
Thank you, Doctor. Next, I invite Dr. Amrita Power for the paper presentation. Dr. Amrita, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
My name is Amrita Pawar, Associate Professor, Department of Shalakya Tantra in SPNH Ayurved Mahavidyalaya, Rahul. Sir, please share the screen.
Okay, Doctor. 1 minute. Hello, Dr. Amrita.
Sir.
Please start, Doctor. Please start the session.
Yes. The screen is visible. Hello, sir. Sir.
Hello, doctor.
Sir, is
My screen is visible, doctor.
actually no, sir.
Please check, doctor. Hello, doctor. The screen is visible, doctor.
Yes, sir.
Please chat, doctor.
Today's my topic is evaluation and comparison between Shankhadi Rasakriyanjan and Madhuanjan in the management of Avarn Shukla with the special reference to the corneal opacity. The purpose, the evaluation and comparison between Shankhadi Rasakriyanjan and Madhuanjan in the management of Avarn Shukla with the special reference of corneal opacity. The prospective design, the randomized interventional hospital-based and comparative study. The materials and methods used this study. In present study, 60 patients were randomized, selected and divided into two groups with 30 patients of each group. The group A patients were treated with the Shankhadi Rasakriya Anjan once a day in the morning for 15 days. And then second, group B were treated with the plain Madhu Anjan once a day in the morning for a period of 15 days. Subjective parameters like a pain of eyes and watery of eyes, visual acuity and objective parameters like a length of opacity and density of opacity were adapted. These were suitable gadgets to assess the result that were the scientifically analysis. Then introduction, sir. The Avarn Shukla is a common netra rog observed in the Shalya practice, which is caused due to the Abhishanda, Abhigatash, Dhum, Bashp, Atap Sevan, and the Mithyahar and Vihar. The main symptoms of Avarn Shukla with white patches in the Krishna bhag of the eye, the corneal ulcer, keratitis, then degeneration and injuries, and the surgical, the manifestation of the cornea, allergens like just dust, pollens, smoke, bright lights, and the chemical, the manifest white patches like nebula, macula, or leucoma in the corneal parts of eye. It contains the Shankhabhasma, Shuktibhasma, Drakshabhasma, and Yashti Madhu in Kataka Beach and Madhu. The Shankhadi Anjan made the considered better in management of Avarna Shukla because it's a Chakshusha Lekhan Vranalopan action of its contents. Therefore, this clinical study is planned to evaluate and compare the role of Shankhadi Anjan and Madhu Anjan in the management of Avarna Shukla, means corneal opacity. The materials and method of this study, the source of data, the 60 patients with classically features in Avarna Shukla were selected from the outpatients and inpatients department of Shri Vivekananda Nursing Home, Rahul. The selection of patients, the selection was done based on the clinical examination, a carefully clinical history of all those patients complaining the Strav, Vedana, means pain, were the considered. The patients were then subjected to the examination, and after establish the diagnosis, the patients were taken for the clinical studies. The study design, the group A, 30 patients were subjected for the Shankhadi Rasakriya Anjan, and other groups, group B, the 30 patients were subjected for the Madhu Anjan. The preparation of the drugs, the Shankhadi Anjan were prepared in the Rasashastra departments of SVNH Ayurved College, Rahuri, as per the following methods. The Shankhabhasma, Shuktibhasma, Draksha, Yashti Madhu, and Kataka Beach were taken in equal quantity and made into very fine powder and it will be kept in airtight container. On the day of Anjan, the powder will be taken from a drop and honey will be added to it and mixed well and to make the recipe Anjan. The methods of application of Anjana. In the morning hour, the patients were advised to sit comfortably and 2 drops of the Anjan were dropped each eyes. Then the patients were asked to close his eyes and rotate the eyes ball for the well distribution of the drugs of eye in the eye. When the lacrimation stopped, the eye were clean with sterilization of swab, and the patients were advised to take rest for a while and not to expose the dust, smoke, and bright light. Then group A, the patients of this group were applied with the Shankhadi Rasakriya Anjan once a day in the morning for 15 days. And second, the group B, the patients of this group were applied with plain Madhuanjan once a day in the for 15 days, morning for the 15 days. Then follow up, the patients will follow up at the regular interval of the 15 days after stop the treatment of periods of the 2 months. Then results got. The out of 60 patients in Avarna Shukla, the 40% were in the age group of 41 to 50 years, followed by the 35% patients, the age group 31 to 40. A higher prevalence was seen in male patients than female patients. Maybe because the male are in outdoor activity more than the female. However, if the study was carried out in larger sample size, could be concluded. Out of 60 patients, the 20 patients were doing the indoor occupational, while the 36 patients were doing the outdoor activities. The reason of increase the insides the outdoor occupant in exposure to heat, dust, smoke, and foam. What out of the 60 patients taken for the study, and the 40% were vegetarian and 60% were mixed diet vegetarian, mixed diet variety. Since the study sample is small, related with the diet. Out of 60 patients, the 60% had normal visual acuity and remaining 40% had a low visual acuity. Out of 60 patients, 60% had a Shukla in Dvipatala and 30% had a Shukla in Prathama Patala. And the remaining 10% Shukla were present in a Tritiya Patala. As per classics, in cases of the Prathama Patala, Avarna Shukla have the better prognosis than the Dvipatala Avarna Shukla, and the same provided in the study. In case of Vidhya Patal and Tritiya Patal, involvement received less improvement than the Prathama Patal in Avarna Shukla. Out of 60 patients in of Avarna Shukla, in 40% were have a chronicity less than 2 years. 35% have a chronicity in 2 to 4 years, and remaining 25% were having a chronicity more than 4 years. As per classics, long history have a bad prognosis. The same provided in the present study. The case of long history received less improvement than the case in short history. Out of 60 patients, Avarna Shukla 90% had a single Shukla and 5% affects the therapy on the individual parameters in both group A and B. The pain, watery, length of corneal opacity, and breadth of opacity and density of opacity. The both group have shown the satisfactory significant results in relief the pain, and there is a higher percentage of success rate. The thread pains of the Shankhadi Rasakriya Anjan than Madhu Anjan. The watery, the both group have shows statistically higher significant results in relief of watery. There is a higher percentage of success rate in treated the watery by Shankhadi Rasakriya Anjan than the Madhu Anjan. Length of lacrimal opacity, both groups have shown the statistically significant result in the relief of length of corneal opacity, and there is a higher percentage success rate with treated the length of corneal opacity by Shankhadi Rasakriya Anjan and Madhu Anjan. The breadth of opacity, the Shankhadi Rasakriya Anjan is provided the significant relief in the breadth of corneal opacity after the 15 days treatment. In this group, the 95% patients got mild relief in breadth of corneal opacity. On the other hand, the Madhu Anjan provided the significant relief in breadth in corneal opacity of 2.33% after the 15 days of the treatment. In this group, 60% patients got the mild relief in breadth of the corneal opacity. Then last one is the density of opacity. The Shankhadi Rasakriya Anjan provided significant relief in the density of the corneal opacity of 4% after the 15 days of the treatment. In this group, 80% patients got the mild relief in the density of the corneal opacity. On the other hand, Madhu Anjan provided significant relief in the density of corneal opacity of 25% after 15 days of the treatment. In this group, 40% patient got a mild relief in the width of corneal opacity. Conclusion. Based on all these details, it can be concluded that both the therapeutics selected of this study provided significant relief in signs and symptoms of the patients in Avarna Shukla, but on the comparison, it was found that the Shankhadi Rasakriya Anjan provided better result in comparison of the Anjan application with Madhu. Hence, it can be said that the Shankhadi Rasakriya Anjan has been effected relevant in Avarna Shuklam, which is one of the Kafash and Pittach Valley. The recommendation of the further study, it is recommended to the carriers to study the larger sample size, evaluation of the effects of the Shankhadi Rasakriya Anjan procedure on the different Raktaj and Kafash Valley of the Netra. Thank you, sir.
Thank you, Dr. Amrita. Next, I invite Dr. Megha for the paper presentation. Dr. Megha, are you there? Hello, Dr.
Hello, sir. Am I audible?
Audible, Doctor.
Sir, could you please share my PPT?
Okay, Doctor. 1 minute. Dr. Megha, please start the session, Doctor.
Okay. Namaste, everyone. Myself, Dr. Megha, first year PG scholar, Department of Panchakarma, Government Ayurveda Medical College, Bengaluru. I am here to present a topic, mode of action of Basti. Next slide. According to Charaka, Nabhi Pradesham Katiparsha Kukshim Gatva, Shakrit Dosha Chayam Vilodya, Samsnehya Kayam Sapurisha Dosha, Samyak Sukheneti Chayasa Basti. Here the Acharya explains that by samsnehana of the Sharira, the Basti which is administered reaches Nabhi Pradesha. By that, it does Vilodana of the Sakrit and thereby it does elimination of the dosha. So, Chakrapani, while commenting on that, samsnehana, he says, samsnehya kayam iti virya rupena charena kayam vyapya. By the virtue of virya, it spreads throughout the body and thereby brings about the action. Similar reference we get in Sushruta also. Similar Patantara it is available, that is Nabhi Pradesham sa Katim Sagatva Kukshim Samalodya, which is again stating the same. When we compare this with the modern science, it could be explained by expiratory mechanism. According to that, Niruha is hyperosmotic solution which causes movement of solvent from cell of the colon to lumen containing Basti Dravya, facilitates movement of endotoxin to lumen and thereby detoxification. Next slide, sir. According to Parashara, Moolam Gudam Sharirasya Siraha Tatra Pratisthita, Sarvam Shariram Pushnanti Murdhanam Yavadashrita. According to this, the Moola Siras of the Sharira is situated in the Guda Pradesha. When those Siras get nourished, it nourishes the whole body, which could be explained by gut-brain theory, that is, by similar to brain, enteric nervous system sends and receives impulses, record and respond to various stimuli. ENS works in synergism with CNS. Simulation with Basti may lead to activation of consent part of CNS, which precipitates result accordingly. Next it is Anvasana Basti. Nataila Danas Paramasti Kinti Dravyam Visheshena Samiranarte. Continuing the shloka, Mule Nishikto hi Yatha Drumasta Nilachada Komala Pallavagraha Kale Mahan Pushpa Phalapradasta Tatha Narasyad Anvasanena. Next slide, sir. Chakrapani commenting on this shloka, he says for Anuvasana, though some acharyas consider that the word taila as a sneha, but Chakrapani strictly says we should not use ghrita in place of taila. Instead, we have to use taila itself, as ghrita doesn't contain the vatahara property. According to Shweta, Pakvashaye tatha Shroonyam Nabhyadasthacha Sarvatah Samyak Pranihito Basti Sthane Shweteshu Tishtati Pakvashayat Basti Viryam Khair Deham Anusarpati Vrikshamule Nishiktanam Apam Viryamiva Dhrumam. According to this, Acharya says the Basti Dravya which is administered through Pakvashaya, it stays there for a few hours. By that, it nourishes the whole Sharira, which could be explained by absorption mechanism. Rectum has rich blood and lymphatic supply, and drugs can cross rectal mucosa like any other lipid membrane. Thus, unionized and lipid soluble substances are readily absorbed from rectal mucosa. A little quantity of short chain fatty acids, such as those from butterfat, are absorbed directly into portal blood rather than being converted into triglycerides. Modern aspects. Next slide, please. Anatomy of ileocecal junction. According to a study, the Basti which is administered doesn't cross beyond ileocecal junction. The reason when we look into it is the anatomy of ileocecal junction. Ileocecal junction contains ileocecal valve, which is actively closed by sympathetic nerves, which causes tonic contraction of ileocecal sphincter. It is also mechanically closed by distension of column. Function of ileocecal valve, it prevents reflux from cecum to ileum, regulates passage of ileus content into the cecum, and prevents them from passing too quickly. When we look into this, according to Acharya Charaka, he has quoted Nabhi Pradesham Katiparsham Kukshim Gatva. So we can correlate this with that of ileocecal junction. Next slide, please. Some other works on Basti. One work that is Pharmacodynamic Understanding of Basti, a Contemporary Approach. According to he has explained the three mechanisms, that is absorption mechanism, next is neural stimulation mechanism, and the third one is excretory mechanism. According to absorption mechanism, by using Triphala Kashaya, by adding biomarker gallic acid, they had administered Triphaladi Kashaya Basti. From that, they have concluded that rectum, which has a rich blood supply and lymphatic supply, by this, the drug cross rectal mucosa like any other lipid membrane. Similarly, unionized and lipid soluble are readily absorbed from rectal mucosa. Next is by neural stimulation mechanism, that is ENS is loosely connected with the central nervous system through the vagus nerve, and the internal viscera contains nerve fibers of autonomic nervous system, which is connected with the CNS. Next. The ENS also contains major neurotransmitters like serotonin, dopamine, glutamate, norepinephrine, and nitric oxide, which is similar to that of the neurotransmitters which are present in the brain. So, by which we can consider that brain is somehow connected with the ENS. Small brain proteins called neuropeptides, along with the major cells of the immune system, are also present in the gut. More than 500 million neurons present in ENS. Hence, it is also called a second brain. Next, it is vitamin B1 deficiency leads to myelin sheath degeneration and neurological disorders. So, by administering Niruha Basti, it showed decreased pyruvic acid level, which resulted in raised vitamin B1 levels, thereby again regenerating the myelin sheath and thereby resulting in curing the Vatavyadhis. Next, it is hit and run theory. It is not mandatory for a drug to stay in long time contact to receptor, like in case of proton pump inhibitor, where drugs interact and flush out from circulation, which is called a hit and drug module. Same module of pharmacodynamics may be hypothesized for Niruha Basti. Examples we have like omeprazole, reserpine, etc. Next, sir. According to Charaka, Matraya api abhyavahritam pathyam sannam najiryate chinta shokha bhaya krodha dukkha shaya prajagraya, which is again pointing towards the gut-brain axis itself. To conclude, everything explained in the classics has got its own importance in one or other way. Active principles of the Niruha Basti, drugs may be absorbed by active transport and diffusion. Sneha Basti and other nourishing Basti contains hypoosmotic solution facilitating absorption into the blood. Thank you.
Thank you, Doctor. Next, I invite Dr. Saudi for the paper presentation. Dr. Saudi, are you there?
Yes, sir. Am I audible?
Audible, Doctor. Please share the screen, Doctor.
Can you share the screen, sir, please?
Okay, Doctor. 1 minute. Hello, Dr. Saudi.
Yes, sir.
Please start the session, Doctor.
Okay. Good evening, everyone. Myself, Dr. Swati, and first year PG scholar, Department of Panchakarma, Government Ayurvedic Medical College, Bangalore. And I am presenting on the topic mode of action of Svedana Karma and its therapeutic benefits. So, Svedana Karma is nothing but application inducing sweating by applying external heat. Basically, it can be classified into Bahya and Abhyantara. And today I'm dealing with the Bahya Svedana. It is, I'll be explaining mode of action of Bahya Sveda, that is Sarvanga and Ekanga, and Svedana as Purva Karma, Pradhana Karma, and Paschat Karma, and Snigdha and Ruksha Sveda. So, coming to modern aspects of sweating, sweat glands are of two types, that is eccrine gland and apocrine gland. Eccrine glands are distributed throughout the body and they open into sweat pores, and they play a major role in temperature regulation. Whereas apocrine glands, they are situated in certain areas of the body like axilla, pubis, areola, and umbilicus, and they open into hair follicles. And they are under are under hormonal control. Next, coming to composition of sweat. Sweat basically composes of minerals like sodium, calcium, potassium, magnesium, and there are traces of metals which is excreted while sweating like zinc, copper, iron, chromium, nickel, lead, mercury, and cadmium. So, mode of action, mechanism of sweating. On application of external heat, there will be increase in body temperature, which in turn stimulates thermoreceptors in heat loss center in preoptic nucleus in hypothalamus, which in turn stimulates the autonomic nervous system, which in turn releases sympathetic acetylcholine through sympathetic cholinergic fibers, which these acetylcholine will then stimulate the sweat glands in dermis and then resulting in production of sweat. Coming to the physiological aspects of passive sweating, the first one is hemodynamic changes. The studies have shown that on exposure to long-term sweating, there will be reduction in systemic blood pressure. A study has been conducted in two groups, that in non-hypertensive group and the hypertensive group, and it has shown that on continuous exposure to several sittings of Svedana Karma has led to lowering the blood pressure. And next is the detoxification. As we have seen, the sweat contains through sweat, heavy metals are excreted, and the metals like mercury, which is responsible for degenerative diseases like Alzheimer's, are excreted through sweat. And next is increased caloric expenditure. Glucocorticoids enhances the catabolism of protein and fat and thereby helping in reduction of weight. Next, coming to the increased vasodilation, it is increased temperature brings vasodilatation through direct reflex action. That is, superficial heating causes cutaneous which activates the cutaneous thermoreceptors, which then releases bradykinin and nitrous oxide, which further there will be relaxation of smooth muscles of vessel wall, bringing vasodilatation. And changes in nerve conduction, that is, for 1 degree rise in temperature, there will be increase in nerve conduction velocity by 2 meters per second. So increased temperature increases the nerve conduction velocity and its firing rate. Next is increased pain threshold. Sweating releases endorphins in the brain, which are natural pain relievers, and also vasodilatation increases blood flow, causing increased oxygen and nutrition supply, speeding up the healing process, and also relaxes the muscle through which pain is managed. Next, coming to effect on collagen tissue. Increased temperature increases the collagen tissue extensibility, resulting in relieving of joint stiffness. Next is increased rate of breathing. Increase in temperature causes rapid oxyhemoglobin dissociation and metabolism activation, resulting in increased breathing. Next, coming to the therapeutic benefit of Samyak Svedana. According to Charaka Sutrasthana, It is said that Shita Shula Vyaparame Stamba Gaurava Nigrahe Sanjate Mardave Svede Svedana Viratir Mataha. Similar explanation is also seen in Sushruta Chikitsa 32nd chapter and also Sharangadhara Uttarakanda, where he adds Deep Tagna. It can be understood as increased body temperature relieves the symptoms of cold, and relief of pain will be seen, reduction of muscle spasm, and increase in joint mobility, and increased appetite. Next, coming to mode of action of Svedana as Purva Karma. Prior to every Shodhana therapy, Svedana is done. So, Sneha Klina Dhatu Samstascha Doshaha Swastanasta Echa Margeshu Linaha Samyak Svedai Yojitaiste Dravatvam Prapta Koshtam Shodhane Yantyashisham. Similar explanation is seen in Astanga Hridaya Sutrasthana 17th chapter also. It can be understood as excretion of waste products from the tissue fluid into the venous blood vessels happens due to difference in the net pressure. That is, venous blood pressure is 10 mm of Hg and osmotic pressure is 25 mm of Hg, where there is 15 mm of difference of 15 mm of Hg. Waste products are drained away into the lymphatic capillaries, which are again returned to the bloodstream through thoracic duct and right lymphatic duct, which opens into subclavian vein. Svedana Karma hastens this process by increasing the permeability of the capillaries and bringing the morbidities into extracellular fluid and then to Kosta, which is eliminated through Shodhana Karma. Mode of action of Svedana as Pradhana Karma. Here the benefits which we discussed above has been summarized. It is Agnidiptim, Madhavam, Kaprasadanam, Bhakta Shraddam Cha Srotasam Nirmalatvam, Kuryat Svedo Hanti Nidram, Satandram, Sandin Stabdhas Cheshta Yedashu Yuktaha. Mode of action of Svedana is Paschat Karma. Here, Svedana is done as Paschat Karma in case of Hiteshalye and Mudagarbhanupadravat and Samyak Prajate Kale. Here, the mode of action is by inducing sweating, reduces pain by increasing body's production of natural pain relievers, that is endorphins. And Svedana is Purva and Paschat Karma. Svedyaha Purvam Cha Paschatcha Bagandhara Ashas Tatha Ashmarya Chaturul Jantuhu. Here in Bagandhara, Ashas and Ashmari, Svedana is done as Purva and Pradhana Karma. Here also the same mode of action, that is relief of pain and relaxation of muscles is seen through sweating. And Sarvanga versus Ekanga Sveda. In Sarvanga Sveda, generalized effects of Svedana, which already has discussed, will be elicited. And Ekanga Sveda, localized effect of Svedana will be seen. And then Snigdha versus Ruksha Sveda. Here, before understanding we have to understand the structure of cell membrane. According to the fluid mosaic model proposed by Singer and Nicholson, bilipid layer of phospholipids in which cholesterol and proteins are embedded. Phospholipids contains a hydrophilic head and a hydrophobic tail. Phospholipids are found close together when it is cold, and when it's hot, they move apart. The lipid bilayer has dynamic properties such as flexion, rapid internal rotation, lateral diffusion, and flip-flop motion. Transfer of lipid molecules from one side of bilayer to the other. All the motional properties are temperature dependent and can be easily increased many folds by application of heat. The active component of the drug are transferred into lipid media while preparing Ghrita or Thaila so that it can passively diffuse the cell membrane during Svedana Karma. Sagni versus Niragni Sveda. New researchers have found that heat therapies like sauna bath mimics the same effects as low to moderate intensity aerobic exercise such as walking, jogging, and cycling. As in Sagni, in Niragni also temperature regulation mechanism plays a role in the mode of action. Conclusion: Svedana Karma is a procedure in which sweating is induced by heating the body. It is done as Purva, Pradhana, and Paschat Karma, each having different therapeutic effects. Scientific research studies could be performed to understand various beneficial effects of Svedana Karma as per disorder, as well as different types of Svedana Karma. Thank you.
Thank you, Doctor. Next, I invite Dr. Anjani Espai for the paper presentation.
Good evening, sir. Am I audible?
Audible, Doctor.
Okay, I will be sharing my screen, sir.
Okay, Doctor.
Sir, is it visible, sir?
Not visible, doctor.
Okay.
Now visible, doctor. Please
Now,
start.
okay. Okay. Good evening, everyone. I am Dr. Anjani Espai, first year Panchakarma PG scholar from Government Ayurveda Medical College, Bangalore. My presentation is a review on mode of action of Shodhana Nasya of Jimutaka in Koshta Shakashrita Kamala. Coming to Kamala, the Kamala is derived from the dhatu Kamo, which means luster, and this is the disease where the luster of the skin is hampered, hence the name Kamala. And Kama also refers to the desire. So in Kamala, the Bhaktadbi Lasha or the desire to take food is hampered, also why it is known as Kamala. Coming to Nidana, Pandurogi tu yo atyartham pittalani nifevate, tasya pittam asragmamsam dagdva rogaya kalpate. So the Pandu, when Pandu Rogi does indulges in Pitta Vardaka Nidana, it leads to Kamala. But when we refer to the Chakrapandika, it says that Iha tu Pandurogigo api bhavet, Pandurogo vina api bhavet. That is, Kamala can occur with or without Pandu. When we look into the shloka of Pandu Nidana, we can see the following Nidana, the ones which I have highlighted, that is Kshara, Amla, Lavana, Atyushna and Vidagda. These are also the Nidana that are seen in the Rakta Dushtikara Nidana as mentioned in Vidhishonitya Adhyaya. And it is mentioned that Pradushya, Kafavata, Asrak, Twak, Mamsani, Karoticha. So the Sthana Samshraya takes in Twak and Mamsa. The Samprapti is as follows: Pitta Vardaka Nidana leading to Pitta Prakopa and Rakta Mamsa Dushana leading to Kamala. So Bheda, based on Nidana, it is Swatantra or Paratantra. Swatantra Kamala is the one which occurs without Pandu as a precursor, and Paratantra occurs after a sequel of Pandu. And based on Ashraya, it is Koshta Shakashrita Kamala or Bhahupitta Kamala and Shakashrita Kamala or Swalpa Pitta Kamala. Lakshana, Haridra Netra, Sabrisham, Haridra Twak Nakhananaha. There is Haridra Varna of Netra, Twak Nakha, Anana, etc. Rakta Pita Shakran Mutra. Bheka Varna, the Twak becomes Bheka Varna. Bheka is the frog that is seen in Varsha Rutu. Hatendriya, Indriya Daurbalya is seen. Other symptoms are Daha, Avipaka, Daurbalya, Sadhana, Aruchi, etc. Jaundice, coming to the contemporary signs, jaundice, even though Kamala is a disease, jaundice is more of a sign. It is the condition where yellowish tinge appears on skin, mucous membrane, whites of the eye, etc. Closely associated with hyperbilirubinemia, where the serum bilirubin levels are elevated in the blood. Even in modern science, jaundice or hyperbilirubinemia is explained under three levels or three stages based on the hepatic system. This prehepatic, intrahepatic, and posthepatic. Prehepatic can involve causes related to the blood or any defect in the blood, such as ineffective erythropoiesis or hemolysis, as seen in thalassemia, pernicious anemia, etc. Intrahepatic will involve causes from the biliary system, such as hepatitis, cirrhosis of the liver, or biliary obstruction, that may be tumors of the liver, intrahepatic gallstones, which are very common. Coming to posthepatic, where the cause lies completely outside of the biliary system, such as cholelocholithiasis, inflammation, malformation of biliary tract, tumors of pancreas, etc. Chikitsa of Kamala. The very infamous quote from Charaka Samhita goes that Samshodhyam Rudubhistikte Kamalitu Virechane. So Kamala Rogi should be subjected to Virechana, and that is also something that is widely followed. So as my presentation is on Nasya in Kamala, let us see where the reference is from. So it is from Chakradatta Pandu Adhikara. Nasyam Karkota Moolam va Greyam va Jalini Phalam. So Karkota Moola and Jalini Phala are also the drugs that are mentioned in the Cucurbitaceae family, same as that of Jimutaka, that is the main drug I've considered in this presentation. In Kamala, we can also give Jimutaka Phalanasya in Avapidana form or Pradamananasya form, both of which are Shodhana types of Nasya. Treatment of jaundice. even in modern science, based on cause. Prehepatic involves correction of the pathology in blood. So intrahepatic, abstinence from alcohol in ALD and liver cirrhosis, beta blockers, IV antibiotics and antiviral medicines in hepatitis, antihistamines in increased itching, liver transplant if it goes to a stage of carcinoma. Coming to post-hepatic causes, surgery in cancer of pancreas and cancer of bile duct, biliary drainage. So now let us look into nasya. Aushada siddha snehova nasikabhyam diyate iti nasya. The procedure where medicine is installed through the nasal route is nasya. It is of 5 types: navana, avapidaka, mapana, dhuma and pratimarsha. Nasya karmukata. Acharya Vagbhatta mentions that nasya aushada reaches Shringataka marma and stimulates Mastishka. It spreads through the siras and causes apakarshanas of dosha and expels them. Now, if we look into the modern contemporary explanation of how nasya may act, it is because of the 3 pathways: vascular, neurological, and diffusion through nasal mucosa. Vascular pathway, going from step 1 to step 5, pooling of nasal venous blood into facial vein, then pterygoid plexus, cavernous sinus, and finally into intracranial circulation. Diffusion through nasal mucosa. Lipid-soluble substances have greater affinity for passive absorption through cell walls of nasal mucosa. This is more applicable when the nasya dravya is a sneha nasya, as in case of grutta nasya or taila nasya. Coming to the Shodhana form of nasya, non-polar hydrophobic molecules diffuse through the lipid bilayer of plasma into and out of the cells. Neurological pathway, which might be the most probable and most applicable kind of mode of action in this type of Shodhana nasya. So peripheral olfactory nerves in the nasal cavity are chemoreceptor in nature, and they are connected with higher centers of the brain. So when the Shodhana nasya is administered, these chemoreceptor olfactory nerves stimulate the higher centers of the brain, that is limbic system and hypothalamus. So just the stimulation of hypothalamus is not sufficient to explain the action of nasya. There should in turn be a relation between the higher centers of the brain and the gut or the hepatic system. So hypothalamus controls liver functions by neural and neural endocrine connections. After receiving information from afferent nerves, the hypothalamus sends signals to the peripheral organ, including the liver, to keep the homeostasis. So when we talk about homeostasis, every function of every organ is included. So even the biliary functions and the production of bile may be included under homeostasis, and thus there is a relation between the hypothalamus and the liver homeostasis. So major areas of the hypothalamus, there are 3 areas: lateral,
Doctor.
medial. Hello, yeah.
Doctor, time is exceeded, doctor. Can you speed up your presentation?
Sure. Also, another study which was conducted in Tokyo, where there was an invasive procedure done to drain the bile through the nasal route. So if invasive procedure can be done, then nasya is a non-invasive procedure where bile is excreted through the nostril. Coming to Jimutaka, it is Katutikta Rasa and Laguruksha Guna, Ushnavirya, Katuvipaka. It is Tridoshahara, Vamaka and Vishagna. It is indicated in Kamala by Raja Martanda, Kayadeva Nigantu, Raja Nigantu, etc. Another study shows that when Jimutaka nasya was given in jaundice, it causes irritation of nasal mucosa, increase in local circulation, and because of the increased secretions, the bile was excreted through these secretions. These are the other related articles. Thank you.
Thank you, doctor. Next, I invite Dr. Priyanka Kalal for the paper presentation. Dr. Priyanka, are you there?
Yes, sir. Am I audible?
Audible, doctor. Please share the screen, doctor.
Okay, sir. Is it visible, sir?
Yes, doctor. Visible. Please start, doctor.
Namaste, myself Priyanka Kalal, first year PG scholar, Department of Panchakarma from GMC Bengaluru. My topic is an understanding of probable mode of action of Pindasveda. Definition of Pindasveda, Tatra Vastrantaritairva, Avastrantaritairva, Pindair Etoktair Upasvedanam, Sankarasveda iti Vidyat. The drugs are made into Pinda form, that is paste form, and it is used for Svedana Karma either by direct applying over the body or by wrapping it in a cloth. According to Kashyapa, he states that Payasaihi Krusharaihi Mamsaihi Odanaihi Trikatorakaihi Usnaihi Salavanaihi Snehai Ambaras Tataiha Sukaihi Kindvai Atasi Dadi Kshira Samyuktaihi Pindakaihi Krutaihi Sthana Svedam iti Michanti Sankara Sveda Uchate. Introduction of Svedana Karma. Svedana is a procedure which is most commonly used as Purva Karma before any Shodhana therapy and after Snehana. It is also an independent therapeutic procedure for the management of various diseases, especially the one which involving Vata and Kapha dosha. Svedana relieves from stiffness, heaviness and coldness in the body, and that induces Sveda. Pindasveda falls into the category of Tapasveda of Sushruta Samhita and Sankarasveda of Charaka Samhita. Probable mode of action. According to Sushruta Sharirasthana 9th chapter, he states that Tiragananam tu Chatusrunanam Damaninam Ekaika Shatada Sahasrada Cha Uttaruttaram Vibhanjante Tats Asankheya Tabiridam Shariram Gavakshitam Vibadda Matatam Cha Tasam Mukani Romakupa Pratipadani Yahi Swedanam Abhi Vahanti Rasam Cha Abhi Tarpayanti Antaha Bahischa Taihi cha abhenga parisheka avagaha alepana virannantaha shariram abhi pratipadanti tvachi vipakmani taraiva cha sparsham sukham asukam va gruhinite. In this shloka, Sushruta described that three types of damanis in Sharira, that is Urdhva, Adhoga and Tirek. Tirek damanis are of 4 types, of which each type is late subdivided into 100 and later in thousands of it. Its subparts and later these damanis are infinite in numbers. Distributed all over the body, these damanis get bound to Romakupa at the end. These damanis functions as channels and carriers of Sveda. In the above shloka, Acharya Dallana has stated that these damanis are Abhyantara and Bahya channels to Dhatu. Initially, these damanis carries Paripakva rasa from the body to Tvacha, thereby providing Santarpana from body to Tvacha. While in Pindasveda, the medicaments used there will be then absorbed by Brajakagni at Tvacha, and hence after the Pachana, the damanis then carries these Snehana to the targeted Shrotas, thereby providing Bahya Abhyantara Poshana to Shrotas. Similar concept could be applied for Pindasveda. When the pottal is applied on the body parts, the drugs get absorbed into the damani, apparently reaches the Shrotas, thereby leading to Santarpana. The contents of Pindasveda are, when processed, gets lipid soluble. Since the biological membrane has affinity to lipids, the drugs diffuses more, leading to more absorption of drugs from the skin membrane. Pindasveda is carried out for at least 20 to 30 minutes. During this process, the duration of drug and the frequency of the drug on the skin is more, which leads to the maximum absorption of the drugs. Mode of action in modern view. Svedana karma produces heat stress. It stimulates the sympathetic stimulation. Further sympathetic stimulation leads to secretion of adrenaline medulla and adrenal cortex. Adrenaline medulla further secretes adrenaline and noradrenaline. These act as a counteract the vasodilation effect of heat by producing vasoconstriction. And again, adrenal cortex secretes glucocorticoids. The action of these glucocorticoids are heat production, which can lead to calorigenic action. It can be correlated with Shetagna property of Svedana karma. And on GIT, it releases mucus and pepsin. It enhances the appetite, that is Kshuddha, and enhances Pitta and Agni. Thereby, it does the Amapachana. And again, it enhances the catabolism of protein and fat, which leads to weight loss, that is Guruta and Medakshaya. It can be considered as Kafakshaya. And it again, acts as anti-inflammatory, reduces stiffness, pain, and swelling, subsides thumb and shula, thereby pacify the vata. Understanding of Valuka Sweda. Silica is the main constituent of the Valuka. Being a bioceramic, sand emits far infrared energy when being heated during the Svedana procedure. On penetration through the skin, it expands the capillary vessels and helps in elimination of toxin and metabolic waste. Far infrared facilitates the generation of nitric oxide, which is responsible for regulating the blood circulation. Micro vibrations are produced as it excites the molecules. Through this process, vasodilation occurs, which in turn improves the blood flow in the area. Hence, vital nutrients and oxygen required are restored in the affected part. The mechanism coincides with the prescribed definition of Svedana, that is, Svedana karma eradicates Stamba, Gaurava, and Shetagna. Importance of Svedana karma. In Charaka Siddhistana, he states that Ardram kastam yata vanir vishandayati sarvataha tata snigdasya vaidoshan svedo vishandayat stiran. When the wet wood is set into fire, the liquid will ooze out. Similarly, in Snigdha Sharira, after giving Svedana, the dosha will liquefy. Next, Klistam Vaso Yatoklesha, Malaha Samshodate Ambasa, Sneha Svedais Tatoklesha, Shodate Shodanait Malaha. When the dirt cloth is set into, when it is washed with water and soap, the doshas will get evacuated. Similarly, in body, after Snehana and Svedana, the Utklesha, the dosha will be eliminated easily. Sneha Svedavana Vanabesya yastu samshodanam pibe daru shushka mivaname dehastasya vishirate. If the shodana is administered without giving snehana svedana to the body, it will destroy the body like daru shushka vinamana. Conclusion, as Svedana is the Bahir Parimarjana Chikitsa and one among the Shad Upakrama, it has wide scope in the management of disease. Among the external mode of treatment, Pinda Sveda is considered as the best mode of management in Vata and Kaphaja disorders. Thank you.
Thank you, Doctor. Next, I invite Dr. Suresh Babasahib for the paper presentation. Dr. Suresh, are you there? Hello, Dr. Suresh, are you there? Okay, next I invite Dr. Anita for the paper presentation. Dr. Anita, are you there? Dr. Anita Essen, are you there?
Yes, sir, I'm there.
Okay, Doctor. Please share the screen, Doctor.
Sir, can I wait for 1 minute? I'm working on that.
Okay, Doctor. Doctor, you have any problem with screen sharing, Doctor?
Yes, sir. Can you share the PPT, sir?
Okay, Doctor, 1 minute. Dr. Anita, please start the session, Doctor.
Yes, sir. Good evening, everyone. Myself, Anita Essen, first year PG scholar, Department of Panchakarma from Government Ayurveda Medical College, Bangalore. Today's my topic is physiological effect of Takradhara in Ekakushta with respect to scalp psoriasis. Next slide, sir. Coming to the psoriasis, it is a non-infectious chronic papilloscomus T-cell mediated inflammatory skin disorder and is one of the most common skin disease. Gender, it equally affects the male and females. Age, it occurs in 2 peak of ages. early onset at the age of 16 to 22 years with a positive family history. It has increased prevalence of HLA group CW6, and later onset at the age of 52 to 60 years, and there is no HLA association. Psychodermatology. Stress is one of the best known trigger factor for the psoriasis. Anxiety might occur in the psoriatic patient due to disfigurement, stigmatization, and chronic pruritus. Psychological stress may also play a role in the exacerbation of psoriasis by dysregulation of the hypothalamic pituitary adrenal axis and peripheral nervous system and immune system. Skin cells also express various neuropeptides and hormones in response to stress, including the fully function analog of the HPA axis. The deterioration of the psoriatic lesion is accompanied by the increased production of inflammatory mediators, which could contribute to the imbalance of the neurotransmitters and the development of the symptom of depression and anxiety. Next slide, sir. Coming to the pathology, due to the mental health condition and experiencing the trauma, patient develops the anger and frustration that impact on the psoriasis, thus leads to the sensory symptoms like hypervigilance to the skin, increased itchiness, compulsive picking of the skin, feeling incorporate difference, and thus leads to the psoriasis is worsens. Next slide, sir. According to Ayurveda psychodermatology, Tatrekam Sparshanam Indriyanam Indriya Vyapakam Chetaha Samavayi Sparshanam Vyapneti Vyapakamiti Cha Chetaha Tasma Sarvendriyanam Vyapaka Sparshakruto Yo Bhavati Shesha So Anupashayat Panjavida Trivida Vikalpo Bhavati Asatmendriya Artha Sanyoga Satmartha Hi Upashayartha. That means out of all the sense organs, skin alone pervades all the sense organs and it is associated with mind. Manha Purasarani Indriyanani Arthagrahanani Samarthani Bhavanti. That means sense organs are capable in perceiving the object only when they are associated with mind. According to Bela Samhita, Chakshu Vaishoshiko Nama Ya Atma Manas Sannikarsha Jnanam Udirayitva. Buddhi Vaishoshiko Nama Yo Bru Madhyo Shungatakasya Susukshman Arthan Adhyatma Krutan Gruhanani Jnanena. Next slide, sir. That means affect and alochaka pitta. Alochaka pitta are two types, Chakshu Vaisheshika and Buddhi Vaisheshika. Chakshu Vaisheshika located within the eyes and maintains its well-being. And other is the Buddhi Vaisheshika, the part of alochaka pitta which has its connectivity with the higher center of the brain and thus monitors the higher function like intelligence, memory, etc. Control of governing of the doshas, pranavayu, sadhaka pitta and tarpaka kapha. The integrity of the functioning of these three subdosha is the key for the perfect body and mind health. Murdi gunas, Abhyanga, Parishechana, Pichu, Shirobasti, Vidya Chaturbeda, Murdani, Tailam, Apyati Gunam, Cheta Kramottaram, Shirosheka indication, Parisheka, Arushika, Shirastoda, Daha Paka Vraneshu, Arunshika, Shirastoda, Daha Paka Vraneshu to Parisheka, according to Ashtanga Sangraha. Preparation of the takra in takradara, taken 80 karsha of Shuddha Prakirna Amalaki and add 18 kudava of jala and reduce to 1/6 kashaya. When kashaya is cooled, add equal quantity of the takra to this. Another method of takra preparation, this is Potali method. Preparation of takra, 2 prasta of cow's milk is mixed with the 8 prasta of water and boiled with 2 pala of cleaned crushed musta, suspended into the liquid in a bag of thin cloth. It is reduced to the quantity of milk. The bag medicament is squeezed well. After the cooling, this processed milk is fermented overnight and decoction of 4 pala of amalaki is prepared by cooling it with the 4 prasta of water and reduced to 1 prasta. This decoction is mixed with the prepared curd and churned to derive the buttermilk. This buttermilk is used as for the dara. Drugs used in the takra dara. In kapha predominant condition, musta can be used. Pitta predominant condition, ST madhu. According to doshas, balaka, ushira chandana drugs can be used. And according to the condition, kushtagna and kandugadravya can be added to the takra preparation. Next slide, sir. Takra guna, size pancharasa lavana varjita, guna, lagu and vikasi ruksha guna, ushnavirya, madhra vipaka. It is Sridoshahara, mainly Kapavatahara. Next slide, sir. Mustaguna. Musta having the Tikta Kashaya Katurasa, Lagu Ruksha Guna and Katuvipaka, Shita Virya and Kapapittahara. Amalaki Guna, it is Pancharasa and Lavana Varjita, Guru Shita Guna and Madhura Vipaka, Shita Virya and Tridoshahara. Probable mode of action of Takradara on psoriasis. Takra contains the large amount of lactic acid. This acid is used to moisten and lessen the plaques. Lactic acid is a good vehicle for the transdermal absorption. Musta has protein glycation inhibitory, anti-inflammatory and antioxidant activity. Glycation has role in the production of inflammatory cytokines. Amalaki fruit contains the ascorbic acid, which has the antioxidant activity and immunomodulatory effect. Scientific research on Amalaki extract shows the inhibited cell proliferation, thus induces the apoptosis and increases the reactive oxygen species production and controls the scaling. Effect on chakra. Shirodhara may stimulate the chakra and they improve the function of mind. According to several spiritual texts, the center of the forehead is said to be the third eye, which is connected to the pineal gland as several blood vessels and capillaries. Pineal gland situated in the root of the third ventricle under posterior part of the corpus callosum, responsible for the rhythmic changes in the body, mood changes, sleep promotion. Yogic tradition refers to this third eye as the Agnya Chakra. Focusing on the Agnya Chakra during meditation with closed eye leads to the psychosomatic harmony. Action of Shirodhara based on the asana involved in the procedure. Posture of Shirodhara is similar as that of the Shavasana. This is one of the complete relaxation procedure mentioned in the Yoga Shastra. Complete mental relaxation decreases the somatic symptoms because mind and body are interconnected. Hence, this posture may add the benefit. Previous case study done, the clinical trial has been carried out in 16 patients in Group A Takradara, 17 patients in Group B Virechana. In Group A, Kandu, Matsya Shakulopanam showed the significant result. Conclusion, action of Shirodhara has been hypothesized on the basis of stimulation on pituitary gland and nerve ending of the skin, which in turn stimulate the CNS system. Incorporation of the hypothetical aspect of Manomaya Kosha, Chakra, Marma and Shavasana posture would certainly help. Thank you.
Thank you, Doctor. Next, I invite Dr. Akshada for the paper presentation. Dr. Akshada, are you there? Dr. Akshada, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Yes.
Screen is visible, Doctor. Please chat.
Visible, no? Okay.
Yes, Doctor, visible.
Okay. Good evening, everyone. Myself, Dr. Akshada Chavan from YMT Ayurvedic Medical College. My topic of presentation is perspective study on Vatikalpana with special reference to Yakrut Pillari Lohavati. Just go through with the introduction part first. Vatikalpana plays an important role in pharmaceuticals of Ayurveda owing to many advantages like easy administration, palatability, convenient form dispensing, transporting to the medicines potent for long life and its quick action. It is prepared with the powder of raw drugs triturated together with the certain kashaya or juices or swaras or even in the honey and medicines are prepared in the form of pills or tablet. It is an outcome of a kalpana among the 5 fundamental preparations of the Ayurveda pharmaceutical science, like which are called as a Panchavid Kashaya Kalpana. Then aims and objective of my topic is preparation method for Yakrut Pillari Lohavati. And second is review on different dravyas used in Vati and also its properties and actions. I am taken this reference from the BHESHAJA Ratnavali, from the Yakrut Pliha Dikar Rog. Then which contains like Hingu Sambhavam Sutam. Hingu Sambhavam Sutam means like Hingulotta Parat. Then Gandhak Luha Abrakam Tulyam. Dviguna Tamrantu. 2 parts of Tamra, Shila, Manashila, and the Rajni Tata. Rajni means the Haridra. Jaipal, Tankanasha, Shila Jatum, Samam Rasat, Etat Sarva Samahitam, Charunikatam, Vimashritam. Then the Danti Chitraka, Nirgundi, Trishunam Tata. Trishun means Shuntha Marich Pipali, Aikam Runga Rajasha, Rase Shesham Pratak Pratak, Bhavaitva Vati Kuryat, Vadara Stigma, Bishak, Lihan Yakrut Chaiva, Chirakalangu Bandhinam. Ekajam Dvandvaj Chaiva, Sarvadosha Bhavam Tatha, Hanyad Udara Anaha Jwaram Pandusha Kamalam. Then contains, these are the contents like Hingulata Parat, Gandhak, then Manishila, Shuddha Jaipal, Abrak Basma, Loha Basma, Shuddha Dankan, Shuddha Shilajit, and then Haridra Churna. These are all taken in the equal quantity, like each of one tola. In Tamra Basma in double, 2 parts, like 2 tola, like 20 grams. 1 gram is approximately, 1 tola is approximately 10 to 12 grams. Like these are the bhavna dravyas, Danti, Adrak Swaras, then Nirgundi Patra Swaras, Tivrutta, Shuntha Marich Pippali, like that is a Trishun, and then last is Bhrungaraj. Then method of vati preparation. First we will prepare a Parad and Gandhak Kajali in Khanva Yantra. Then after mixture of that complete mixture of Kajali, then add 6 basmas, which I have mentioned in the last slide, like Tamra Basma, Manishila, Shuddha Jaipal, Abrak Basma, Loha Basma, and Shuddha Tankan, Shuddha Shilajit. Then after mixing of the bhasmas, then add one by one separately add 6 bhavna dravyas, Danti, which will be in the swaras or quat form, Danti, Adrak swaras, Dirgundi, Patra swaras, Tivrutta, Shuntha Marish Pipali, and Bhrungaraj. After complete titration of hormonal drugs, then after completing the trituration, then make a, like when it is not sticking to the hand, then make a 2 size of rati vatis and make dry it under the shade, then store in a container. Importance of bhavna, like why we are doing the trituration, what it affects the pulp. Then trituration of herbal powders with kajali draws out the structure of compounds as a different layers of herbal therapeutic standards with inert molecular layer of kajali, and this formation chemically organize alternate layers of kajali and herbal compounds continuously, then proportionally with that of the continued mardan. It increases the potency. Bhavna will increase the potency of the medicine. It directs medicine and helps it rapid uptake of the towards affected organs. And the doses will be 2 rati. Then duration of maybe like 3 months to 9 months. Indication is pliha rog, then yakrut udar, shwas kas, visham jwar, then shot udar anah, kamla pandu jwar. And these are the karma and uses of each bhasmas. Most of the bhasmas are action is like Agni Mandya, Pandu, then karma and uses useful in the Pandu, Anaha, Jvar, then Amdosh, Nashak. Then these are the mode of action of that all the bhasmas. Like Abrak increases the Rakta Dhatvagni, Loha Tamra increasing the Rasa Dhatvagni, Loha and Mashik increases the like Rakta Vardhan and gives strength to the Rakta Dhatu. Tamra is a Yakrutgami, Tamra and Loha is both are act as a Plihagami, then Tankan is a Dipan, act as a Dipan, then Shilajit Abrak Suvarna Makshik, they act as a like Rasayana, and Tamra Loha Abrak Shilaj, which are the all are the Snigdha Gunatmak that may act on the Yakrut Pliha. These are the karma rasavirya vipak of the bhavna dravyas. Most of the dravyas are katu rasatmak and ushna vidyatmak. And then most of it is like Bhedan, Pitta Shamak and Yakruto Tejak action. So they may be acting on the Yakrut and Pliha. Then mode of action of Yakrut Plihari Lohavati. Kajali act as a Shushma Srutogami, and sustained release of Kajali compounds in GI tract undergoes a process of adsorption and hence act as an GI stimulant. Mostly all the bhasmas are acting as a prasadan and rasayana Yakrut Pliha due to the Ushna Gun Katu Tikta Ras of most of Bhavna Dravya helps in balancing Pitta, Kapha and Vata Dosha. Rapid and easy uptake of the medicine towards Yakrut and Pliha is possible because of this all the ingredients like Danti, Trivrutta, then which are like Sushma
Hello, doctor.
Surdogami. Haan,
You
yes,
are
sir.
exceeding the time limit, doctor. Can you speed up?
I am just completing. Yes, sir.
Okay.
Removal of excessive pitta dosha leads to amapachan. Then conclusion gives strength. It gives strength to the Raktadhara Kala, increase rasa Raktadhatvagni and improves formation of rasa rakta. Gives strength to the organs Yakrut Pliha due to rasayan karma and gives strength to Sira for improving circulation of rasa rakta dhatu. These are the references and thank you.
Thank you, doctor. Next, I invite Dr. Najma Sultana for the paper presentation.
Hello, sir. Am I
Hello.
audible?
Audible, doctor. Please share the screen, doctor.
Just a minute. So can you please share my PPT, sir?
Okay, doctor. 1 minute, doctor.
Yes, sir.
Doctor, please chat, doctor.
Okay. Good evening, all. Myself, Dr. Najma Sultana, second year PG scholar from JMC Bangalore. My presentation topic is conceptual analysis of role of Chakshusha Dravyas in the Netra Vikaras. Next slide, sir. These are the contents. Introduction, Chakshusha and Rasayana, Chakshusha Dravyas, Chakshusha Dravyas, mode of action of Chakshusha Dravyas, discussion and conclusion. So, eye is one of the important among sensory organs, hence it is rightly said as Sarvendriyanam Nayanam Pradhanam. The major eye diseases that cause blindness are refractive errors, glaucoma, cataract, ARMD. The present era is also witnessing the new disorders like corneal epithelial erosion syndrome, dry eye syndrome, etc. Therefore, regular consumption of Chakshusha Varga Dravyas present or slow down the manifestations of the various ocular diseases. Next slide, sir. Chakshusha. What is Chakshusha? Chakshusha hitam, Chakshusha. That which is good for Chakshu is Chakshusha. As per Bhav Prakasha, yad jara vyadhi vidvamsi vayasaha stambakarakam tatha Chakshusha brahmanam rushyam bheshajam tat rasayanam iti. As per Bhav Prakasha, the drugs that are Chakshusha and Indriya Balaprada can be advocated as rasayana in order to arrest the progression of already existing diseases and also prevent the recurrence of the new disease. Chakshusha Dravyas, as per Rajnigantu, these are Karpara, Raktachandana, Kasturi, Lavanga, and Prapoundarika. According to Vangasena, Trifala, Gruta, Madhu, Yava, Shatavari, and Mudga. According to Yoga Ratnakara, the Chakshusha Dravyas are Gruta, Kshira, Saindava, Madhu, Jivanti, Matsakshi, Punarnava, Masha, Trifala, Lodra, Meghanada, Patola, Godhuma, Mudga, Sita, and Shali. These are the brief information about some of the Chakshusha Dravyas used, like Trifala. It is mentioned as Chakshusha by Chakradatta, Sushruta, and Bhav Prakasha and others. The chemical constituents are gallic acid, vitamin C, ellagic acid, chebulic acid, beta-cetosterol, tannins, flavonoids. The pharmacological action is antioxidant, it's anti-inflammatory, it's anti-diabetic, and immunomodulator. Polyphenols present in Trifala acts as antioxidant. A study showed that Trifala, when administered topically, reduced the inflammation because of the gallic acid in the endotoxin-induced uveitis. Trifala is a drug present in most of the ocular formulations. Daily eye wash with Trifala Kashaya keeps the eye healthy. Rakta Chandana. It has been mentioned as Chakshusha by Chakradatta in Bhav Prakasha. Its constituents are santalin A, tirocarpiol, tirocarpodiolone, lupendiol, homotirocarpine. Its mode of action is it's a hemostatic action. It's indicated in Rakta, Pitta, and Vataja Vyadhis. Administration, it can be applied as a lepa in digital users when the eyes are stressed and in hemorrhagic disorders. It is one of the ingredients of Mahavasakadikwata and Pundarikadi Seka, indicated for Sarvajanetra Rogas. So these are some of the dravyas and its Chakshusha dravyas and its probable mode of action. Triphala, it's an antioxidant and it is used as best Chakshusha in all the Kriya Kalpas. Shigru, it is also an antioxidant and rejuvenates the cells of the lens. It's popularly used in Arka Swarasa for Aschotana. Shatavari, it acts as anti-hemorrhagic analgesic and is used as in Kshirapaka and Kriya Kalpas. Rakta Chandana acts as a hemostatic, used in Lepa and Seka. Bringaraj acts as immunomodulatory and promotes the cell growth, used in Taila Nasya and cataract, Tila Tailadi Nasya and Timira. So these are the Chakshusha dravyas mentioned by the Rasaratna Samuchaya: Swarna, Abraka, Tamra, Vanga, Yashada, Loha, Swarnamakshika, Tutta, Kharbara, Kasisa, Srotanjana, Swarna Gaika, Kapardika, Kati. Swarna acts as stimulates the nerves. Loha helps in the phototransduction and prevents the oxidative stress in the lens. And it is commonly used in the Saptamruta Loha. Gandhaka helps in the synthesis of the glutathione component of choroid, lens, and the teophil. And Yashada plays a vital role in bringing vitamin A from liver to the retina. It is important for vision because high levels of the zinc is found in the macula. These are the Chakshusha dravyas, which are commonly used in the Kriya Kalpas. Dugdha, which helps in visual phototransduction and scotopic vision. It is a base for all the Gruta preparations and in all the Kriya Kalpas. Madhu acts as a potent antioxidant and is a base for all the Anjanas. Saindhava maintains the normal hydration of corneal surface and it is used in Kshira Saindhava Seka, is potent Shulahara in Shushkakshi Paka. Gruta is a potent antioxidant, neurodegeneration, and it's a base for all the Kriya Kalpas. Pipali acts as a vehicle for a drug to reach its target, and it is antibacterial, and it is used in many anjanas to accelerate the action of the drug. So the literary research of dravyas indicated to possess Chakshusha action reveals a total 105 single herbal drugs, 36 single mineral drugs, and 97 Aharya dravyas. So these are the Chakshusha dravyas, which is based on the rasa. Generally, Katu, Lavana, Amla rasa are considered as a Chakshusha, and Madhura, Tikta, Kashaya rasa are considered as Chakshusha. So a Chakshusha dravyas are Patra Shaka can be, which is contrary to the modern claim that which is non-beneficial for the eyes. So that green leafy vegetables are beneficial to the eyes. This may be because majority of the vegetables are having the capacity to cause abhishanda, that is, which causes obstruction to the srotas. Atasi Taila, Kusumba Taila, and Sarshapa Taila is also considered to be non-beneficial. This is a probable mode of action of the Chakshusha dravyas. Immunomodulatory action of the drugs is an effective as well as protective approach in many eye disorders, whether primary or secondary, like retinopathy, uveitis, ARMD. Presence of glutathione and ascorbate does anti-aging action and does the physiological protection against the oxidative damage of the lens and helps to maintain the transparency of the lens. Nutrients like vitamin A, C, vitamin B1, B2, B12, B6, vitamin D, beta carotenoids, cysteine present in the Chakshusha dravyas protect the eyes from free radical damage and prevents diseases like macular degeneration. The content like polyphenols and tannins are responsible for radioprotecting ability in the diseases like pterygium, cataract, cataract conjunctivitis. Presence of zinc helps to store vitamin A in the retina. So these are some of the Drishtikara Ahara. Next slide, sir. So discussion. Acharya Charaka has told Chakshus Tejomayam Tasya Visheshat Shleshmato Bhayan. That is, Chakshu is the chief site for Alochaka Pitta, but special protection is required against the Kapha because Kapha dosha is opposite to the Teja Mahabhuta in reference to their guna. So Chakshusha Dravya should be Kapha Shamaka and Pitta Vardaka. But Pitta is Adana Karaka and it will cause Chakshu Indriya Balahara. So Chakshusha Dravya should be having the property of balancing all the three doshas, especially keeping the Pitta Kapha Samya, that is Kapha Shamaka, but without disturbing the Pitta Samyata. The Ahara Varga, which indicates using Navanita and Gruta, is based on the nutritive aspect present in it, which is beneficial to the eyes and is also said to increase the Majja, which is beneficial to the eyes. Sira and Kandara are the Upadhatu of the Rakta as per Ayurveda. So, to repair these damages, various methodologies like Grutapana, Nasya, Tarpana, and Jana are followed. Kataka, Lodhra, Padmaka, etc. are the drugs used as a cleansing agents of the eyes. Yashti Madhu, Jivaniya Panchamula, Prapoundarika, etc. Dravya reduces the increased pitta and are also considered to be the vision boosters or the promoters. These are the Chakshusha drugs. Pharmacologically further can be categorized as Netra Dahahara, that which reduces the burning sensation, that is Chandana Asava, Triphala, Gugulu, etc. So Netra Rujahara, analgesic action, and it includes like Jatamansi and Ashwagandha. Netra Shotahara, anti-inflammatory action, includes Dashamula, Triphala, Punarnama, etc. Netra Drudikarana, that which maintains the power of vision, is Saptamruta Loha and Nimba. Netra Kanduhara, which is anti-allergic action, are Khadira and Manjishta. Vranaropana, wound healing effect, is Imba, Karanja, Ishtimadu, Haridra, and Daru Haridra. So conclusion, the various Chakshusha Dravyas mentioned in our classics are rich sources of macro and micronutrients like sorbitol, glucose, fructose, glycogen, mucoprotein, calcium, zinc, glutathione, vitamin A, vitamin E, C, K, vitamin B1, B2, B6, B12, and vitamin D helps in maintaining the normal function, structural integrity of the eye. Practicing or intake of Chakshusha Rasayana helps to prevent the eye disorders, which can be prophylactic in many highly prevalent lifestyle disorders in turn, which causes pathological changes in the eye. Thank you.
Thank you, Doctor. Next, I invite Dr. N.C. Bharati for the paper presentation.
Hello, am I audible?
Audible, Doctor. Please share the screen, Doctor.
Just a second. I think I've WhatsApped you my presentation. Can you please share that?
Okay, Doctor, 1 minute. Doctor, can you send me a PPT in my WhatsApp?
I did that.
Didn't get, Doctor.
Like that 3009 number, right?
Doctor, I will message you.
Yeah.
I will call you next, Doctor.
Oh my God. Okay, fine.
Next, I invite Dr. Akash Parashar for the paper presentation. Dr. Akash, are you there? Hello, Dr. Akash, are you there? Next, I invite Dr. Vaishnavi for the paper presentation. Dr. Vaishnavi Shankar Gore, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Just a minute, sir.
Okay, Doctor. Your screen is visible, Doctor.
Is it visible, sir?
Yes, Doctor. Visible. Please start, Doctor.
Good evening. Myself, Vaishnavi Shankar Gore from Government Ayurvedic College, Nagpur. So my topic is importance of Hetu in diagnostic methodology. Introduction. Ayurveda is oldest and traditional system of medicine. It is a science of life. All principles mentioned in Hetu are based on three sutra, that is Hetu, Linga, and Asha. For examination of disease, Ayurveda has explained 5 tools called as Nidan Panchak. They are Nidan, Purva, Roop, Ukshay, and Samprag, which are helpful for proper understanding of and manifestation of disease. Nidan helps to know etiology, symptoms, and pathogenesis of disease, and also gives a complete knowledge about the disease. For proper diagnosis of disease, Hetu is one of the most important points. The best treatment for all the disease in Nidan Parivarjan means to avoid all the positive factors. Aim and objective: to study the concept of Hetu, to study the importance of Hetu in diagnosis of disease. Material and method. Material Ayurvedic classes such as Charak Sahita, Ashtang, Hruday, Madanidan, etc. Methodology. Collection of data of Hetu and importance of Hetu in diagnostic methodology from all Ayurvedic literature. Review of literature. Vyadhi Utpatti Hetu Nidana. Hetu means the causative factor of any disease. It is the first factor which is responsible for the progression of disease. Synonyms of Hetu. Iha Khalu Hetu Nimitta Aitam Karta Karanam Pratyayah Samuthanam Nidanam iti Arthantaram. Nimitta Aitan Karta Karan Hetu आणि Samuthan. Word Hetu is used with two meanings. Vyadhi Utpatti Jnapti means diagnosis of disease. Hetu means the etiological factor of disease. Acharya Gangadhar has called Hetu as a beach, which is of two types. That is Upayogi Hetu, responsible for the maintenance of health. Second is Utpadak Hetu, means the etiological factor of disease. Types of Hetu. There are different types of Hetu described in Ayurvedic classes. 4 types of Hetu. Sanikrushta. Sanikrushta means the nearest cause of disease. Example, aggravation of doshas as per day and night. Viprakrushta. Viprakrushta means the remote cause of disease. Example, Sanchit cough in Hemant Ritu produces Kapha Vyadhi in Vasant Ritu. Vyabhichari means weakest cause of disease. Fourth type is Pradhani. Strongest cause of disease which produce disease instantly. Example, Vishada. 3 types of Hetu. Asatnendriyartha Sayog. Improper use of sense organ means ayog, atiyog and mithya yoga panchanendriya. Second, prajnakara means doing all ashubh karma due to vibram of the dhruti and smriti. Third, parinam. Parinam is also called as kal. Atiyog, ayog and mithya yoga of kal is called as parinam. 3 types of Hetu. Dosh Hetu, Vyadhi Hetu and Ubhay Hetu. Dosh Hetu means sanchay, prakop and shaman of dosha in respective Hetu. Vyadhi Hetu, responsible for direct manifestation of Vyadhi. That is, example, Mruddakshan in Mruddakshan Janya Pandu. Ubhay Hetu, responsible for aggravation of dosha and simultaneously manifest the Vyadhi. 3 types of Hetu, Kshay, Sthan and Vruddhi. Kshay means the decrease of dosha due to causative factor. It can be qualitative, quantitative or functional. Sthan means the dosha samya or normal or balanced state of dosha. Vruddhi means the increase of dosha due to causative factors. 2 types of Hetu. Utpadak Hetu, which favors the aggravation of dosha. Example, Madhur is responsible for cough sanchay in Hemant Ritu. Vyanjak Hetu. Hetu which stimulates the manifestation of disease. Example, sunlight in Vasant Ritu is responsible for the prakop of sanchit cough in Hemant Ritu, causing cough vika. 2 types of Hetu. Bhaya Hetu. Example, ahit ahar vihar according to Ritu. Abhyantar Hetu, sharirik dosh, dhatu and mud. 2 type of Hetu. Anubandhya, Anubandha. Anubandha means Hetu having Swatantra Vyaktalinga. Anubandha means not having Swatantra Vyaktalinga. 1 type of Hetu, Ashayapkarsha Hetu. Swasthangat dosha moves to other place due to impact of Vata and produce neuroses. Diagnostic plot. Vyadhi parikshayam च संदेहे जाते यस्य व्याधेः हेतु सेवा दृश्यते स परिकल्प्यते एवं आदि हेतूनां व्याधि परीक्षणं. Charak Nidan 1/7 Chakrapani. In modern era, due to change in lifestyle, there is need to understand importance of Hetu as mentioned in Sarak Samhita. Sarvam anya parityajya shariram anupalyat means one must left all work in order to maintain health. For accurate diagnosis of disease, complete knowledge about Hetu is necessary. Example, excessive sleeping, excessive use of curd, milk and no annapan etc. are the Hetu of Prameha. Proper history will help to diagnose disease as early as possible. Understanding of Hetu also helps to understand the samprapti of disease. As it is mentioned in Charak Samhita, it is not possible to name every disease, so we have to diagnose it and treat on the basis of dosh prakop. Also help in differential diagnosis of this. Example, in Udar Vyadhi, if there is a history of alcohol consumption, then we can diagnose it as the Yakruta. Knowledge of Hetu 7 helps to understand the chronicity of disease. To know the Nidan or causative factor will help to clarify the state of disease. It will help the patient to keep away from causative factor and help to plan the treatment protocol. Knowledge of Nidan helps in prognosis of disease. If the causative factor is less efficient, then the disease is sadhya. If the causative factor is moderately effective, then the disease is klicha sadhya. If causative factor is more effective, then the disease is asadhya. By gaining the knowledge of Hetus, physician can get the proper way of treatment of the disease. Hence, by avoiding the all causative factor which responsible for manifestation of disease, can treat the disease in its own way. Therefore, Hetu is considered as one of the diagnostic tools which is helpful for the treatment of disease. References. Thank you.
Thank you, Doctor. Next, I invite Dr. Bharati for the paper presentation.
Hello, am I audible?
Audible, doctor.
Yes. Good evening, myself Dr. Bharti, final PG scholar from Department of Prasuti and Yoga from Government College, Vijayawada. So today this yoni picture is one of the widely used treatment aspect. So I'm going to talk about that. In coming to introduction, Pichu Karpasathulam, Pichu Visheshanat Nithar. Pichu is one among the Sthanika Chikitsa, where the sterile cotton swab, that is, which is made into ball, is kept inside the vagina for a specific period of time. Ayurveda explains two types of chikitsas. One is Abhyantara, other one is Sthanika. Coming to Abhyantara Chikitsa, it breaks the dosha, sammochana and cures the disease, while Sthanika Chikitsa corrects the Sthanika dosha dushti. These Sthanika Chikitsas like Yoni Dhamana, Yoni Pichu, Yoni Dhrupana, Yoni Lepana, Yoni Varti, and Utravasi, they are proven to be greatly beneficial as treatment on Shamana or Shodhana Chikitsa. Specifically in Stri Roga, it plays an important role as it directly acts on the affected area and can rectify the pathology. Coming to the definition, Pichu Thailam Pichuna, Tulakena Thailam, Bathagna Dravyam, Khwata Siddham, Yonudushina Dhare. Pichu is application of sterile cotton soaked in Vatagna Dravyas, medicated oil or ghee in the vagina, that is particularly mentioned like Pratamavata. Preparation of the Pichu. Cotton ball is covered with a sterile gauze piece and the tail, like the end part, is made using the gauze so that it can be removed easily by the patient herself. It can be done by the physician or we can advise to the patient also. It has to be done under antiseptic precautions. The yoni pichu is soaked in the desired medicine and inserted into the vagina with the index finger in such a way that the thread, that is the tail part of the pichu, comes out of the introitus, which helps for the easy removal. It should be kept deep inside the vagina so that it remains intact with the cervical portion. Few precautions are to be taken, like the pichu and the desired medication should be sterilized and the medication should not be neither too hot or not too cold, and the pichu should be made according to the vaginal size. Bigger pichu is needed for the uterovaginal prolapse as there is increased genital hiatus. The indications of yoni pichu in Prasuti and Stri Roga are like this, and in all kind of yoni rogas, Mushika Tala pichu is the best thing and undoubtedly clears all the yoni rogas. And here we can't discuss about all the yoni rogas. It can be classified into Vataja, Pittaja and Kaphaja. In case of Vataja yoni rogas, Tilatala pichu is used widely because it has the drugs like Vatashamaka, which have anti-inflammatory and nerve toning. This Tilatala will penetrate into the tissues and also helps in the absorption. And due to the Sukshma Vyavayi Guna and lipophilic property, it nourishes the pelvic tissues. Pichu retains the medicine in the vagina for a longer period for better action and also normalizes the function of Apanavata and maintains a healthy environment. And Pittaja Yoni Yoga, this pichu, this tampon prepared with the drugs having Shita Vidhya, Pittahara properties are to be used. Like Chandan and Ushira, which have Lagu Ruksha Guna, it absorbs the excessive moisture, soothes the burning sensation, and having Tikta Madhura Rasa, Katu Vipaka and Shita Vidhya, it promotes new tissue growth. And the next one is Kafaja Yoni Rogas, the pichu prepared by the drugs having Kashaya Rasa, Ruksha Guna Shita Vidya, Kafashamaka and Sameeksha, which cures the infection by scraping out the discharges and will heal the wound. And coming to indications of pichu and Prasuti Tantra, as you all know that Charaka and Vagbata both have advised the use of Anuvasanavasti with oil prepared with the drugs of Madhuravyas. In the same way, the pichu should be prepared, which gives a lubrication to Garbhasthana and Garbhavanta. And here the action is pichu made of oil, made like particularly Balataila and Tilatala pichus, may destroy the pathogenic bacteria of the vagina and can prevent the puerperal sepsis and softens the vaginal passage. This helps in normal labor. A regular use of tampon might influence autonomic fibers while governing the myometrium and helps in regulating the contraction. That is, the main function is contractions. And softens the perineum and helps in relaxation during labor. And during labor, like after labor, that is in the third stage of labor, pichu is capable of making the uterine contractions well. So particularly pichu made up of Shatapushpa, Kushta, Madanaphala, Hingu Siddha Taila pichu can be used, which helps in vigorous contraction and to take off the retained placenta. In the puerperal period, yoni pichu made of Balataila, that is to correct the damaged tissue. In the last one, that is Mudagarbha for post-operative, particularly in Mudagarbha, post-operative management, that is for the after the extraction of Mudagarbha. The use of tampon soaked in decoction of Shishiran, Hebuka and Balataila pichu for the suppression of vayu. And coming to the mode of action. Pichu helps in Pichu helps the medicine to remain intact for the site for a longer period of time for better action. It has different action depending upon the drug we take, and it also alters the pH of the vagina. As vaginal wall is highly vascular and having lipophilic property, it facilitates the proper absorption of the drug. And it prevents the fungal and yeast infections and strengthens the vaginal muscles. It causes snehana, vishana, mardava, kleda as per the definition of snehana, and also it has the properties like Sravanasha, Paichilatanasha, Kanduhara, Karkashata, and Stabdanashaka, Raktasravanashaka after Shalyakriyas. The Tila Taila oil is the most commonly used and is highly antiseptic and antibacterial and Sukshma Yoga property. The oil helps to nourish and strengthen the uterine muscles. Pichu helps to hold the uterus or the walls of the vagina upward and remains the vagina for the longer duration for better action. There are a few contraindications and also complications while using the Pichu. The contraindications are PIDs, that is pelvic inflammatory disease, and UTIs, because there will be more chance of ascending infections while using the Pichu. And the complications include if large and thicker size of yoni Pichu is used, and if the time of retention is more, then it might cause Mutrakritra, Yoni Shoda, Yoni Shula, and it develops as a complication. Thank you.
Thank you, Dr. Rathod, for the paper presentation. Dr. Shraddha Rathod, are you there? Dr. Shraddha, are you there? Okay.
Yes, sir. Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Yes, sir. Yes.
The screen is visible, Doctor. Please chat.
Yes, sir. Hello, my name is Dr. Shraddha Rathod, final year Shalakya Tantra PG scholar from hello. From PMT Ayurveda College, Shevgaon, Ahmednagar. My topic is Ayurvedic management of blepharitis with Haridra Kwat Ashotan. Background nowadays, due to industrialization, huge amount of air pollution take place, like a chemical smoke, dust particle, etc. Overuse of cosmetic, unhygienic condition, long-standing dandruff, etc. leads to various type of eye disorders. Blepharitis is a commonest disease of a lead margin in day-to-day life. It is compared to Klina Vartma by Ayurvedic view. Ashotan with the Haridra is useful in this condition. Method. A 32-year female patient come with complaints of itching, redness, swollen eyelids, eyelid margin. She was successfully treated with the Haridra Kwat Ashotan. Discussion: a drug Haridra Kwat was used in patient of blepharitis in a form of Ashotan. Conclusion: Haridra is a Kandugna, Shotahar, and Chakshusha in properties, and Haridra acts as antiseptics. Keywords: blepharitis, Klina Vartma, Ashotan, Haridra Kwat. Introduction. Blepharitis is an ophthalmic condition characterized by the inflammation of eyelid margin. It can be acute or chronic. Further be defined by location of the problem, anterior and posterior. They usually present with a recurrent symptom that may vary over time and involve both eyes. Blepharitis is a clinical diagnosis based on irritation of eyelid margins with the crusting of eyelashes. The main treatment for blepharitis is good eyelid hygiene and topical antibiotics. Etiology: age, all age group, poor eyelid hygiene, exposure to smoke and dust, refractive errors, secondary to sty, overuse of cosmetic. Symptoms: itching, redness, swollen eyelids, eyelid margins, watering, photophobia. Aim to study the role of Haridra Kwat Ashotan in blepharitis management. Material and methods. The drug Haridra Kwat was used in patient of blepharitis in form of ashwatan. Drug Haridra, Latin name Curcuma longa, local name Haldi, family Zingiberaceae, Rasa Tikta Madhur, Virya Ushna, Vipak Katu, Karma Kandugna, Shotahar, Chakshusha, Tridosha, Kafagna, Prayoganga Kand. Conclusion, blepharitis is a common lid margin disorder caused by the overuse of a cosmetic, unhygienic condition, etc., and secondary staphylococcal and parasitic agent. This study aimed to reduce the signs and symptoms recurrence of blepharitis by ashwatan of Haridra. I have taken references from A.K. Khurana, Kansky, and Ayurvedic references from Bhav Prakash Nigandu. Thank you.
Thank you, Doctor. Next, I invite Dr. Komal Bele for the paper presentation. Hello, Dr. Komal Bele, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Okay.
Thank you, Doctor.
Your screen is visible, Doctor. Please start.
Can you see, ma'am?
It's breaking, Doctor.
Good evening to all of you. My name is Vedha Komal Pele, PG Scholar, Dravya, third year. SSM Ayurveda Mahavidyalaya, Hardas, Pune. My topic is review on Shundi as an Ekal Dravya Chikitsa with respect to Brutri. Introduction. As the are mentioned in Chatushpada, the Dravya plays important role in treatment. In Chatushpada, there are the qualities are mentioned as Dravya should be qualities as Bahupiti, Anikrita can be used in different forms. We can interpret the Ekal Dravya Chikitsa as the single ingredient or the single formulation with multiple ingredients, or the single ingredient or substance with Anupan, a single ingredient substance formulation with process with some other substances. The meaning of Ekal is alone, single and solitary soul.
Hello, Dr. Komal, are you there? Hello, Dr. Komal Bele, are you there? Hello, Dr. Komal Bele, are you there? Finally, I invite non-presented participants. Jakshani Shanawat, Dr. Suresh Babasaheb Munde, and Dr. Akash Parasha. Dr. Komal Bele, Hello, Dr. Komlapelle. Are you there? Hello, Dr. Komlapelle. Please unmute, doctor. Hello, Dr. Komlapelle. Are you there? I think it was some network problem. Okay, I would like to invite Dr. Aishwarya RS for the conclusion. Before conclusion, once again, I invite the non-participants name. I told the non-participants name. Dr. Drakshani Shanawat, Dr. Suresh Babasahib Munde, Dr. Agash Parashar. I would like to invite Dr. Aishwarya for the conclusion. Dr. Aishwarya.
Thank you, Dr. Sabin. So, thus we officially comes to an end of this presentation series. Soon we meet again with the seminar session, and I invite all participants to participate in the seminar with the same enthusiasm